General concepts. 1. Apply gloves. 2. Dentures are fragile. Be sure to set a towel or something soft over the work area. 3. If the client is able, let him or her remove his or her own dentures. 4. If assistance from the nurse is required, grasp the upper plate at the front teeth and move the dentures up and down to release the suction. 5. Lift the lower plate up on one side at a time. 6. Use warm water to clean dentures. 7. Do not soak dentures for an extended time period. 8. The dentures may have sharp edges. Handle carefully. 9. Check the oral cavity. Report any abnormalities. 10. Replace the dentures in the client's mouth. 11. If the dentures are to be stored, assure that they are properly labeled with the client's name. Broccoli, carrots, cheese, collard greens, green beans, milk, rhubarb, spinach, tofu, yogurt, dark green leafy vegetables, egg yolk, fortified breads and cereals, liver meats. General concepts. Part Y. Food sources. Magnesium. 5. NCLEX RN Flash Review. General concepts. Avocado, cauliflower, green leafy vegetables, legumes, beans and peas, milk, peanut butter, pork, beef, chicken, potatoes, raisins, rolled, cooked oats, white tuna, canned yogurt, fish, nuts, organ meats, pork, beef, chicken, whole grain breads and cereals, avocado, bananas, cantaloupe, carrots, fish, mushrooms, pork, beef, chicken, potatoes, raisins, spinach, strawberries, tomatoes. 6. General concepts. Part Y. Food sources. Sodium. Laboratory values. Normal hematology. 7. NCLEX RN Flash Review. General concepts. American cheese, bacon, butter, canned food, cottage cheese, cured pork, hot dogs, ketchup, lunch meat, milk, mustard, processed food, snack food, soy sauce, table salt, white, and whole wheat bread. Red blood cell RBC, count 4.7 to 6.1 millions, or 4.2 to 5.4 millions MM3 hemoglobin, HGB hematocrit, HCT, mean corpuscular hemoglobin, MCG, mean corpuscular hemoglobin concentration, MCHC, mean corpuscular volume, MCV, white blood cell, WBC, count neutrophils, monocytes, lymphocytes, eosinophils, basophils, bands, platelets, 14 to 18 G, DL, 12 to 16 G, DL, 42%, 52%, 37%, 47%, 27-31. Petagrams, cell 32 to 36 G, DL of cells, 80 to 90 FL, 5,000 to 10,000 MM3, 54%, 75%, 2%, 8%, 25%, 40%, 1%, 5%, 0%, 1%, 0%, 5%, 150,000 to 400,000 MM3. 8. General concepts. Part 1. Laboratory values. Normal metabolic. Laboratory values. Normal renal. 9. NCLEX RN Flash Review. General concepts. Albumin, alkaline phosphate, aspartate aminotransferase, AST Scott, alanine aminotransferase, alt SGPT, bilirubin. Total calcium, carbon dioxide, chloride, glucose, potassium, protein, total sodium 3.5 to 5, GDL 30 to 120, 0 to 35 IU, 0.3 to 1 mg, DL to 1 mg. Albanian Lex EQ, EQ and E 100 milligrams DQ, Albanian Lex to 100 milligram 36 to 145 MEQ. Uric acid level, creatinine 8 to 25 mg, mg-DL 2.5 to 8. mg-DL male 97 to 137 milliliters min, female 88 to 128 milliliters min. General concepts. Part Y. Mathematical FORMU loss, common intravenous therapies. Mathematical FORMU loss, common medication dosage. 11. General concepts. NCLEX RN Flash Review. Intravenous therapies, calculating milliliters per hour. Total volume to infuse ml equal to ml/HR. Total time hours. Intravenous therapies, calculating milliliters per hour when time is less than 1 hour. Total volume equal to XML min. X 60 minutes, HR equal to XML/HR. Total time min. Intravenous therapies, calculating drops per minute. Total volume X drop factor equal to drops per minute GTT min. Total time min. Check tubing package drop factor may be 10, 15, 20 macro drip, or 60 microdrip GTT/ml. Formula for calculating a medication dosage: D desired amount and XQ quantity equal to X amount to give, H have available. D desired amount is the dosage that the physician has ordered. H have available is the dosage strength as stated on the label of medication. Q quantity is the volume or form in which the dosage strength is available: tablets, capsules, or milliliters. 12. Part Y. General Concepts Medication Administration, 6 Rights of Medication Levels, Toxic, nclex RN Flash Review. General Concepts: 1. Right medication. 2. Right route. 3. Right time. 4. Right client. 5. Right dosage. 6. Right documentation. Signs and symptoms of medication normal value. Toxic level. Toxicity greater than or equal to 2.4 nanograms ml digoxin, 0.8 to 2. Ng ml, slow or irregular pulse. Lanoxin, rapid weight gain. Loss of appetite, nausea, vomiting, blurred or yellow vision. Unusual tiredness and weakness. Swelling of the ankles, legs, or fingers. Difficulty breathing greater than or equal to 5 mcg ml lidocaine 1 to 5. mcg ml drowsiness, dizziness, antiarrhythmic numbness, double vision, use nausea. Vomiting greater than or equal to 1.2 meters EQ, lithium 0.8 to 1.5. MEQ, mild fine hand tremors, polyuria, thirst, nausea moderate, headache, confusion, weakness, fatigue severe, dysrhythmias, bradycardia, irregular pulse greater than or equal to 30 mcg ml phenytoin 10 to 20 mcg ml rash, severe nausea or dilantin vomiting, drowsiness, slurred speech, impaired coordination, ataxia, swollen glands, yellowish discoloration of skin or eyes, joint pain, fever, unusual bleeding, persistent headache greater than or equal to 20 mcg ml theophylline, 10 to 20 mcg ml mild moderate, due to rapid infusion, hypotension, hyperventilation, tachycardia severe, seizures, severe dysrhythmias, cardiovascular collapse, unang equal to nanograms. 14. General Concepts, Part, Medication Suffixes, Medications and Antidotes Common. 15. nclex RN Flash Review, General Concepts, Suffix, cane, psilin, dine, dunide, lamicin, mycinamide, neem, olaloxacin, pampril, S1 statin, verazide medication class, local anesthetics, penicillins, H2 blockers, anti-ulcer opiate analgesics, oral hypoglycemics, anti-anxiety agents, antibiotics, diuretics, neuromuscular agents, beta blockers, antibiotics, anti-anxiety agents, ACE inhibitors, steroids, antihyperlipidemics, antivirals, diuretics. Medication: acetaminophen, anticholinergics, anticoagulants, benzodiazepines, calcium channel blockers, digoxin, heparin, insulin-induced hypoglycemia, iron lead, opiates, antidote, mucomist, N-acetylcysteine, physostigmine, antilirium, protamine, vitamin K, flumazenil, romazicon, calcium chloride, digoxin, immune, fab, digibind, protamine sulfate, glucagon, deferoxamine, desferol, acetate, calcium disodium, EDTA, naloxone, Narcan. 16. General Concepts, Part 1, Metric Conversions, Metric AB abbreviations, new Arsing process steps. 17. nclex RN Flash Review, General Concepts, Volume 1, TSP equal to 5 ml 1 TBSP equal to 15 ml 1 ounce equal to 30 ml 1 cup 8 ounces equal to 240 ml 1 soda can 12 ounces equal to 360 ml 1 pint equal to 480 ml 1 quart equal to 960 ml weight 1 milligram equal to 1000 UG or 0.001 grams. 1 gram equal to 1000 milligram. 1 gr equal to 60 milligrams. 1 kilogram equal to 2.2 lb or 1 kilogram equal to 1000 gram. 1 Albanian lek of water equal to 1 kilogram. 1 mcg equal to 0.000001 grams. 1 ml equal to 0.001 Albanian lek. Abbreviations: meter, equal to m liter equal to L milliliter equal to ml kilogram equal to kg gram equal to g milligram equal to mg microgram equal to mcg or ug. Assessment: assess for symptoms of the disease, subjective data, and signs of the disease, objective data. Analysis: interpret signs and symptoms. Identify the client's needs and formulate an appropriate nursing diagnosis. Planning: prioritize the nursing diagnosis. Develop a nursing plan of care with clear goals. Implementation: provide appropriate nursing care and implement nursing procedures as directed. Educate the client in relation to his or her specific healthcare needs. Evaluation: evaluate client outcomes compared with those expected. Modify plan of care if necessary. Evaluate client's understanding and ability to complete self-care. 18. General concepts. Part: vital signs normal. 19. NCLEX RN flash review. General concepts: pulse rate, respiratory, blood temperature, beats, rate, pressure, age, deg, minute, beats, minute, Hg, neonate 98.6 degree, 99.8 degree, 110 to 160, 30 to 50, 70 to 72, 45, 48, 1 month, 98.5 degree, 99.5 degree, 80 to 130, 20 to 30, 90 to 100, 55, 63, 3 years, 6 to 10 years, 97.5 degree, 98.6 degree, 75 to 100, and 15, 17 to 25, 96 to 110, 57 to 72, 16 years, 97.6 degree, 98.6 degree, 55 to 115 to 20, 100, and 20 to 123, 76, 80, 60, to 100 adult, 96.8 degree, 98.6 degree, 15 to 20, 100, and 20 80ths, 60 to 100 elderly, 96.5 degree, 97.5 degree, 15 to 20, 100, and 20 80ths, 70 plus years. AD base imbalanc S signs and D symptoms of NCLEX RN flash review. Adult: acid-base imbalance, respiratory acidosis, metabolic acidosis, respiratory alkalosis, metabolic alkalosis signs and symptoms. Dyspnea, hypoventilation breathing pattern, respiratory distress, headache, restlessness, altered mental state, seizures, drowsiness, lethargy, coma, papilledema, hypotension, tachycardia, dysrhythmia, warm and flushed skin, diaphoretic restlessness, drowsiness, headache, confusion, stupor, coma, hypotension, dysrhythmia, cold and clammy skin, shock, nausea, vomiting, small respirations, hyperventilation breathing pattern, inability to concentrate, loss of consciousness, paresthesia, tinnitus, palpitations, tachycardia, dysrhythmia, syncope, dizziness, weakness, lethargy, coma, seizures, muscle twitching, muscle cramps, paresthesia, dysrhythmia, decreased gastric motility, paralytic ileus, acid-base imbalance, respiratory acidosis, metabolic acidosis, respiratory alkalosis, metabolic alkalosis treatment. Administer bronchodilators, detergents, antibiotics, sodium bicarbonate, sodium lactate intravenously IV, Ringer's lactate 4, and potassium as ordered. Suction as indicated. Turn and reposition every 2 hours. Implement pulmonary toileting measures. Hydrate client. Monitor vital signs and assess arterial blood gases. Administer sodium bicarbonate, sodium lactate, and lactated Ringer's IV. If ketoacidosis is present, administer insulin. Monitor laboratory values. Observe for signs of hyperkalemia and record intake and output. Eliminate causes of hyperventilation, use rebreathing bag, and provide sedation as ordered. Monitor lab values, especially potassium and HCO3. Minister acetazolamide diamox, IV solution of added electrolytes, and potassium chloride to clients on long-term diuretic therapy. Maintain a diet high in potassium. Observe for signs of hypokalemia and record intake and output. 24. Acid-base, fluid, and electrolyte imbalances. Part E. Arterial blood GSS ABG, TRMS and D values. arterial blood GSS ABG, fully compensated ABG interpreted ions, arterial blood GSS ABG, partially compensated ABG interpreted ions, nclex RN flash review, adult, CO2 carbon dioxide H plus HCO hydrogen ion bicarbonate HTO, carbonic acid 02 oxygen, PCO2 partial pressure of carbon dioxide pos pH, partial pressure of oxygen, arterial oxygen, saturation 7.35 to 7.45, 35 to 45 mmHg, PCO2 HTO 22 to 26, MEQ, LROS 80 to 100 mmHg, imbalance pH PaCO2 HTO respiratory acidosis normal 17.40, respiratory alkalosis normal 17.40, metabolic acidosis normal 17.40, and metabolic alkalosis normal 17.40, imbalance respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis, pH PaCO2 HCO, calcium, party, calcium Cia imbalanci hypercalcemia. 27. nclex RN flash review, adult, normal serum value general information 4.3 to 5.3. MEQL plays a major role in blood coagulation, cardiac muscle func 911 mg DLC on, and muscle and nerve function. Definition: excessive calcium in the extracellular fluid serum level greater than 5.3 meters EQL. Causes: immobilization, thyrotoxicosis, Paget's disease, excessive intake of vitamin D or calcium supplements, hyperparathyroidism, neoplasm of the thyroid. Assessment findings: nausea, vomiting, anorexia, flank pain, bone pain, decreased muscle tone, pathological fractures, lethargy, weight loss, polydipsia, polyuria, dehydration, stupor, coma. ECG changes, shortened QT segments, ventricular dysrhythmias. Treatment, nursing interventions, treat the underlying cause. Immediate reversal can be obtained through the administration of sodium salts 4 and diuretics as prescribed. Definition: excess concentration of potassium ions in extracellular fluid, serum level greater than 5.5 meters EQ. Causes: renal disease, inability to excrete potassium, burns, crush injuries, adrenal insufficiency, respiratory or metabolic acidosis, excess potassium administration. Assessment findings: weakness, muscle cramps, flaccid paralysis, irritability, hyperreflexia proceeding to paralysis, bradycardia, dysrhythmia, ventricular fibrillation. ECG changes, elevated or tented T waves, widened QRS complexes, prolonged PR interval, flattened P waves with depressed ST segments, sine wave pattern. Treatment, nursing interventions, administer diuretics, hypertonic I4 glucose, dextrose 50% in water D50 with insulin, Kayexalate, IV calcium is prescribed. If acidosis is present, treat with sodium bicarbonate and withhold foods and medications containing potassium. Part: acid-base, fluid, and electrolyte imbalances, hypermagnesemia, nclex RN flash review, adult. Definition: excessive magnesium as a result of renal insufficiency or inability to excrete magnesium absorbed from the diet. Serum level greater than 2.1 meters EQ. Causes: renal insufficiency, overdose of magnesium, severe dehydration, oliguria, excessive usage overdose of antacids containing magnesium. Assessment findings: hypotension, decreased respirations, sedation, warm sensation in body, bradycardia, cardiac dysrhythmia. Hypoactive deep tendon reflexes. Treatment, nursing interventions, administer calcium gluconate IV slowly via a peripheral vein, monitor vital signs and neurological status. Definition: high concentration of sodium in extracellular fluid, serum level higher than 145 meters EQL. Causes: severe diarrhea, decreased water intake, febrile states, ingestion of sodium chloride, excessive loss of water through rapid and deep respiration, renal failure, diabetes insipidus. Assessment findings: weakness, restlessness, delirium, irritability, confusion, hyperpnea, oliguria, increased temperature and pulse, flushed skin, dry mucous membranes, abdominal cramps, convulsions, nausea, anorexia. Treatment, nursing interventions, record intake and output, restrict sodium in diet, weigh daily, observe vital signs, administer fluids via IV and/or orally, as prescribed. Special considerations: if hypernatremia is caused by dehydration, in which fluid is lost and the concentration of ions increases, signs and symptoms will include concentrated urine, oliguria, dry mucous membranes, dry swollen tongue, seizures, coma, flushed skin, increased temperature, tachycardia, and hypertension. Definition: deficit of calcium in extracellular fluid, serum level lower than 8.5 milligrams DL. Causes: acute pancreatitis, vitamin D deficiency, chronic renal insufficiency, burns, malabsorption syndrome, massive blood transfusions. Assessment findings: tetany, convulsions, abdominal and muscle cramps, spasms of larynx and bronchus, circumoral tingling, especially in fingers, confusion, anxiety, moodiness. ECG changes, QT interval prolonged, ventricular tachycardia. Treatment, nursing interventions, calcium gluconate 4, followed by oral calcium supplements as prescribed. Serum albumin if condition is due to low serum albumin concentration. Monitor for a positive Trousseau's and Fostex test. Monitor for signs of hypercalcemia and dysrhythmia. 30. Part 2 hypokalemia. Adult, nclex RN flash review. Definition: low concentration of potassium ions in extracellular fluid, serum level lower than 3.5 meters EQL. Causes: renal loss. Most common: diuretic use, insufficient potassium intake, loss from gastrointestinal tract via nasogastric NG tube placement without replacement electrolyte solution, vomiting, diarrhea. Assessment findings: muscle weakness, muscle pain, leg cramps, hyporeflexia, fatigue, hypotension, shallow respirations, dysrhythmias particularly PVCs, nausea, vomiting, diarrhea, apathy, drowsiness leading to coma, paralytic ileus. ECG changes, peaked P waves, flat T wave, depressed ST segment, elevated U waves. Treatment, nursing interventions, maintain IVs with potassium chloride KCl, added as prescribed. Replace K+ when excess loss occurs. NG tubes, diarrhea, etc. Observe for adequate urine output. Special considerations: replace no more than 20 meters EQ of potassium chloride in 1 hour. Observe ECG monitor during infusion. Dilute potassium chloride in 30 to 50 ml of IV fluid and administer on an infusion pump. Definition: deficiency of magnesium due to chronic alcoholism, starvation, malabsorption, or vigorous diuresis, serum level less than 1.3 milligrams DL. Causes: diet low in magnesium, chronic diarrhea, chemotherapy, pancreatitis, chronic nephritis, diuretic phase of renal failure, toxemia. Assessment findings: jerks, twitches, hyperactive reflexes, tetany, convulsions, coma, tachycardia, ventricular dysrhythmia, hypotension. ECG changes, prolonged PR and QT segments. Treatment, nursing interventions, administrate magnesium sulfate as prescribed. Observe for adequate urine output. Monitor cardiac rhythm. Institute seizure precautions. Special considerations: when administering magnesium sulfate, administer intravenously IV or intramuscularly IM slowly. Antidote is calcium gluconate. Part E, hyponatremia. 33. Adult, nclex RN flash review. Definition: low concentration of sodium in extracellular fluid, serum level lower than 135 meters EQ. Causes: excessive perspiration, use of diuretics, gastrointestinal losses, severe diarrhea, vomiting, pancreatic and biliary fistula, decreased sodium in diet, burns, excessive IV administration without NaCl, diabetic acidosis, adrenal insufficiency. Assessment findings: weakness, restlessness, delirium, irritability, confusion, hyperpnea, oliguria, increased temperature and pulse, flushed skin, dry mucous membranes, abdominal cramps, convulsions, nausea, anorexia. Treatment, nursing interventions, administer IV fluids with sodium, maintain accurate intake and output. Special considerations: if sodium is lost but fluid is not, The following signs and symptoms will be noted similar to those of water excess: mental confusion, restlessness, headache, muscle twitching and weakness, oliguria, coma, and convulsions. Normal serum value general information 1.3 to 2.1. MEQ 50 Albanian lex percent of magnesium is contained in the bones, and the remaining 50% is found in the intracellular compartment. Normal serum value general information 3.5 to 5.5. MEQ L potassium deficiency in excess are common problems in fluid and electrolyte imbalances. Manager cell cation. General nursing management observe ECG tracings for changes in T-wave, ST segment, or QRS complex, and measure intake and output accurately. Draw frequent blood specimens to gauge level. Observe for signs of metabolic acidosis and alkalosis, Part acid-base, fluid, and electrolyte imbalances. Sodium na imbalanke tonic of IV fluids. 35. nclex RN flash review. Adult. Normal serum value 135 to 145 MEQ. L general information and deficiency and excess are common problems in fluid and electrolyte imbalances. General nursing management. Observe skin condition. And measure intake and output. Auscultate lung sounds. Observe specific gravity and color of urine. Isotonic hypertonic solution 0.9%. Saline D5WLRNS, DSLRNS, D5NS, D5NS qualities in isotonic solutions go where you put them and stay there. They expand the intravascular space. Hypotonic solutions pull water from the intravascular space into the cell. When in less salt and more water and water, and monitor for fluid cell will swell. Overload. And monitor for cardiovascular collapse. D10WN hypertonic solutions greatly expand the intravascular space and draw fluid from intravascular areas. N cells will shrink. 36. Part 11. Afterload aneurysm angina, cardiovascular disorders. 37. nclex RN flash review. Adult. Definition: resistance to ejection of blood from the ventricle, and the second determinant of stroke volume. The resistance of systemic blood pressure to the left ventricle ejection is called systemic vascular resistance. The resistance of pulmonary blood pressure to the right ventricle is called pulmonary vascular resistance. Afterload has an inverse relationship with stroke volume. Definition: a balloon-like bulge in an artery, resulting from damage or injury to artery walls. They can grow large and rupture, which causes bleeding inside the body, or dissect, split one or more layers of the artery wall, which causes bleeding into and along the layers of the artery wall. Both rupture and dissection are often fatal. Definition: chest pain as a result of myocardial ischemia related to inadequate myocardial blood and oxygen. Causes: obstruction of coronary blood flow from atherosclerosis of the coronary artery, spasms, or any condition that increases myocardial oxygen consumption. Assessment findings: pain, which can develop slowly or quickly, pain described as mild or moderate, pain that is substernal, crushing or squeezing, pain that may radiate to the arms, back, jaw, shoulders, or neck, pain that can last less than 5 minutes or greater than 20 minutes. Clients may experience dizziness and faintness, dyspnea, digestive disturbances, hypertension, palpitations, and tachycardia, and sweating. Treatment: nursing interventions. Apply oxygen therapy per order. Monitor cardiac signs. Assess vital signs. Obtain intravenous access. Assess pain. Institute measures to relieve pain. Administer nitroglycerin as ordered. Maintain client on bed rest. And obtain a 12-lead electrocardiogram, ECG. Treatment will continue based on client response and healthcare provider orders. Special considerations: various patterns can occur: stable, unstable, intractable, or refractory, variant, and pre-infarction. 38. Cardiovascular disorders. Part E, angina, type ES or PAD-RNs of. 39. nclex RN flash review. Adult. Type of angina: stable angina, exertional angina, unstable angina, pre-infarction or crescendo angina, variant, angina Prinz-Metals angina, intractable, refractory angina, pre-infarction angina defining characteristics, predictable and consistent pain that occurs on exertion and is relieved by rest and/or nitroglycerin. Most often has a stable pattern of onset, duration, severity, and relieving factors. Symptoms increase in frequency and severity and may not be relieved with rest or nitroglycerin. Increases in occurrence, duration, and severity over time. Pain at rest with reversible ST segment elevations, believed to be caused by coronary spasms. Can occur at rest. Chronic, incapacitating pain that is unresponsive to treatment, associated with acute coronary insufficiency. Pain lasts more than 15 minutes. Symptoms are associated with worsening cardiac ischemia. Occurs post-myocardial infarction, MI. Definition: incomplete closure of the aortic semilunar valve between the left ventricle and the aorta regurgitation. Aortic insufficiency results in left ventricular failure, later leading to right ventricular failure. Definition: fusion of the valve flaps between the left ventricle and the aorta, caused by a congenital abnormality or acquired from atherosclerosis or bacterial endocarditis. Occurs more often in men than in women. Results in pulmonary congestion and decreased cardiac output. Cardiovascular disorders. Part E. Atrial fibrillation, Berger's disease, thromboang, it is obliterans. Cardiac output Co. 41. Adult, nclex RN flash review. Definition: rhythm is grossly irregular. Atrial heart rate above 350 beats per minute can't be counted. Ventricular rate will vary with the number of impulses conducted through the AV node. P-wave, wavy deflections affecting entire baseline. PR interval, not measurable. QRS, normal, 0.10 seconds or less. Causes, risk factors, hypertension, diabetes, male gender, congestive heart failure, valvular disease. Temporary triggers, alcohol, cardiac surgery, myocardial infarction, ME, pericarditis, pulmonary embolism. Assessment findings dependent on ventricular rate. Fatigue, weakness, shortness of breath, distended neck veins, dizziness, anxiety, syncope, palpitations, chest discomfort, hypotension. Treatment: nursing interventions, antidysrhythmic drugs and anticoagulants. For those at risk of emboli, electric treatment of choice is cardioversion. Take anticoagulants for 4 to 6 weeks prior to procedure. Rate control with calcium, channel blockers, and beta blockers for ventricular rate greater than 100 beats minute. Special considerations: clients with atrial fibrillation are at risk for pulmonary embolism and systemic emboli, embolic stroke. Careful assessment for these conditions is warranted. Definition: an occlusive disease that causes vasculitis of the small and medium-sized arteries and veins of the extremities. The distal upper and lower limbs are most commonly affected. Causes unknown, strongly associated with tobacco use, familial genetic predisposition, and autoimmune etiologic factors. Assessment findings: claudication, muscle pain caused by inadequate blood supply of the arch of the foot, intermittent claudication of the lower extremities, aching pain that is more severe at night, sensitivity to cold. Pulses diminished in distal extremities. Extremities are often cool and red or cyanotic in the dependent position. Ulcerations and gangrene may be seen in the digits. Treatment: nursing interventions, no cure. Treatment based on symptoms. Medications: vasodilators, antiplatelets, calcium channel blockers. Special consideration: commonly seen in young adult males who smoke. Definition: refers to the amount of blood pumped by each ventricle during a given period. In a resting adult, this rate is about 5 Albanian lex. Min and varies greatly depending on the metabolic needs of the body. CO is calculated by multiplying the stroke volume by the heart rate. 42. Part E. Catheterization, cardiac, coronary angioplasty, percutaneous teranzelluminal PTCA. Coronary artery by Piaskra, FT cab Jesh. 43. Adult. Definition: a procedure used to diagnose and treat cardiovascular conditions. During the procedure, a long, thin tube called a catheter is inserted into an artery or vein in the groin, neck, or arm, and threaded through blood vessels to the heart. Definition: a procedure performed to open blocked coronary arteries caused by coronary artery disease (CAD) and to restore arterial blood flow to the heart tissue without open heart surgery. A catheter is inserted into the coronary artery that is diseased being treated. This catheter has a tiny balloon at its tip. The balloon is inflated once the catheter has been placed into the narrowed area of the coronary artery. The subsequent inflation of the balloon compresses the fatty tissue in the artery and makes a larger opening inside the artery for improved blood flow. The use of fluoroscopy during the procedure assists the physician in locating blockages as the contrast dye moves through the coronary arteries. Definition: a surgery that improves blood flow to the heart, often in clients diagnosed with severe coronary artery disease (CAD). Open heart surgery is performed with the use of a cardiopulmonary bypass machine, which allows for full visualization of the heart while maintaining perfusion and oxygenation. During CABG, a healthy artery or vein from the body is connected or grafted to the blocked coronary artery. The grafted artery or vein bypasses the blocked portion of the coronary artery. This creates a new passage, and oxygen-rich blood is routed around the blockage to the heart muscle. nclex and Flash Review. 44. Cardiovascular disorders. Part T. Coronary artery disease (CAD). Electrocardiogram (ECG). Steps for interpreting. 45. nclex and Flash Review. Definition: CAD is a narrowing of the coronary arteries as a result of the accumulation of lipid-containing plaque in the arteries, atherosclerosis. Causes: results from inadequate perfusion of the myocardial tissue and decreased myocardial supply, both of which lead to hypertension, angina, dysrhythmia, MI, heart failure, and/or death. Assessment findings: unremarkable findings during asymptomatic periods, chest pains, cough or hemoptysis, excessive fatigue, palpitations, dyspnea, syncope. Treatment: nursing interventions. Instruct client on eliminating risk factors: low calorie, low sodium, low cholesterol, low fat diet, increased fiber in diet. Surgical treatment may include percutaneous transluminal coronary angioplasty, PTCA, laser angioplasty, atherectomy, vascular stenting, and coronary artery bypass. Medication therapy may include nitrates, calcium channel blockers, cholesterol-lowering medications, and beta-adrenergic blockers, beta blockers. Steps initially. 1. Determine the heart rate. Count the P waves in a 6-second strip to determine the atrial rate, and count the R waves to determine the ventricular rate. Ask yourself, 2. Is there a QRS complex occurring at regular intervals? 3. Are P waves present for each QRS complex? Moving on. 4. Measure the PR interval. Normal equal to 0.08 to 0.20 seconds. 5. Measure the QRS interval. Normal equal to 0.06 to 0.10 seconds. 6. Identify the T wave in the ST segment. 7. Analyze for any abnormalities. Essential. 8. Correlate findings with the characteristics of normal sinus rhythm. 9. Identify rhythm. 10. Initiate appropriate treatment modalities. 46. Cardiovascular disorders. Part 11. Endocarditis, bacterial, infective, heart failure, adult. nclex and Flash Review. Definition: an infection of the valves and inner lining or endocardium of the heart. Organisms often grow in the endocardium in areas of increased turbulence of blood flow or areas of previous cardiac damage. Bacteria can enter from any site of localized infection. Organisms grow in the endocardium, producing vegetation. Causes: risk factors, history of IV drug abuse, recent invasive procedure, endocarditis, prosthetic valves or valvular disease. Assessment findings: low-grade fever, chills, weakness, malaise, murmur development or change in past murmur, and symptoms of heart failure. Vascular findings: petechia in conjunctiva, lips, buccal mucosa, ankles, and the popliteal and antecubital areas, Osler's nodes on fingertips, and Janeway lesions on the palms and soles of the feet. Symptoms associated with emboli: splenomegaly, upper left quadrant pain, flank pain, hematuria, hemiplegia, decreased level of consciousness, and visual changes. Treatment: nursing interventions. Administer 4 to 6 weeks of antibiotic therapy and bed rest in the presence of a high fever or heart failure. Surgical intervention is required for severe valvular damage. Special considerations: vegetation may invade adjacent valves. Vegetation is fragile and may break off, causing emboli. Definition: a general term used to describe the inadequacy of the heart to pump blood effectively throughout the body. This leads to insufficient perfusion of body tissues with vital nutrients and oxygen. Can be acute or chronic in nature, also referred to as pump failure. Causes: ischemic heart disease, myocardial infarction, cardiomyopathy, valvular heart disease, and hypertension. Assessment findings: left-sided heart failure. Results in pulmonary congestion due to the inability of the left ventricle to pump blood to the periphery, dyspnea, orthopnea, wet lungs cough, fatigue, tachycardia, anxiety, restlessness, and confusion. Right-sided heart failure. Results in peripheral edema due to the inability of the right ventricle to pump blood out of the lungs. Peripheral edema, weight gain, distended neck veins, anorexia, nausea, nocturia, and weakness. Treatment: nursing interventions, treat the underlying cause, manage hypertension, treat any dysrhythmias, apply oxygen therapy per order, replace potassium as indicated, decrease sodium in the diet, enforce fluid restriction, limit activity, position client in Fowler's or semi-Fowler's position or seat in an armchair. Medication management includes those that reduce preload and afterload, as well as those that improve contractility of the heart. Cardiac glycosides, diuretics, aldosterone antagonists, vasodilators, angiotensin-converting enzymes, ACE inhibitors, and beta blockers. Special considerations: acute pulmonary edema, a medical emergency, can result from left ventricular failure. If not treated, death will occur from suffocation. The client literally drowns in his or her own fluid. Cardiovascular disorders. Part 11. Heart sounds. Hypertension classification of 49. Adult. nclex RN flash review. Valve location to listen: auscultate aortic valve AV, right second intercostal space pulmonic valve PV, left second intercostal space tricuspid valve TV, left third and fourth intercostal space left midclavicular line, fifth intercostal space mitral valve MV normal heart S1 apex closure of the tricuspid and mitral sounds valve systole, lub S2 base closure of pulmonic and aortic valves diastole, dub abnormal S3 apex rapid ventricular filling Kentucky heart sounds S4 tricuspid mitral, increased resistance to ventricular filling Tennessee pericardial friction rub, left sternal border pericardial inflammation. Grading other heart sounds: clicks, snaps, and murmurs. Systolic blood pressure, diastolic blood pressure category: MHG normal 120 and less than 80 pre-hypertension, 120 to 130 or 80 to 89 hypertension stage I, 140 to 159 or 90 to 99 greater than or equal to 160 greater than or equal to 100 hypertension stage 2 or. Cardiovascular disorders. Part 11. Hypertension management, intermittent claudication. 51. nclex RN flash review. Adult. Pre-hypertension SBP 120 to 139, DBP 80 to 89. Lifestyle modification, weight loss, regular exercise, management of cholesterol levels, reduction of salt intake, and cessation of alcohol and tobacco use. SPB 140-159, DBP. Diuretics or potassium sparing may also initiate. Consider ACE inhibitor or other antihypertensive medications for blood pressure control. SBP 160 or greater, DBP 100 or greater. Continue diuretics, add a second medication, such as a beta-adrenergic blocker, an ACE inhibitor, a calcium channel blocker, or another antihypertensive medication. Hypertension stage I, hypertension stage 2. SBP equal to systolic blood pressure, DBP equal to diastolic blood pressure, ACE equal to angiotensin converting enzyme. Definition: incomplete closure of a valve due to contraction of chordae tendineae or papillary muscles, or due to calcification and scarring of leaflets. Definition: a characteristic leg pain experienced by clients with chronic peripheral arterial disease. Typically, clients can walk only a certain distance before cramping muscle pain forces them to stop. As the disease progresses, the client can walk only shorter and shorter distances before pain recurs. Eventually, The pain may occur at rest. Cardiovascular disorders. Part 11. Medications, anti-anginal. Medications, antihypertensive, nclex N flash review. Adult, nitrates nitroglycerin isosorbide dinitrate, Isordal, isosorbide mononitrate, Imdur beta blockers propranolol, HCTZ, Inderal, atenolol, tenormin Corgard calcium channel blockers, verapamil, Calin, nifedipine HCl percardia, diltiazem HCl cardizem. Alpha adrenergic blockers prazosin, minipres, terazosin, hydroxyphentylamine mesylate, regitine, doxazosin, cardura. Combined alpha-beta blockers labetalol, normodine, carvedilol, coreg beta blockers metoprolol, Lepressor, toprol, nadolol, Corgard, propranolol, HCl, Inderal, timolol, maleate, blocadren, atenolol, tenormin, bisoprolol, zebeta. 54. Cardiovascular disorders. Part 2nd. Medications, antihypertensive, second nclex N flash review. Adult, angiotensin-converting enzyme, ACE inhibitors captopril, capoten, enalapril, maleate, vasotec, lisinopril, zestril, ramipril, altasis, benazepril, lotensin, quinapril, acupril, calcium channel blockers, diltiazem, cardizem, nifedipine, percardia, adalat, verapamil, HCI, Calin, isoptin, isoldipine, suler, thiazides, chlorthalidone, hygrotin, hydrochlorothiazide, ezidrix, microzide, indapamide, lozolmetolazone, xeroxolin, loop, furosemide, lasix, torsemide, demodexis, bumetanide, bumex, potassium-sparing spironolactone, aldactone, amiloride, mitamor. 56. Cardiovascular disorders. Part E. Medications, nitroglycerin administration, client education FOR. 57. nclex N flash review. Adult. 1. Bottled sublingual SL nitroglycerin must be kept tightly closed and in a dark container. 2. Carry medication at all times, sublingual tablets or translingual spray. 3. Tablets that are fresh will cause a slight tingling burning sensation when placed under the tongue. 4. Date all medications, discard after 24 months. 5. Prophylactic use, prior to exercise, sexual intercourse, walking, and so on. 6. Take nitroglycerin at the onset of pain and stop all activity. 7. If pain remains after 5 minutes, call 911 and request emergency medical services, EMS. While waiting for EMS response, if chest pain remains, take another SL tablet or 1-metered spray. 9. Lie down, remain lying down until EMS arrives. 10. Do not abruptly discontinue. 11. If taking long-acting preparations, schedule an 8-hour nitro-free period each day at night is recommended. 12. Male clients should not take erectile dysfunction drugs with nitroglycerin. Definition: leaking, regurgitation of blood back into the left atrium. Mitral insufficiency results from myocardial infarction and chronic rheumatic heart disease. A less common cause is bacterial endocarditis. Men are affected more often than women. Definition: narrowing of the mitral valve. Most common residual cardiac lesion of rheumatic fever. Affects women less than 45 years of age more often than men. Interferes with filling of the left ventricle. Produces pulmonary hypertension and right ventricular failure. Cardiovascular disorders. Part E. Myocardial infarction me. Myocardial infarction. Cardiac enzyme elevation post-me. 59. nclex N flash review. Adult. Definition: also referred to as coronary occlusion or heart attack. It is considered a total occlusion of a portion of a coronary artery. Following this occlusion, myocardial ischemia, injury, or death occurs. Causes: risk factors, atherosclerosis, coronary artery disease CAD, elevated cholesterol levels, smoking, hypertension, obesity, physical activity, impaired glucose tolerance, and stress. Assessment findings: pain, lasts 30 minutes or longer, crushing substernal, radiates to the jaw, back, and left arm, occurs without cause often in the morning. Pain is not relieved by rest or nitroglycerin. only relieved by opioid administration. Other assessment findings: diaphoresis, dyspnea, dysrhythmia, feeling fear and anxiety, pallor, cyanosis, and coolness of extremities. Treatment, nursing interventions: immediate, obtain description of pain, apply nasal cannula oxygen per healthcare provider order, establish IV access, administer nitroglycerin and/or morphine sulfate as ordered, assess vital signs and apply cardiac monitoring, assign bed rest semi-Fowler's position, obtain 12-lead ECG, administer antidysrhythmic agents and thrombolytic therapy as ordered, monitor laboratory results, administer beta blockers as ordered, and monitor for complications of MI dysrhythmia, cardiogenic shock, heart failure. Monitor distal pulses, skin temperature, and blood pressure closely after medication administration. Special considerations: not all clients experience the classic symptoms. Women may experience atypical discomfort, shortness of breath or fatigue, and often present within STEMI, non-stelivation MI or T-wave inversion. Return to enzyme marker onset peak normal, CK2, not cardiac 3 to 6 hours, 12 to 24 hours, 3 to 5 days, specific 4 to 6 hours, CKMB, recognized 12 to 20 hours, 48 to 72 hours indicator of MI by most clinicians, myoglobin 1 to 4 hours, 4 to 8 hours, 24 hours elevates prior to CKMB cardiac troponins as early as 110 to 24 hours, 5 to 14 days hour post-onset LDL, 24 hours 3 to 6 days, 10 to 14 days, 48 hours 10 days, then LDH, 4 hours. The cardiovascular disorders. Part 11, myocardial infarction, MONA 4, pacemaker permanent. 61, nclex RN flash review, adult, M equal to morphine, O equal to oxygen, N equal to nitroglycerin, A equal to aspirin or clopidogrel Plavix. Definition: internal pacemaker with pulse generator implanted in the abdomen or shoulder, can be single or dual chambered. Programmable pacemakers can be reprogrammed by placing a magnetic device over the generator. Settings: synchronous demand pacemaker senses the client's rhythm and paces the heart only when the client's intrinsic rate falls below the set pacemaker rate for stimulating depolarization. Asynchronous fixed rate spikes precede the pacemaker paces at a chamber being paced. A fixed rate no matter what spike preceding a P-wave the client's intrinsic rhythm indicates the atrium is used when the client being paced. A spike pre-asystolic or severely seeding the QRS complex bradycardic indicates the ventricle is being paced. Overriding pacing is used in atrial spike, followed in clients with tachydies by a P-wave indicates rhythmias to suppress atrial depolarization, the rhythm, and permit a ventricular spike full sinus node to regain load by a QRS complex control of the heart. Indicates ventricular depolarization. This process is referred to as pacemaker capture. Pacemaker spikes a pacemaker spike. Straight vertical line will be seen on the monitor or electrocardiogram ECG strip when a pacing stimulus is delivered to the heart. 62. Cardiovascular disorders. Part E. Pacemaker, permanent client education. Pacemaker, temporary, invasive epicardial pacing. 63. nclex RN flash review. Adult. Instruct client about the pacemaker and programmable rate, when of the signs of battery failure, and when to notify the healthcare provider. To report any signs of infection at the insertion site, fever, redness, swelling, and/or drainage. To report signs of dizziness, weakness or fatigue, edema of the ankles or legs, chest pain, and/or shortness of breath. To carry his or her pacemaker identification card at all times and to obtain and wear a Medic Alert ID bracelet. How to take a radial pulse daily and to keep a pulse diary of each pulse rate. To avoid contact sports. To inform all healthcare providers of pacemaker insertion. To make airport security aware that he or she has a pacemaker, as it may set off security system. That most electronic devices may be used with no interference with pacemaker function. Microwave ovens are safe. To avoid anti-theft devices in department stores and transmitter towers. To use cell phone on the side opposite the pacemaker. Type invasive epicardial pacing definition, an electrical power source used outside the body that stimulates and maintains the client's heart rate when the client, intrinsic pacemaker, fails to provide a perfusing rhythm, used only in the hospital setting. Placement pacing wires applied via transthoracic approach. Lead wires are placed on the epicardial surface of the heart after cardiac surgery. Pacemaker wires are brought through the abdomen and capped covered. Considerations and insulate the exposed pacer wires with plastic syringe or rubber material, rubber glove, when the wires are not attached to the pulse generator. May also cover with non-conductive tape and handle pacemaker wires only while wearing rubber gloves to avoid a microshock. 64. Cardiovascular disorders. Part E. Pacemaker temporary invasive transvenous pacing. Pacemaker temporary non-invasive transcutaneous pacing. NCLEX RN flash review. Adult. Type invasive transvenous pacing definition, an electrical power source used outside the body that stimulates and maintains the client's heart rate when the client's intrinsic pacemaker fails to provide a perfusing rhythm, used only in the hospital setting. Placement pacer wires are placed through either the antecubital, femoral, jugular, or subclavian vein into the right atrium or right ventricle. This provides direct contact with the endocardium. Considerations and set pacemaker settings as ordered. And monitor cardiac rhythm and cardiac status continuously, and monitor client's vital signs continuously. And assess pacemaker insertion site often, and restrict client movement to prevent lead wire displacement, and handle pacemaker wires only while wearing rubber gloves to avoid a microshock. Type definition, non-invasive, an electrical transcutaneous power source pacing used outside the body that stimulates and maintains the client's heart rate when the client's intrinsic pacemaker fails to provide a perfusing rhythm, used only in the hospital setting. Placement, used as a temporary emergency measure in the severely bradycardic or asystolic client until a permanent pacemaker can be placed. Minor large electrodes, pads are placed on the client's back, posterior between the spine and left scapula, behind the heart. Avoid placing over bone, and on the client's chest anterior between V2 and V5 positions over the heart. In women, place pad under breast tissue. Considerations and wash skin with soap and water prior to pad electrode placement. Ensure that the pads, electrodes are in good contact with the skin. They do not obtain pulse or blood pressure readings on the left side. And set pacing rate as prescribed. Assure pacemaker capture. And evaluate the client's anxiety and pain level. Administer analgesics as needed. 66. Cardiovascular disorders. Part 11. Pain assessment, PQRST method. 67. Adult NCLEX RN flash review, TPRS. Timing and precipitating Q region and symptoms and response to factors quality radiation signs treatment can occur. Burning, substernal apprehend, sudden with or retroster, on, onset, when heaviness, without nail, auscultation, constant.
Precipitate.
Increases and spreads of crackling factors, with a duration across the and extra move, greater than needing chest. Heart sounds, meant 30 minutes, large and radiates and diaphoresis, meals, and pressure, no relief inside of cold, clammy with nitrates, emotional either or skin, severe or rest. Distress, both arms, pain, dyspnea. The back, in relief within physical the jaw, in smother, dysrhythmias, exertion and uppering, abdomen, nausea, orthopnea, and syncope, vomiting, weakness. Cardiovascular disorders, pericarditis, peripheral arterial disease, PAD. 69. Adult, NCLEX RN flash review, definition, inflammation of partial and or visceral pericardium, acute or chronic condition that may or may not occur with effusion, fibrosis or accumulation of fluid in the pericardium, which causes compression of cardiac pumping, resulting in decreased cardiac output and increased systemic pulmonic venous pressure. Causes risk factors, bacterial, viral, and or fungal infections, tuberculosis, collagen diseases, uremia, myocardial infarction, and trauma. Assessment findings, sharp pain, which is moderate to severe, located in the area of the pericardium and which may radiate to the right arm, jaw, teeth. Chills, sweating, apprehension, anxiety, fatigue, abdominal pain, shortness of breath, restlessness, tachycardia, elevated temperature, decreased pulse pressure, pulses paradoxus, pericardial friction rub, hallmark finding. Elevated central venous pressure CVP, distended neck veins, dependent pitting edema, liver engorgement. Treatment, nursing interventions, semifowler's position, frequent vital signs with cardiac monitoring, oxygen is ordered. Medications, analgesics, non-steroidal anti-inflammatory medications, antibiotics, digoxin, lanoxin, and diuretics if heart failure is noted. Invasive procedure pericardiocentesis, surgical pericardectomy, special considerations, monitor for signs of cardiac tamponade, tachycardia, tachypnea, hypotension, pallor, narrow pulse pressure, pulsus paradoxus, or distended neck veins. Definition: a chronic disorder in which partial or complete arterial occlusion deprives the lower extremities of oxygen and nutrients. Tissue damage occurs below the level of the occlusion. Assessment findings: intermittent claudication, pain at rest with accompanying burning, numbness, and aching in the distal portion of the leg, which awakens the client at night. Pain is relieved by placing the limb in the dependent position. Also, lower back or buttock pain, loss of hair and dry scaly skin on the lower extremities, thickened toenails, decreased or absent peripheral pulses, elevational pallor, and dependent rubor in the lower extremities, signs of arterial ulcer formation, and blood pressure measurements at the thigh, calf, and ankle that are lower than the brachial pressures. Treatment, nursing interventions, assess pain, monitor the extremities for color, motion, and sensation, check pulses, assess for ulcer formation or signs of gangrene. Medication therapy, antiplatelet agents, antihypertensive agents, and antihyperlipidemic agents. Procedures to improve arterial blood flow, percutaneous transluminal angioplasty, laser-assisted angioplasty, and bypass surgery specific to the area of occlusion. Special consideration: amputation may be necessary. Cardiovascular disorders, Part E, peripheral arterial disease, client education FOR. 71, nclex RN flash review. Adult, instruct client to stop smoking, decrease cholesterol and triglyceride intake, maintain an optimal body weight, adhere to exercise regimen, control diabetes and hypertension as directed, walk to the point of claudication, stop and rest, and then walk a little farther, avoid crossing legs, avoid exposure to cold, wear socks as necessary, never apply direct heat to the lower extremities, inspect skin, report any signs of breakdown to healthcare provider. Definition: when affecting veins on the superficial layer of skin, phlebitis is termed superficial and is not serious. Blood clots in the deeper veins are referred to as deep vein thrombosis, not serious in its superficial form, though it may herald deep vein thrombophlebitis, which affects larger blood vessels in the legs. In this form, thrombi or blood clots can break apart and travel to the lungs. This can lead to a life-threatening pulmonary embolism. Causes: most common is trauma to the vessel wall caused by an injury to the vein, can also result from prolonged inactivity or a sedentary lifestyle. Other causes: obesity, smoking, pregnancy, certain birth control pills, intravenous drug use, and certain medical conditions like cancer. Definition refers to the degree of stretch of the ventricular cardiac muscle fibers at the end of diastole. The end of diastole is the period when the filling volume in the ventricles is the highest and the degree of stretch on the muscle fibers is the greatest. Determined by the volume of blood within the ventricles at the end of diastole, this directly affects stroke volume. Cardiovascular disorders. Part 11. Pulmonary edema, Raynaud's phenomenon, nclex RN flash review. Adult. Definition: a condition caused by an abnormal accumulation of fluid blood in the lung, in both the interstitial and alveolar spaces. Pulmonary edema is a result of severe impairment of the left side of the heart to maintain cardiac output, leading to engorgement of the pulmonary vascular bed. Causes: risk factors, inhaled toxins, severe hypoxia, pneumonia, cardiac myopathy, heart failure, and overhydration. Assessment findings. Initial findings: frothy pink, blood-tinged sputum classic sign, restlessness, anxiousness, sense of breathlessness and suffocation, ashen skin, weakened and thready pulse, distended neck veins. Late findings: confusion, stupor, breathing that is rapid, noisy, and moist sounding. Oxygen saturation readings decrease drastically. Treatment: nursing interventions, oxygen therapy via face mask, mechanical ventilation may be required. Obtain 4-access, administer 4-morphine, IV push or a continuous infusion of furosemide Lasix, and at 4 infusion of a vasodilator nitroglycerin or nitroprusside nipride per physician order. Position client in a high Fowler's position, insert a Foley catheter, monitor vital signs and urine output, and provide emotional support. Special consideration: pulmonary edema is a medical emergency and requires prompt recognition and treatment. Definition: an episodic vasospastic disorder of small cutaneous arteries, most frequently involving the fingers and toes. The vasospasms result from an exaggerated response to the sympathetic nervous stimulation. Causes, contributing factors, occupationally related trauma, and pressure to the fingertips. Pianists, typists, and those who handle vibrating equipment. Exposure to stress, cold, caffeine, and tobacco. Assessment findings: vasospasm-induced color changes of the fingers, ears, nose, and toes, white, blue, and red. Complaints of coldness, numbness, throbbing, aching pain, tingling, and swelling of the affected area during an attack. After frequent prolonged attacks, skin will thicken and nails will become brittle. Treatment: nursing interventions, extensive client teaching, avoidance of temperature extremes, cold, tobacco and caffeine use, and stress. Medications: calcium channel blockers, nifedipine, Procardia, diltiazem, cardizem. Special consideration: commonly seen in young adult women between the ages of 15 and 40. Cardiovascular disorders, Part 11, shock states, nclex N-flash review. Adult, shock state, hypovolemic, cardiogenic, anaphylactic, neurogenic oxygen, cautious use of fluid resuscitation, vasopressors, atropine. Treatment dependent on cause, for example, spinal cord injury. Flushed, pale, cyanide oxygen, hemodynamic monotoric skin, BP normal, IG, aggressive fluid resuscitation, ABP, full bounding antibiotics, cultures first, for example, pulse, rapid, weak, blood, urine, wound, vasopress ready, shallow sores, inotropes. Respirations, changes in lock septic signs and symptoms, pallor, cool, clammy skin, APP, rapid, thready pulse, shallow respirations, AWO, changes in lock, pallor, cool, clammy skin, ABP, rapid, thready pulse. Tachypnea, crackles, raunchy, and DUO, NBS, changes in lock, cool, pale skin, and BP, unpulse, chest pains, swelling of the lips and or tongue, larynx, epiglottis, wheezing, stridor, skin rash, anxiety, pale, warm, dry skin, and BP, and pulse nursing intervention. Treatment: oxygen, rapid infusion of fluid volume, blood, crystalloids. Correct the cause, for example, bleeding, GI losses. Oxygen, hemodynamic monitoring, nitrates, inotropes, diuretics, intra-aortic balloon pump, IEBP, ventricular assist device. Restore blood flow. Oxygen, fluid resuscitation, antihistamines, epinephrine, bronchodilators, corticosteroids. Identify and remove cause. Equal to decreased, equal to increased, BP equal to blood pressure, BS equal to bowel sounds, GI equal to gastrointestinal, LOC equal to level of consciousness, UO equal to urine output. Cardiovascular disorders, Part 11. Sinus bradycardia. Adult, nclex N-flash review. Definition: heart rate below 60 beats per minute, P-wave, 1 for every QRS complex, PR interval, normal, 0.1, 2 to 0.20 seconds. QRS complex, normal, 0.10 seconds or less. Causes: hypoxia wall, suctioning, vomiting, Valsalva maneuvers, beta-adrenergic, blocking agents, calcium channel blockers, digitalis. Assessment findings: syncope, dizziness and weakness, confusion, hypotension, diaphoresis, shortness of breath, and angina pain. Treatment: nursing interventions, oxygen therapy, external pacemaker, atropine intravenously IV. Special considerations: well-conditioned athletes have a hyper-effective heart, thus tolerating bradycardia well. Definition: heart rate between 60 to 100 beats per minute, rhythm is regular, P-wave, 1 for every QRS complex, PR interval, normal 0.12 to 0.20 seconds, QRS complex, normal 0.10 seconds or less. Cardiovascular disorders. Part 11. Sinus tachycardia. Stenosis. 79. Adult. nclex and flash review. Definition: heart rate between 100 and 180 beats per minute. P wave, 1 for every QRS complex. PR interval, normal 0.12 to 0.20 seconds. QRS complex, normal 0.10 seconds or less. Causes: excitement, exertion, fever, infection, septic shock, hypoxia, hypovolemia, hypotension, heart failure, pain, anxiety, anemia, smoking, alcohol, caffeine, medications that increase sympathetic tone, medications that decrease parasympathetic tone, myocardial ischemia, and myocardial infarction. Assessment findings: fatigue, weakness, restlessness, anxiety, shortness of breath, orthopnea, neck vein distension, decreased oxygen saturation, and hypotension. Treatment: nursing interventions treat the underlying cause. Initiate oxygen and medication therapy as directed. Special considerations: sinus tachycardia in healthy individuals is usually benign and does not require aggressive treatment. The underlying cause must be treated. Definition: narrowing of valvular opening due to adherence, thickening, and rigidity of valve cusp. This narrowing prevents the valve from opening fully, which obstructs blood flow from the heart into the aorta and onward to the rest of the body. When the aortic valve is obstructed, the heart needs to work harder to pump blood to the body, which eventually can weaken the heart and limits the amount of blood it can pump, leading to symptoms such as fatigue and dizziness. In its severe form, surgery is required to replace the valve. Left untreated, it can lead to serious heart problems. Definition: amount of blood ejected from the ventricle per heartbeat. The average resting stroke volume is about 70% ml, and the heart rate is between 60 to 100 BPM. Cardiac output can be affected by changes in either stroke volume or heart rate. Cardiovascular disorders. Part E. Valvular defects. Comparison of symptomatology of I valvular defects. Comparison of symptomatology of second nclex RN flash review. Adult. Assessment: subjective data. Mitral stenosis, insufficiency, fatigue, X, shortness of breath, X, orthopnea, proximal, nocturnal dyspnea, cough, dyspnea of exertion, palpitations, syncope of exertion, angina, weight loss, aortic stenosis, aortic insufficiency, X. Mitral stenosis, mitral insufficiency, aortic stenosis, aortic insufficiency assessment, objective data: blood pressure, low normal blood pressure, normal or elevated X-pulse, weak, irregular X-pulse, rapid respirations, increased, X-shallow dyspnea of exertion, X cyanosis, jugular vein distension, enlarged liver, murmur, X. Cardiovascular disorders. Part E. Venous thrombosis, thrombophlebitis, ventricular contractions complexes, premature PVCs. 83. Adult. nclex RN flash review. The most common disorder of the veins, the formation of a thrombosis clot in association with inflammation of the vein, can be superficial or a deep vein thrombosis, DVT. Causes, risk factors: Virchow's triad, venous stasis, surgery, hip, pelvic and orthopedic surgery, pregnancy, obesity, prolonged immobility, heart disease, endothelial damage, IV fluid and drug use, abdominal and pelvic surgery, history of DVT, fractures and dislocations, leg, hip, pelvis, hypercoagulability, malignancies, dehydration, blood dyscrasias, oral contraceptives. Assessment findings: superficial thrombophlebitis, firm, palpable, cord-like vein, tender to touch, surrounding area warm and reddened. DVT, area around vein is tender to touch, reddened and warm, extremity pain and edema. Temperature above 100.4 of. Omen sign may be present, but is an unreliable indicator. Treatment, nursing interventions, bed rest, elevated extremity, anticoagulation, anti-inflammatory, and fibrinolytic medications, warm, moist packs, elastic support stocking on unaffected extremity during periods of bed rest, surgical interventions, venous thrombectomy, umbrella filter in the vena cava. Special consideration, DVT is associated with a high risk for pulmonary emboli, chronic venous insufficiency, and venous stasis ulcers. Definition, an impulse that starts in the ventricle and is conducted through the ventricles before the next normal sinus impulse. Causes, cardiac ischemia or infarction, heart failure, tachycardia, digitalis toxicity, hypoxia, acidosis, or electrolyte imbalances, especially hypokalemia. Underlying rhythm can be regular or irregular. P wave is not usually visible and is often hidden in the PVC. PR interval is not measurable. QRS complex is wide and distorted. Assessment findings can be benign in those with no underlying heart disease. And heart disease, depending on frequency, can reduce cardiac output and precipitate angina and heart failure. Treatment, nursing interventions. Treatment is based on the cause of the PVC, for example, oxygen therapy for hypoxia, electrolyte replacement. Medication therapy may consist of beta blockers, procainamide, amiodarone, or lidocaine. Special considerations, PVCs can occur in healthy people with intake of caffeine, nicotine, or alcohol. PVCs can be called as follows. Bigeminy. Every other complex is a PVC trigeminy. Every third complex is a PVC and quadrigeminy. Every fourth complex is a PVC. 84. Cardiovascular disorders. Part 11. Ventricular fibrillation VF. 85. Adult. nclex RN flash review. Definition, a severe derangement of the heart rhythm characterized on the ECG by irregular undulations of varying shapes and amplitude. HR is not measurable. Rhythm is irregular and chaotic. The P wave is not visible, and the PR interval and QRS interval are not measurable. Causes, acute myocardial infarction, myocardial ischemia, EAD, cardiomyopathy, electrical shock, hyperkalemia, hypoxia, acidosis, and drug toxicity. Assessment findings, unresponsiveness, pulselessness, and apneic state. Treatment, nursing interventions, immediate CPR, and advanced cardiac life support, ACLS measures, with the use of defibrillation and definitive medication therapy. Special consideration mechanically, the ventricle is simply quivering and not effectively contracting. Consequently, no cardiac output occurs. Definition, 3 or more PVCs in a row. It occurs when there is an ectopic focus, or when foci fire repetitively and the ventricle takes control as the pacemaker. Ventricular rate is 150 to 250 BPM. Rhythm is regular or irregular. P waves occur independently of the QRS complex. The P wave can be buried in the QRS complex, and the PR interval is not measurable. The QRS complex is distorted in appearance with duration greater than 0.12 seconds. It can be stable with a pulse or unstable without a pulse. Causes associated with myocardial infarction, CAD, significant electrolyte imbalances, cardiomyopathy, mitral valve prolapse, digitalis toxicity, and central venous disorders. Assessment findings, hypotension, pulmonary edema, decreased cerebral blood flow, and cardiopulmonary arrest. Treatment, nursing interventions, stable, beta blockers, lidocaine, amiodarone, procainamide, or sotalol. Unstable, cardiopulmonary resuscitation CPR with rapid defibrillation are first-line treatments followed by epinephrine if defibrillation is unsuccessful. Special consideration, occurrence without a pulse is life-threatening. 86. Endocrine disorders, Part 2 Addison's crisis. 87. nclex RN flash review. Adult. Definition, a life-threatening disorder caused by adrenal hormone insufficiency. Crisis is precipitated by infection, trauma, stress, or surgery. Death may occur from shock, vascular collapse, or hyperkalemia. Causes, severe physical shock, for example, a car accident, severe infection, for example, flu with a high temperature, severe dehydration, for example, gastrointestinal virus with vomiting. Assessment findings, extreme weakness, mental confusion, extreme drowsiness, in advanced cases slipping toward a coma, pronounced dizziness, nausea, and/or vomiting, severe headache, abnormal heart rate, bradycardia or tachycardia, abnormally low blood pressure, feeling extremely cold, possibly a fever or abdominal tenderness. Definition: autoimmunity-induced condition resulting in a decrease in secretion of the adrenal cortex hormones, decreased physiologic response to stress, vascular insufficiency, and hypoglycemia can cause an alteration in adrenal androgen secretion necessary for secondary sex characteristics. Causes: occurs after bilateral adrenalectomy or abrupt withdrawal from long-term corticosteroid therapy. Adrenal crisis may be precipitated by client's failure to take medications, AIDS, sepsis, tuberculosis, or increased emotional stress without appropriate hormone replacement. Assessment findings: fatigue, weakness, weight loss, gastrointestinal GI disturbances, hypoglycemia, postural hypotension, hyponatremia, hyperkalemia, bronze pigmentation of the skin, and Addisonian crisis. Treatment: nursing interventions, focus on replacement of adrenal hormones and safely administering steroid replacement. Frequently evaluate vital signs, assess sodium and water retention, evaluate serum potassium levels, and keep client immobilized and quiet. Administer steroid preparations with food or antacid. Evaluate for edema and fluid retention. Assess serum sodium and potassium levels. Check daily weight. Increase intake of protein and carbohydrates. Monitor for Cushingoid symptoms and evaluate for hypoglycemia. Definition: an abnormal spasm of the facial muscles elicited by light taps on the cheek to stimulate the facial nerves in clients who are hypocalcemic. It is a sign of tetany. Checking for this sign is especially important after thyroid or parathyroid surgery. Endocrine disorders, Part E, CUS-H-Ings disease. 89. Adult nclex flash review. Definition: condition resulting from excess levels of adrenal cortex hormones and, to a lesser extent, androgen and aldosterone. Causes: more common in women 20 to 40 years old, pituitary hypersecretion, a benign pituitary tumor, iatrogenic, most often a result of long-term steroid therapy. Assessment findings: emotional ability and irritability, moon face, deposit of fat on the back, thin skin, purple striae, truncal obesity with thin extremities, petechiae and bruises, persistent hyperglycemia, GI distress from increased acid production, osteoporosis, increased risk of infection, edema, potassium depletion, hypertension, amenorrhea females, hirsutism females, gynecomastia males, impotence or decreased libido. Treatment: nursing interventions, manage hormone imbalance directed at restricting sodium and water intake, monitor fluid and electrolyte levels, evaluate for hyperglycemia and GI disturbances, and prevent infection. Identify complications, including excess sodium and water retention, potassium depletion, thromboembolic problems, and fractures. Definition: the hyposecretion of antidiuretic hormone from the posterior pituitary gland, resulting in failure of tubular reabsorption of water in the kidneys and diuresis. Definition: a complex multisystem disease characterized by the absence of, or a severe decrease in, the secretion or utilization of insulin. Classified as either type 1 absolute lack of insulin secretion or type 2 combination of insulin resistance and inadequate insulin secretion to compensate. Clinical manifestations of both type 1 and type 2 include polyphagia, polydipsia, polyuria, fatigue, and increased frequency of infections. Endocrine disorders. Part 2: diabetes, type 1, diabetes type 2, 91. nclex flash review. Adult description: absolute lack of insulin secretion, previously known as juvenile diabetes or insulin-dependent diabetes mellitus. Absence of insulin production, client is dependent on insulin to prevent ketoacidosis and maintain life. Onset is frequently in childhood, most often diagnosed before the age of 18 years. Most common age range is 10 to 15 years. Familial tendencies and transmission, lifelong disorder, clinical manifestations, weight loss, excessive thirst, bedwetting, blurred vision, and abdominal pain. Description: combination of insulin resistance and inadequate insulin secretion to compensate. Insulin deficiency caused by defects in insulin production or excessive demands for insulin. Client is not dependent on insulin. Ketoacidosis not a concern. Onset is predominantly in adulthood, generally after the age of 40 years, but it may occur at any age, previously called adult-onset diabetes mellitus, AODM, or non-insulin-dependent diabetes. Associated with obesity, obese clients require more insulin. Blood sugar is often controlled by diet and oral hypoglycemics, but during episodes of increased stress, insulin injections may be required. Clinical manifestations. Clients often asymptomatic for the first 5 to 10 years. Weight gain, visual disturbances, fatigue, and malaise. Recurrent vaginal yeast or Monilla infections, frequently initial symptom in women. Endocrine disorders. Part E, diabetic ketoacidosis DKA, 93, adult, nclex N flash review. Definition: a life-threatening complication of diabetes mellitus that develops when a severe insulin deficiency occurs. Hyperglycemia progresses to this state over a period of several hours to several days. Acidosis occurs in clients with type 1 diabetes mellitus, persons with undiagnosed diabetes, and persons who stop prescribed treatment for diabetes. DKA HHNS onset, age sudden, all ages, with gradual adult, usually seen in increased incident in older adults with chronic illnesses, children, precipitating infection, other stressors, infection, other stressors, poor factors, inadequate insulin dose, fluid intake manifestations, ketosis, Kussmaul, Azres, altered central nervous system function with neurologic pyrations, fruity breath, nausea, abdominal pain symptoms, on dehydration and dehydration and electrolyte loss, same as DKA electrolyte loss, polyuria, polydipsia, weight loss, dry skin, sunken eyes, soft eyeballs, lethargy, coma. Definition: elevated blood glucose level greater than 250 milligrams, DL. Clinical findings: high blood glucose levels, high levels of glucose in the urine, frequent urination, increased thirst. 94. Endocrine disorders. Part E, hyperglycemic, hyperosmolar nonketotic syndrome HHNs, hyperthyroidism Graves' disease. 95. nclex N flash review. Adult. Definition: extreme hyperglycemia without acidosis. A complication of type 2 diabetes mellitus that may result in dehydration or vascular collapse but does not include the acidosis component of diabetic ketoacidosis. Onset is usually slow, taking from hours to days. Definition: hypersecretion of growth hormone by the anterior pituitary gland leads to conditions such as acromegaly and Cushing's disease. Causes primarily by pituitary tumors. Assessment findings: large hands and feet, thickening and protrusion of the jaw, arthritic changes in joint pain, visual disturbances, diaphoresis, oily and rough skin, organomegaly, hypertension, dysphagia, and deepening of the voice. Treatment: nursing interventions. Provide emotional support and encouragement to the client and family to express feelings related to disturbed body image. Provide frequent skin care. Provide pharmacological and non-pharmacological interventions for joint pain. Prepare the client for radiation of pituitary gland if indicated, and prepare the client for hypophysectomy if planned. Definition: an immune system disorder that results in the overproduction of thyroid hormones. Causes: more prevalent in women and older adults. Peak incidence in third and fourth decade of life, possibly an autoimmune condition. Assessment findings: because thyroid hormones affect several body systems, signs and/or symptoms can be wide-ranging. They include anxiety, irritability, difficulty sleeping, fatigue, rapid or irregular heartbeat, fine tremor of hands or fingers, increase in perspiration or warm, moist skin, sensitivity to heat, weight loss, despite normal eating habits, goiter, change in menstrual cycles, erectile dysfunction or reduced libido, frequent bowel movements or diarrhea, bulging eyes and thick, red skin usually on the shins or tops of the feet. Treatment: nursing interventions, thyroidectomy, reduction of thyroid tissue, irradiation of thyroid gland eventually resulting in hypothyroid state, decreased thyroid synthesis and release. Other interventions involve decreasing the effects of excess thyroid hormone, preventing complications of thyroid storm, and protecting the eyes. Endocrine disorders. Part 2, hypoglycemia. 97. Adult, nclex RN flash review. Definition: decreased blood glucose level, lower than 70 milligrams DL, which results from too much insulin, not enough food, or excess activity. Clinical findings: mild, hunger, nervousness, palpitations, sweating, tachycardia, tremor. Moderate, confusion, drowsiness, double vision, headache, impaired coordination, inability to concentrate, irrational or combative behavior, slurred speech, numbness of tongue and lips. Severe, difficulty arousing, seizures, loss of consciousness. Definition: hyposecretion of one or more of the pituitary hormones caused by tumors, trauma, encephalitis, autoimmunity, or stroke. Hormones most often affected are growth hormone GH and gonadotropic hormones, luteinizing hormone, follicle-stimulating hormone, thyroid-stimulating hormone TSH, adrenocorticotropic hormone ACH, or antidiuretic hormone ADH may be involved. Assessment findings: mild to moderate obesity GH-TSH, reduced cardiac output GH-ADH, infertility, sexual dysfunction gonadotropins ACH, fatigue, low blood pressure TSH-ADH, ACH-GH. Tumors of the pituitary also may cause headaches and visual defects. Pituitary is located near the optic nerve. Treatment: nursing interventions. Provide emotional support to the client family. Encourage the client family to express feelings related to disturbed body image or sexual dysfunction. Client may need hormone replacement for the specific, deficient hormones. Client education is needed regarding the signs and symptoms of hypofunction and hyperfunction related to insufficient or excess hormone replacement. Definition: condition characterized by a slow deterioration of thyroid function, occurs primarily in older adults and 5 times more frequently in women ages 30 to 60 than in men. Myxedema coma is a life-threatening form. Causes: hyposecretion of thyroid hormones, T3 and T4. Assessment findings: early, extreme fatigue, menstrual disturbances, brittle nails, hair loss, dry skin, anorexia, intolerance to cold, apathy, constipation. Late, subnormal temperature, bradycardia, congestive heart failure, hypotension, thickened skin, weight gain and edema, alterations in level of consciousness. Treatment: nursing interventions, assist client to return to hormone balance, thyroid replacement, provide a warm environment, prevent and treat constipation, assess client's response to therapy, decreased body weight, intake and output balance, reduction in visible edema, increased energy level, evaluate cardiovascular response to medications, assist the client to understand implications of disease and requirements for health maintenance. Endocrine disorders. Part T. Insulin, type E's of, NTR immediate ATTing, and D long ATing. nclex RN flash review. Adult. Type description: intermediate acting insulin, NPH, lentehumulin N, novolin N, rely on, onset 1.5 to 4 hours peak, 4 to 12 hours duration, 12 to 18 hours. Never give forth. May be mixed with regular insulin, long-acting insulin, glargine lantus, Toujeo, detamir levmir, degludec tresiba, cannot be mixed with other insulins. 1 to 4 hours, no pronounced peak, 16 to 24 hours, usually given once a day at bedtime, but can be administered during the day. Type description: rapid-acting insulin, Lispro Humalog, Aspart Novolog, Glulisine Apodra, onset peak 15 to 30 minutes, 30 minutes 3 hours duration 3 to 5 hours, should be used in combination with long-acting insulin. Because of quick onset and action, client must eat immediately. Short-acting insulin, regular Humulin R, Novolin R, Relion, and Amand given 20 to 30 minutes before meals, may be given alone or in combination with longer-acting insulins, and even for sliding scale coverage, and may mix regular insulin with other insulins. Only regular insulin may be given for 30 minutes, 1 hour, 2 to 5 hours, 5 to 8 hours, 100. Endocrine disorders. Part E. Myxedema, Somogi, Phenomenon. 101. nclex RN flash review. Adult. Definition: the most severe form of hypothyroidism characterized by swelling of the hands, face, feet, and periorbital tissues. At this stage, the disease may lead to coma and death. Definition: a rebound phenomenon that occurs in clients with type 1 diabetes mellitus. Normal or evaluated blood glucose levels are present at bedtime. Hypoglycemia occurs at about 2 to 3 a.m. Counter-regulatory hormones produced to prevent further hypoglycemia result in hyperglycemia, evident in the pre-breakfast blood glucose level. Treatment includes decreasing the evening pre-dinner or bedtime dose of intermediate-acting insulin or increasing the bedtime snack. Definition: an acute, potentially fatal exacerbation of hyperthyroidism that may result from manipulation of the thyroid gland during surgery, severe infection, or stress. Antithyroid medications, beta blockers, glucocorticoids, and iodides may be administered before thyroid surgery to prevent its occurrence. Definition: a sign of hypocalcemia. Carpal spasm can be elicited by compressing the brachial artery with a blood pressure cuff for 3 minutes. 102. Eye and ear disorders. Part E. Cataracts. 103. nclex RN flash review. Adult. Definition: condition characterized by opacity of the lens. Diagnostic tests include ophthalmoscope and slit lamp biomicroscope. Surgical removal is done when vision impairment interferes with daily activities. Causes: advanced age, trauma, toxic substances, or systemic diseases, or may be congenital. Assessment findings: early signs, blurred vision, decreased color perception. Late signs: diplopia, reduced visual acuity, progressing to blindness, clouded pupil, progressing to a milky white appearance. Treatment: nursing interventions. Postoperative care: teach proper eye medication installation to client or family member. Postoperative teaching includes: client should not rub or apply pressure to the operative eye, shaded glasses should be worn during waking hours, and an eyelid cover during sleeping hours. Take stool softeners to avoiding straining. No lifting of 15 pounds or more. Bending, coughing, or any other activity that may increase intraocular pressure. Avoid lying on operative side. Keep water out of eye while showering. Report pain or changes in vital signs. Note: remember to pull the ear up and back. 1. Position the client on the side of the unaffected ear, or tilt the head. Pull the pin up and back. Direct the ear drops toward the ear canal. This is done to avoid hitting the tympanic membrane, which would cause pain, and instill the correct number of drops. 3. Release the pinna. 4. Instruct the client to remain in the tilted head position for 2 to 3 minutes to allow solution to run completely in the ear. 5. Instruct the client to resume a normal head position and dry any solution from around the outside of the ear. 1. Retract the client's lower eyelid gently. 2. Request that the client look up at the ceiling to diminish the corneal reflex. 3. Instill the eye drops into the inner corner of the eye conjunctival sac. 4. Gently release the client's lid. Note: never let the drops fall directly on the pupil. Eye and ear disorders. Part E. Glaucoma, hearing loss, type E as of hyperopia. 105. Adult, nclex RN flash review. Definition: a group of ocular diseases resulting in increased intraocular pressure. Increased pressure results from inadequate drainage of aqueous humor from the canal of Schlemm, or overproduction of the aqueous humor. The condition damages the optic nerve and can result in blindness. Cannot be cured, but can be treated successfully with medications and surgery. Causes: family history, history of diabetes, increased incident in the elderly, certain medications, antihistamines, anticholinergics. Assessment findings: early signs: increased intraocular pressure, greater than 22 mmHg, decreased accommodation or ability to focus. Late signs: loss of peripheral vision, seeing halos around light, decreased visual acuity not correctable with glasses, headache, or eye pain that may be so severe as to cause nausea and vomiting. Treatment: nursing interventions, administer eye drops as ordered, pilocarpine most commonly utilized. Teach client about proper eye drop administration, safety measures, and avoiding activities that increase intraocular pressure. Special considerations: vision that is lost cannot be restored. Eye drops will be required for life. Instruct client that after pilocarpine administration, vision may be blurred for 1 to 2 hours, and adaptation to dark environments will be difficult because of papillary constriction, desired effects of medication. Conductive hearing loss, sensorineural hearing loss, in which sound does not travel well to the sound organs of the inner ear. The volume of sound is less, but the sound remains clear. If voice volume is raised, hearing is normal. Usually results from cerumen, wax impaction, or middle ear disorders, treated successfully with hearing aids, a form of hearing loss in which sound passes properly through the outer and middle ear but is distorted by a defect in the inner ear, involves perceptual loss, usually progressive and bilateral. Damage to the 8th cranial nerve. Causes include infections, ototoxic drugs, trauma, neuromas, noise, aging process. Definition: farsightedness. Rays coming from an object converge to a point behind the retina. Vision beyond 20 feet is normal, but near vision is poor. Condition corrected by a convex lens. 106. Eye and ear disorders. Part 2. Macular degeneration. 107. Adult. nclex flash review. Definition: a blurred central vision caused by progressive degeneration of the center of the retina. The condition may be atrophic or age-related and may be dry or exudative wet. Definition: a dilated pupil that occurs because of blockage of the muscarinic receptors of the sphincter muscles or by stimulation of the alpha receptors of the dilator muscles. Enlarged pupils occur with stimulation of the sympathetic nervous system, use of dilating drops, acute glaucoma, or past or recent surgery. 108. Eye and ear disorders. Part 2. Myopia. 109. Adult. nclex flash review. Definition: nearsightedness. Rays coming from an object are focused in the front of the retina. Near vision is normal, but distant vision is altered. A biconcave lens is used for correction. Definition: a hole or tear in, or separation of the sensory retina from the pigmented epithelium. Occurs when the layers of the retina separate because of the accumulation of fluid between them, or when both retinal layers elevate away from the choroid as a result of a tumor. Partial detachment becomes complete when untreated. When detachment becomes complete, blindness occurs. Causes: blunt trauma, astigmatism. Assessment findings: flashes of light, floaters or black spots, signs of bleeding, increasing blurred vision, loss of a portion of the visual field, painless loss of central or peripheral vision. Treatment: nursing interventions. Client may be placed on bed rest. Eye patch placed over affected eye. Administer medication as ordered to inhibit accommodation and constriction. Cycloplegics, midriatic, and homatropine are administered to dilate the pupil prior to surgery. Administer pain medication postoperatively as ordered. Acetaminophen, Tylenol, meperidine, Demerol, oxycodone. If gas bubble used inserted in vitreous, position client so bubble can rise against area to be reattached. Special considerations: resealing is done by surgery, cryotherapy, freezing, photocoagulation, laser, diathermy, heat, or scleral buckling most common. 110. Part 11. Adult nclex flash review. Definition: accumulation of fluid, usually serous fluid, which is a pale yellow and clear fluid, in the abdominal peritoneal cavity. Acidic fluid can have many sources, such as liver disease, cancers, congestive heart failure, or kidney failure. The most common cause is advanced liver disease. Definition: obstruction that occurs when the small or large intestine is partly or completely blocked, which prevents food, fluids, and gas from moving through the intestines normally. Fluid, gas, and intestinal contents accumulate proximal to the obstruction. This causes distension proximal to the obstruction and bowel collapse distal to the obstruction. Causes can be mechanical or intestinal vascular. Mechanical causes include strangulated hernia, intussusceptions, volvulus, tumors, adhesions, vascular obstruction. Assessment findings: vomiting, abdominal distension. Initially, bowel sounds may be hyperactive proximal to the obstruction and decreased or absent distal to the obstruction. Eventually, all bowel sounds will be absent. Paralytic ileus or adynamic ileus, colicky abdominal pain, fluid and electrolyte imbalance, dehydration. Treatment: nursing interventions. Medical and vascular obstruction are generally treated surgically. Ileostomy or colostomy may be necessary. Conservative treatment includes nasogastric, NG, suctioning and decompression, fluid and electrolyte replacement. If intussusception is noted, hydrostatic reduction by water-soluble contrast, air or barium enema. Definition: an inflammation of the gallbladder, which is frequently associated with stones. This condition may be acute or chronic. Causes associated with stones: Escherichia coli is a common bacterium involved, may also be associated with neoplasms, anesthesia, or adhesions. Assessment findings: nausea and vomiting, indigestion, belching, flatulence, epigastric pain that radiates to the scapula 2 to 4 hours after eating fatty foods and may persist for 4 to 6 hours, pain localized in the right upper quadrant, guarding, rigidity and rebound tenderness, Murphy's sign, elevated temperature, tachycardia, signs of dehydration. If biliary obstruction is present, jaundice, dark orange and foamy urine, steatorrhea and clay-colored feces, pruritus. Treatment: nursing interventions, anticholinergics to decrease secretions and promote relaxation of the gallbladder, analgesics, hydromorphone dilaudid, morphine, antibiotics, atropine and dicyclamine, bentyl, will relieve spasms and decrease pain. Ketorolac, Toradol, may be used to decrease spasms and pain in older adults. Laparoscopic cholecystectomy, 112. Gastrointestinal disorders, Part 11. Cholelithiasis, 113. NCLEX RN flash review. Adult. Definition: presence of stones in the gallbladder, most common form of biliary disease. Causes, risk factors, and etiology include supersaturation of bile with cholesterol. Conditions upsetting cholesterol and bile balance include infection and disturbances of cholesterol metabolism, increased incidence in females, especially during pregnancy, increased occurrence after age 40, obesity. Assessment findings: depends on the mobility of the stone and whether obstruction occurs, epigastric distress, feeling of fullness, abdominal distension, vague pain in the right upper quadrant after consumption of meals high in fat. Treatment: nursing interventions, cholecystectomy, surgical removal of stones. Definition: a chronic, progressive disease of the liver, characterized by diffuse degeneration and destruction of hepatocytes, which causes scar tissue to form. Complications include portal hypertension, ascites, bleeding esophageal varices, coagulation defects, hepatorenal syndrome. Causes: chronic alcohol abuse, hepatitis B, hepatitis C, cystic fibrosis, destruction of the bile ducts, fat that accumulates in the liver, hardening and scarring of the bile, galactosemia, hemochromatosis, autoimmune hepatitis, schistosomiasis, biliary atresia, glycogen storage disease. Assessment findings: neurological, GI, renal, endocrine, immune system, cardiovascular, pulmonary, hematologic, dermatologic, and fluid and electrolyte alternations. Treatment: nursing interventions, elevate the head of the bed, provide supplemental vitamins, restrict sodium and fluid intake as ordered, initiate enteral feedings or parenteral nutrition as ordered, weigh client and measure abdominal girth daily, monitor for asterixis, factor hepaticus, and level of consciousness. Evaluate coagulation laboratory results. Administer diuretics, blood products, antacids, lactulose, antibiotics as ordered. Maintain gastric intubation to assess bleeding or esophagogastric balloon tamponade to control bleeding. If indicated, prepare client for paracentesis and surgical shunting procedure. 114 gastrointestinal disorders, Part E. 115 NCLEX RN flash review. Adult. Lennox cirrhosis, post-necrotic cirrhosis, biliary cirrhosis, cardiac cirrhosis, alcohol-induced, nutritional or portal. Cellular necrosis causes eventual widespread scar tissue with fibrotic infiltration of the liver. Occurs after massive liver necrosis. Results as a complication of hepatitis or exposure to hepatotoxins. Scar tissue causes destruction of the liver lobules and entire lobes. Develops from chronic biliary obstruction, bile stasis, and inflammation, resulting in severe obstructive jaundice. Associated with severe right-sided congestive heart failure and results in an enlarged edematous, congested liver. The liver becomes anoxic, resulting in liver cell necrosis and fibrosis. Definition: an inflammatory disease that can occur anywhere in the gastrointestinal tract, but commonly affects the terminal ileum and leads to thickening and scarring, a narrowed lumen, fistulas, ulcerations, and abscesses. Causes: high incidence of familiar occurrence. Assessment findings: fever, cramp-like and colicky pain after meals, electrolyte imbalances, diarrhea which may contain mucus and pus, dehydration, anemia, weight loss, anorexia, nausea and vomiting, abdominal dissection, malnutrition, impaired absorption of vitamin B12. Treatment, nursing interventions, increase calories, protein, and fluid. Encourage several small meals each day. Anti-inflammatory, aminosalicylates, and corticosteroids. Antimicrobials to prevent and treat infections. Immunosuppressants to decrease or suppress the immune response. Antidiarrheals. Surgical intervention may be necessary if client fails to respond to medical management and if fistulas, perforation, bleeding, or internal obstruction occurs. Total removal of colon, rectum, and anus with the formation of permanent ileostomy and continent ileostomy Cox pouch. Minimally invasive surgery (MIS) involves a laparoscopy to remove small areas of diseased tissue in the ileum and ileocecal areas. Definition: bluish discoloration of the abdomen and periumbilical areas seen in acute hemorrhagic pancreatitis. 116. Gastrointestinal disorders. Part 11. Diverticulitis. Factor hepaticus. 117. Adult. NCLEX RN Flash Review. Definition: condition in which small pouches or sacs composed of mucous membrane protrude through the muscular wall of the intestine. Causes: results from retention of stool and bacteria in the diverticulum. Risk factors include a low-fiber diet, high intake of processed foods, constipation, and indigestible fibers, seeds, corn, etc. may precipitate the condition, but do not contribute to the development of diverticula. Assessment findings frequently asymptomatic, but symptoms vary based on the degree inflammation present. Fever, left lower quadrant pain, may be accompanied by nausea and vomiting, abdominal distension, and increased pain on palpation. Treatment: nursing interventions, oral antibiotics, antispasmodic medications, liquid or low-residue diet until better. In its severe form, requires the administration of a broad-spectrum antibiotic, bowel rest NPO, hydration with IV fluid, NG tube placement, pain management with opiates. Surgical intervention is required for obstruction, abscess, hemorrhage, or perforation. Definition: tortuous, dilated veins in the submucosa of the lower esophagus, possibly extending into the fundus of the stomach or upward into the esophagus. Bleeding varices are a medical emergency. Causes: portal hypertension, often associated with cirrhosis of the liver. Assessment findings: hematemesis, melena, tarry stools, ascites, jaundice, hepatomegaly, and splenomegaly, dilated abdominal veins, signs of shock. Treatment: nursing interventions, monitor vital signs, elevate the head of bed, monitor lung sound, administer oxygen, maintain NPO status, administer IV fluids and electrolytes as ordered, monitor hemoglobin and hematocrit values and coagulation factors, assist in inserting an NG tube or a balloon tamponade if indicated, endoscopic injection, endoscopic varicose ligation, and shunting procedures. Definition: an unpleasant odor of the breath in individuals with severe liver disease caused by volatile aromatic substances that accumulate in the blood and urine. 118. Gastrointestinal disorders. Part T. Gastroesophageal reflux disease GERD. 119. Adult. NCLEX RN Flash Review. Definition: caused by the backward flow and/or reflux of gastric contents into the esophagus. Amount of damage experienced depends on the amount and composition of gastric contents, as well as the ability of the esophagus to remove the acid fluid. Causes: risk factors include obesity, smoking, excess alcohol intake, consumption of high-fat meals, consumption of caffeine and carbonated beverages, stress. Assessment findings: heartburn, dyspepsia, regurgitation not associated with bleeding or nausea, increased discomfort, pain following meals that may be alleviated with antacids, and pain that radiates to the back and neck. Activities that increase intra-abdominal pressure increase esophageal discomfort. Treatment: nursing interventions. Diet therapy involves avoiding the intake of fatty foods, eating small, frequent meals, chewing gum after and between meals, avoiding wine and other alcoholic beverages, caffeinated drinks, and chocolate. Medication may include histamine 2 receptors antagonists, proton pump inhibitors, and GI stimulants or promotility medications. Surgical interventions involve fundoplication or anti-reflux surgery, endoscopic intervention at lower esophagus and gastroesophageal sphincter, fundoplication, radiofrequency, sclerosing agents. Definition: an inflammation of the liver that can be caused by a group of viruses. There are 5 major types of viral hepatitis, A, B, C, D, E. Types A, B, and C are the most common. Description: formerly known as infectious hepatitis, seen in fall and early winter. Individuals at risk: young children, individuals in institutional settings, healthcare personnel. Transmission: fecal-oral route, person-to-person contact, parenteral, contaminated fruits, vegetables or uncooked, shellfish, contaminated water or milk, poorly washed utensils. Incubation and infectious period: incubation period is 2 to 6 weeks, infectious period is 2 to 3 weeks before, and 1 week after development of jaundice. Testing: presence of HAV antibodies in blood, increased levels of immunoglobulin M IgM in the blood. Complications: fulminant, severe, acute, and often fatal hepatitis. Prevention: strict hand washing. Stool precautions: treatment of municipal water supplies, serological screening of food handlers, hepatitis vaccine, Havrix Vacta. 120. Part E. Hepatitis B, HBV, hiatal hernia. 121. nclex and flash review. Adult. Description: non-seasonal. All age groups are affected. Individuals at risk: IV drug users, clients undergoing long-term hemodialysis, healthcare personnel. Transmission: blood or bloody fluid contact, infected blood products, infected saliva or semen, contaminated needles, sexual contact, parenteral, perinatal, blood, bloody fluid or body fluids contact at birth. Incubation period: 6 to 24 weeks. Testing: presence of hepatitis B antigen antibody systems in the blood, presence of hepatitis B surface antigen HB SAG in the blood. Complications: fulminant hepatitis, chronic liver disease, cirrhosis, primary hepatocellular carcinoma. Prevention: strict hand washing, screening blood donors, testing of all pregnant women, needle precautions, avoiding intimate sexual contact with hepatitis B carriers, hepatitis B vaccine, Engerix B for adults, Recumbivax for children. Description: occurs year-round, occurs in any age group, is the major cause of post-transfusion hepatitis. Individuals at risk: IV drug users, clients receiving frequent blood transfusions. Transmission: same as HBV, primarily through blood. Incubation period: 5 to 10 weeks. Testing: presence of anti-HBC in the blood. Complications: chronic liver disease, cirrhosis, primary hepatocellular carcinoma. Prevention: strict hand washing, screening of blood donors, needle precautions. Definition: protrusion of a portion of the stomach through the diaphragm and into the thorax, also known as esophageal or diaphragmatic hernia. Causes: congenital weakness, trauma, relaxation of muscles, increased intra-abdominal pressure. Assessment findings: heartburn, dyspepsia, feeling of fullness, regurgitating or vomiting. Treatment: nursing interventions, medical and surgical management are similar to those for GERD. Avoid anticholinergics, which delay stomach emptying. Eat small, frequent meals, and limit the amount of liquids taken with meals. Advise client not to recline for 1 hour after eating. Special considerations: complications include ulceration, hemorrhage, regurgitation and aspiration of stomach content, strangulation, and incarceration of the stomach in the chest, with possible necrosis, peritonitis, and mediastinitis. Part 11. Jaundice. 123. Adult. nclex and flash review. Definition: a yellow color of the skin, mucous membranes or eyes. The yellow coloring comes from bilirubin, a byproduct of old red blood cells. Occurs when too many red blood cells are dying or breaking down and going to the liver is overloaded or damaged, or the bilirubin from the liver is unable to move through the digestive tract properly. Commonly a sign of liver, gallbladder, or pancreas problems. Infections, use of certain medications, cancer, blood disorders, gallstones, birth defects, and a number of other medical conditions can lead to this condition. Definition: indicates inflammation of the gallbladder. The client is asked to inhale while the examiner's fingers are positioned under the liver border at the bottom of the rib cage. The inspiration causes the gallbladder to descend onto the fingers, producing pain. Deep inspiration is limited. Definition: an inflammatory condition of the pancreas. The acute form is characterized by an inflammatory process. Problems range from mild edema to severe hypotension and severe hemorrhagic necrosis. In contrast, the chronic form is characterized by progressive destruction and fibrosis of the pancreas. Causes, risk factors include trauma, certain medications, thiazide diuretics, NSAIDs, estrogen, steroids, salicylate, hyperlipidemia, biliary tract disease, causing reflux of bile secretions, alcohol intake, precipitating an increase in the secretion of pancreatic enzymes. Assessment findings: general severe constant mid-gastric pain that radiates to the back or flank area and is exacerbated by eating, acute, persistent vomiting, low-grade fever, hypotension and tachycardia, jaundice, abdominal distension, Cullen's sign, Gray-Turner's sign, chronic, decrease in weight, mild jaundice, steatorrhea, abdominal distension and tenderness, hyperglycemia. Treatment, nursing interventions, administration of antibiotics and analgesics. Interventions are directed at decreasing pancreatic stimulus, NPO status, administration of IV fluids, nasogastric suction, bed rest, low-fat, high-carbohydrate diet, if not NPO. Surgical intervention may be required to eliminate precipitating cause biliary obstruction. 124. Gastrointestinal disorders. Part E, peptic ulcer disease, PUD, peristalsis. 125. Adult, nclex N-flash review. Definition: an erosion of the GI mucosa by hydrochloric acid and pepsin. Any location in the GI tract that comes in contact with gastric secretions is susceptible. There are 3 types: duodenal, most common, gastric, and physiologic stress ulcers. Causes, predisposing factors include stress, smoking, the use of alcohol, NSAIDs, corticosteroids, history of gastritis, infection with H. pylori. Family history of gastric ulcers. Assessment findings: burning pain lasting minutes to hours. The pain associated with ulcers can overlap and can be confusing. Gastric type: pain is high in the epigastric area, occurs 1 to 2 hours after eating. Duodenal type: pain is in the mid-gastric area just below the xiphoid process or in the back, occurs 2 to 4 hours after eating, and is relieved by antacids or eating. Treatment, nursing interventions, dependent on client presentation and presence of complications: hemorrhage, perforation, gastric outlet obstruction. General medications: metronidazole, Flagyl, omeprazole, omeprazole, Prilosec, clarithromycin, amoxicillin, and tetracycline, all used to eliminate H. pylori bacteria. Additional medications: antacids, histamine 2 receptor, H2R antagonists, prostaglandin analogs, and proton pump inhibitors, PPIs. Special considerations: often results in an emergency situation. May initially be treated conservatively. However, surgery may be required. Hot, spicy, or rough foods are not factors associated with PUD. Definition: wave-like rhythmic contractions that propel material through the gastrointestinal tract. Definition: an increase in the pressure within the portal vein, the vein that carries blood from the digestive organs to the liver. Causes: the increase in pressure is caused by a blockage in the blood flow through the liver. Increased pressure in the portal vein causes large veins, varices, to develop across the esophagus and stomach to bypass the blockage. The varices become fragile and can bleed easily. Results from cirrhosis or scarring of the liver. Assessment findings: gastrointestinal bleeding, black, tarry stools or bloody stools, or vomiting of blood due to the spontaneous rupture and hemorrhage from varices, ascites, encephalopathy, and reduced levels of platelets or decreased white blood cell count. 126. Turner's sign ulcerative colitis. 127. nclex N-flash review, adult. Definition: a gray-blue discoloration of the flanks seen in acute hemorrhagic pancreatitis. Definition: an inflammatory bowel disease, IBD, that causes chronic inflammation of the digestive tract, characterized by abdominal pain and diarrhea. Usually affects only the innermost lining of the large intestine, colon, and rectum. Causes: can occur at any age, but often affects people in their 30s. Some people may not develop the disease until their 50s or 60s. Caucasians have the highest risk of the disease. Family history, altered immune response are also implicated. Assessment findings: rectal bleeding, diarrhea, increased stools 10 to 20 per day during an acute exacerbation, fever, malaise, anorexia, tenesmus. Treatment: nursing interventions, increased calories, protein, and fluid. Encourage several small meals each day. Administration of aminosalicylates and corticosteroids to decrease inflammation as ordered. Surgical intervention may be necessary if client fails to respond to medical management and if fistulas, perforation, bleeding, or internal obstruction occur. Total removal of colon, rectum, and anus with the formation of permanent ileostomy or continent ileostomy, Cox pouch. Laparoscopy can be performed to remove small areas of diseased tissue in the ileum and ileocecal areas. 128. Hematological disorders. Part 2, acute transfusion reactions. Anemia. 129. nclex N-flash review. Adult. Reaction acute hemolytic febrile non-hemolytic, most common mild allergic anaphylactic, and severe allergic circulatory overload sepsis. Clinical manifestation chills, fever, lower back pain, tachycardia, dyspnea, tachypnea, hypotension, vascular collapse, acute jaundice, bleeding, shock, cardiac arrest, death, sudden chill and fever, headache, flushing, anxiety, vomiting, muscle pain, flushing, itching, hives, anxiety, urticaria, dyspnea, wheezing progressing to cyanosis, bronchospasms, hypotension, shock, possible cardiac arrest, cough, dyspnea, pulmonary congestion, headache, hypertension, tachycardia, distended neck veins, rapid onset of chills, high fever, vomiting, diarrhea, hypotension, shock. Definition: a condition that occurs in which either quality or quantity of blood decreases. Deficiency may be a decrease in erythrocytes or a lower than normal level of hemoglobin. Causes: acute or chronic blood loss, destruction of red blood cells, abnormal bone marrow function, drugs, chemicals, chemotherapy, decreased erythropoietin due to renal damage, subtherapeutic maturation of red blood cells. Assessment findings: weakness and fatigue, lethargy, dyspnea, tachycardia, tachypnea, pallor, cold extremities, vertigo, irritability, depression, poor healing, vertigo. Treatment: nursing interventions, provide a diet high in protein, iron, and vitamins, maintain adequate fluid intake, provide bed rest as necessary, protect from injury, avoid extremes of cold or heat, provide mouth care with diluted mouthwash and soft toothbrush, provide emotional support for long-term therapy. 130. Hematological disorders. Part 2, anemia aplastic. Adult. nclex N-flash review. Definition: a deficiency of marrow stem cells as a result of bone marrow suppression. Pancytopenia. Deficiency of all types of blood cells including white blood cells, red blood cells, and platelets often accompanies red blood cell RBC deficiency. Causes: exposure to radiation and chemotherapy, chemicals DDT, benzene, medications dilantin, chloromycetin, sulfonamides, alkylating agents, anticonvulsants, mesenteric viral infection, pregnancy, diseases that suppress bone marrow activity, leukemia, and metastatic cancer. Assessment findings: fatigue, shortness of breath with exertion, rapid or irregular heart rate, pale skin, frequent or prolonged infections, unexplained or easy bruising, nosebleeds and bleeding gums, prolonged bleeding from cuts, skin rash, dizziness, headache. Treatment: nursing interventions, transfusion of RBCs and or platelets, stem cell transplant, administration of androgens and or corticosteroids, and antibiotics as ordered. Protect from infection, place client in private room, and prevent fatigue. Definition: the most common type of anemia, slowly progressive, related to an iron deficiency. Frequently occurs in infants, adolescents, pregnant females, alcoholics, and the elderly. Causes: chronic blood loss, inadequate nutritional intake, defective absorption, improper utilization of iron, prolonged drug therapy, improper cooking of foods. Assessment findings: chylosis, exertional dyspnea, glossitis, papillae, atrophy of tongue. Check for pica syndrome, concave, brittle nails, fatigue, and lack of energy. Treatment: nursing interventions, provide foods high in iron, administer iron preparations as prescribed, oral ferrous sulfate, provide liquid iron with the straw stains teeth. Iron oral supplements should be taken on an empty stomach. Give iron with orange juice or vitamin C. As this aids in absorption, watch for and educate client about the side effects of iron: constipation, nausea, and diarrhea, abdominal cramps, epigastric distress, Alert clients that stool will be black. Parenteral. Administer Imferon, IV, IM, Sorbatex IM, using the Z-Track method of administration. Monitor fluid and electrolyte balance. Provide frequent rest periods for intense fatigue. 132. Hematological disorders. Part G. Anemia megaloblastic. Blood products I. 133. Adult. nclex RN flash review. Definition: type of anemia involving morphologic changes that are caused by defective DNA synthesis and abnormal RBC maturation. Causes: primary cause is deficiency of vitamin B12 or folic acid, absence of intrinsic factor, surgical resection of the stomach, alcohol abuse and anorexia infections, atrophy of the gastric mucosa, malabsorption syndrome, disease, bacterial or parasitic infections. Medications: methotrexate, oral contraceptives, and anticonvulsants. Assessment findings: yellow cast to the skin, pallor, tingling of the extremities which does not occur with folic acid deficiency, peripheral neuropathy, weakness, fatigue, anorexia, personality and behavioral changes, beefy red tongue glossitis, alterations in gait, loss of balance. Treatment: nursing interventions, serum blood work for RBC count and megaloblastic maturation. Administer B12 deep IM, usually once a month. Change amount of dietary intake and oral folic acid. If anemia is caused by folic acid deficiency due to chronic alcoholism, provide safety measures if neurological alterations are observed. Prepare client for possible bone marrow aspiration, upper GI series, gastric analysis, Schilling test, and/or gastric analysis. Product packed RBCS frozen RBCS platelets description prepared from whole blood by sedimentation or centrifugation. 1 unit contains 250 to 300 ml. Prepared from RBCS using glycerol for protection and freezing. They can be stored for 10 years at 188.6 degrees Fahrenheit. Prepared from fresh whole blood within 4 hours after collection. Indications for usage: anemia, acute blood loss, autotransfusion, stockpiling or rare donors for clients with alloantibodies, not often used because filters remove most white blood cells, WBC as. Bleeding caused by thrombocytopenia may be contraindicated in immune thrombocytopenia purpura, thrombotic thrombocytopenic purpura, and heparin-induced thrombocytopenia, except in life-threatening situations. 134. Hematological disorders. Part E. Blood products second in TRM-USCular medication administration, ZTRAC method. 135. nclex RN flash review. Adult. Product: fresh frozen plasma albumin cryoprecipitate and commercial concentrations. Description: liquid portion of blood is separated from cells and frozen. Plasma is rich in clotting factors but contains no platelets. It can be stored for 1 year and must be used 2 hours after thawing. Prepared from plasma. It can be stored for 5 years. Prepared from fresh plasma with 10 to 20 ml bag. It can be stored for 1 year and once thawed must be used immediately. Indications for usage: bleeding caused by deficiency in clotting factors, hypovolemic shock, hypoalbuminemia, replacement of clotting factors, especially factor V8, von Willebrand disease, and fibrinogen. 1. Draw up the medication in the syringe using aseptic technique. 2. Add 0.25 ml of air to the syringe. 3. Discard the needle used to draw up the medication. 4. Place a new 22-gauge 2 to 3 inches long needle on the syringe. 5. Select the dorsal gluteal site for the injection. 6. Once the site is selected, pull the skin and subcutaneous tissue sideways away from the muscle. 7. Cleanse the site while holding the skin and subcutaneous tissue off to the side. 8. Insert the needle deeply into the muscle tissue. 9. Aspirate to determine needle placement. 10. If blood is aspirated, withdraw the needle and begin the procedure again from the beginning. 11. If no blood is aspirated, inject the medication slowly, followed by the injection of the air bubble. 12. Quickly withdraw the needle. 13. Release the skin and subcutaneous tissue. Do not massage injection site. 136. Hematological disorders. Part VN. Leukemia. Polycythemia. 137. Adult. nclex RN Flash Review. Definition: malignant disorder of blood-forming tissue, including bone marrow and lymphatic system, characterized by neoplastic proliferation of hematopoietic cells or their precursors. Classification is based on its speed of progression and the type of cells involved. In acute type, abnormal blood cells are immature blood cells, blasts. Chronic type involves more mature blood cells, which produce no symptoms and can go undiagnosed for years. Causes thought to be a combination of genetic and environmental factors. Predisposing factors include excess radiation exposure, viral factors, bone marrow alterations, immune alterations, noxious chemicals and drugs. Assessment findings: fever or chills, persistent fatigue, weakness, frequent infections, unexplained weight loss, swollen lymph nodes, enlarged liver or spleen, easy bleeding or bruising, petechiae, excessive sweating, especially at night, bone pain or tenderness. Treatment: nursing interventions, chemotherapy, preventing complications of medications, maintaining fluid and electrolyte balance, providing high-calorie and high-protein diet, providing emotional support and client education, and preventing infection, hemorrhage, and ulceration. Special considerations: major types: acute lymphocytic leukemia, all, mostly in young children. Acute myelogenous leukemia, AML, occurs in children and adults. Chronic lymphocytic leukemia, CLL, most common adult leukemia, very rare in children, and chronic myelogenous leukemia, CML, mainly affects adults. Definition: a condition that results in an increased level of circulating red blood cells in the bloodstream. This disorder also causes an increase in hematocrit, HCT, hemoglobin, HGB, or red blood cell counts. Normally discussed in terms of increased hematocrit or hemoglobin. HCT, disorder considered when the hematocrit is greater than 48% in women and 52% in men. HGB, disorder considered when the hemoglobin level is greater than 16.5 grams DL in women and greater than 18.5 grams DL in men, can be divided into two categories: primary and secondary. In primary form, the increase in red blood cells is due to inherent problems in the process of red blood cell production. In secondary form, the increase generally occurs as a response to other factors or underlying conditions that promote red blood cell production. 138. Hematological disorders, Part VN, thrombocytopenia. 139. Adult, nclex RN Flash Review. Definition: any disorder in which there is an abnormally low number of platelets. Often divided into three major causes of low platelets: low production of platelets in the bone marrow, increased breakdown of platelets in the bloodstream, and increased breakdown of platelets in the spleen or liver. Disorders that involve low production in the bone marrow include aplastic anemia, cancer in the bone marrow, cirrhosis, folate deficiency, and vitamin B12 deficiency. The use of certain medications and chemotherapy treatments may also lead to a low production of platelets in the bone marrow. 140. Integumentary disorders. Party, BURNS, causes of BURNS chemical, MERGNC, MNAG-MNT. BURNS electrical, MERGNC, MNAG-MNT. 141. nclex RN Flash Review. Adult. Type: thermal electrical chemical radiation, light inhalation, source: excessive heat from fire, flames, hot liquids, hot objects, steam lightning, electrical current, acids, bases, caustics, ultraviolet light, nuclear radiation, sunlight, ultraviolet light, inhalation of air or noxious chemicals. Two types: smoke inhalation, inhalation of carbon dioxide. Causes: alkalis, acids, organic compounds. Assessment findings: burning, localized pain, redness, swelling of injured tissue, paralysis, degeneration of exposed tissue, discoloration of injured skin, edema of surrounding tissues, respiratory distress if chemical inhaled. Nursing interventions: initial secure patent airway, cervical spine stabilization, anticipate intubation with significant inhalation injury, circumferential full thickness burns of the neck, chest, and or large total body surface area, TBSA burn. Assess airway, breathing, and circulation before decontamination procedures. Brush dry chemical from skin before irrigation. Flush chemical. Remove non-adherent clothing, shoes, watches, jewelry, glasses, or contact lenses when face is exposed. Initiate fluid replacement. Insert urinary catheter. Elevate burned limbs. Administer IV pain medications as ordered. Cover burned areas with dry dressings or clean sheet. Ongoing care, monitor airway, monitor urinary output. Causes, electric and utility wires, lightning, defibrillator. Assessment findings, lethargy, white or charred skin, burn odor, impaired touch or sensation, minimal pain or sensation, dysrhythmias. Location of contact points, decreased peripheral circulation if extremities injured, thermal burns if clothes ignite, fractures or dislocations from current or force, head or neck injury if associated with fall, depth and extent of wound difficult to visualize. Always assume injury is greater than what is observed. Nursing interventions, initial secure patient airway, cervical spine stabilization, assess and monitor vital signs, level of consciousness, oxygen saturation, and cardiac rhythm, assess airway, breathing, and circulation, remove non-adherent clothing, shoes, watches, jewelry, glasses, or contact lenses when face is exposed, initiate fluid replacement, insert urinary catheter, elevate burned limbs above heart to decrease edema, administer IV pain medications, treat associated injuries, cover burned areas with dry dressing or clean sheet. Ongoing care, monitor airway, urinary output, urine for the development of myoglobinuria, vital signs, level of consciousness, oxygen saturation, and cardiac rhythm. Anticipate the administration of mannitol and NOCCO3 and hemoglobinuria. 142. Integumentary disorders. Party. BURNS, thermal, MERGNC, M-monogamin T. 143. nclex RN flash review. Adult. Causes, hot liquids or solids, flash flame, open flame, steam, hot surface, ultraviolet rays. Assessment findings, partial thickness superficial, redness, pain, moderate to severe tenderness, blanching with pressure. Partial thickness deep, moist blebs, blisters, mottled white, pink, cherry red, hypersensitive to touch or air, moderate to severe pain, blanching with pressure. Full thickness, dry, leathery eschar, white waxy, dark brown, or charred appearance. Burn odor strong, impaired sensation when touched. Absence of pain with severe pain in surrounding tissues. Lack of blanching with pressure. Nursing interventions, initial secure patent airway, cervical spine stabilization. Assess for inhalation injury. Assess and monitor vital signs, level of consciousness, oxygen saturation, and cardiac rhythm. Assess airway, breathing, and circulation. Remove non-adherent clothing, shoes, watches, jewelry, glasses, or contact lenses when face is exposed. Initiate fluid replacement. Insert urinary catheter. Elevate burned limb. Administer IV pain medications. Treat associated injuries. Cover burned areas with dry dressing or clean sheet. Ongoing care. Monitor airway, urinary output, vital signs, level of consciousness, oxygen saturation, and cardiac rhythm. Depth, superficial thickness, burn. Superficial partial thickness. Burn deep partial thickness. Burn description limited to the epidermis. Skin blanches with pressure. Painful. Skin appears red. Requires local wound care. No scarring occurs. Heals in 3 to 6 days. Example, sunburn. Injury into the dermis, large blisters, edema, mottled pink to red base, and broken epidermis with a wet, shiny, and weeping surface. Painful and sensitive to cold air. Heals in 10 to 21 days with no scarring. Grafts may be used if the healing process is prolonged. Expands deeper into the skin dermis. Blister formation usually does not occur because the dead tissue layer is thick and sticks to underlying viable dermis. Wound surface is red and dry with white areas in deeper parts. May or may not blanch. Moderate edema. Heals in 3 to 6 weeks. Scar formation occurs. 144. Integumentary disorders. Party. Burn depth second fluid resuscitation fo RMOLAS. First 24 ho URs fo allowing a burn in Jurai. 145. nclex RN flash review. Adult. Depth full thickness burn, deep full thickness burn, description injury and destruction of the epidermis and the dermis. The wound will not heal by reepithelialization, and grafting may be necessary. Skin appears as dry, hard, leathery eschar, which is waxy white, deep red, yellow, brown, or black in color. Sensation is reduced or absent due to nerve-ending destruction. Healing may take weeks to months and depends on establishing adequate blood supply. Burn requires eschar removal and grafting. If not prevented, scarring and wound contractures may develop. Injury extends beyond the skin into underlying fascia and tissues, and muscle, bone, and tendons are damaged. Injured areas appear black and sensation is completely absent. Eschar is hard and inelastic. Healing takes months and grafts are required. Rate of formula solution administration: modified brookine or 5% albumin in a half given in the first 0.5 ml to 15 ml kg Zri. Isotonic saline 8 hours, TBSA, burn and lactated ringers L-Aramin half given in the next without dextrose 16 hours, Parkland, Baxter, and crystalloid only, LRN, half given in the first 4 ml kg, TBSA, burn 8 hours, half given in the next 16 hours, modified Parkland and crystalloid only, LRN half given in the first 4 ml kg, TBSA, burn 8 hours, half given in plus 15 ml M2 of TBSA the next 16 hours. TBSA equal to total body surface area. 146. Integumentary disorders. Part E. Herpes zoster shingles. RT zoster Shannon. Adult. Definition: a painful blistering Sousa virus which causes chickenpox. The virus remains inactive, becomes dormant in certain nerves in the body, and becomes active again in the nerves years later. May develop in any age group, but more likely to develop in those who are older than 60, who had chickenpox before age 1, and who have immune systems weakened by medications or disease. If adults or children have direct contact with a shingles rash on someone and have not had chickenpox as a child or a chickenpox vaccine, they can develop chickenpox rather than shingles. The first symptom is usually one-sided pain, tingling, or burning. The pain and burning may be severe and are usually present before any rash appears. Causes: exposure to intense heat or flames, inhalation of carbon monoxide, noxious chemicals, or smoke. Client burned in an enclosed space or clothing catching fire. Assessment findings: shallow, rapid respirations, oxygen saturation, hoarseness, coughing, singed facial or nasal hair, black darkened oral, nasal membranes, smoky breath, carbonaceous sputum, cough with black, gray, or bloody sputum, difficulty swallowing, altered mental status. Nursing interventions: initial secure patent airway, cervical spine stabilization, assess for inhalation injury, assess and monitor vital signs, level of consciousness, oxygen saturation, and cardiac rhythm, assess airway, breathing, and circulation, remove non-adherent clothing, shoes, watches, jewelry, glasses, or contact lenses when face is exposed, initiate fluid replacement, insert urinary catheter, obtain ABG, carboxyhemoglobin levels, and chest X-ray, administer IV pain medications, treat associated injuries, cover burned areas with dry dressing or clean sheet, anticipate need for fiber optic bronchoscopy or intubation. Ongoing care: monitor airway, urinary output, vital signs, level of consciousness, oxygen saturation, and cardiac rhythm. 148. Integumentary disorders. Part E. Par-Essure ulcers, stages of, rule of NNEs. 149. nclex RN flash review. Adult. Stage I, Stage 2, Stage 3, Stage 4 description: intact skin and non-blanching erythema, epidermis interrupted. Dermis may be interrupted, abrasion or blister in full thickness and damage and or necrosis down to the fascia, full thickness and penetrates the fascia, involves muscle, tendon, and or bone. Method to estimate extent of burn injury. 150. Musculoskeletal disorders. Part D. Amputation, crutch walking. 151. Adult. nclex RN flash review. Definition: surgical removal of a diseased part or organ. Causes: peripheral vascular disease, PVD, 80% to 75% of which are diabetic clients, trauma, infection, congenital deformities, malignant tumors. Assessment findings: prior to amputation, assessment findings of PVD include decreased pain, feeling in the affected extremity, cool extremity, leathery skin on affected extremity, absent peripheral pulses, hair loss on affected extremity, necrotic tissue or wounds, area blue or blue-gray turning black, drainage possible with or without odor. Treatment: nursing interventions, provide wound care, monitor surgical dressing for drainage, mark dressing for bleeding, measure suction drainage, change dressing as ordered. Monitor for signs of infection. Elevate residual limb, stump for 24 hours postoperatively. Position client to decrease edema and spasms of the stump. Be aware of phantom pain that is real pain. Provide passive range of motion ROM. Collaborate with rehabilitation team for mobility needs. Handle affected stump gently. Encourage independence and self-care. Non-weight bearing, placing no weight on the injured leg. 1. Instruct the client to place the crutches forward about 1 step's length while pushing down on the hand grips. 2. Instruct the client to squeeze the top of the crutches between the body and the upper arm while holding the injured leg up from the floor. 3. Instruct the client to swing the good leg forward while being careful not to go too far. 4. Instruct the client to now step on the good leg and bring crutches forward to 1 step's length. 1. Instruct the client to face the stairs squarely. 2. Instruct the client to place both crutches close to the first step. 3. Instruct the client to put the uninjured leg on the first step. 4. Instruct the client to push from the strong leg and lift both crutches and the injured leg up to the step. 5. Instruct the client to repeat the sequence for each step. Part E. Musculoskeletal disorders, fractures, complications of eye fractures, complications of second, 153. nclex RN Flash Review. Adult. Definition: a break in the continuity of the bone caused by trauma, twisting as a result of muscle spasm or indirect loss of leverage, or bone decalcification and disease that result in osteopenia. Assessment findings: pain and tenderness over the involved area, loss or decrease in muscular strength or function, muscle spasm, and neurovascular impairment, obvious deformity of affected area, crepitation, erythema, edema, bruising. Treatment: nursing interventions, reduction, fixation, traction, and casting. Emergency initial care involves immobilization of the affected extremity, with casting or splinting, assessment of neurovascular status of the extremity. Complication: pulmonary embolism of vascular necrosis, fat embolism, description caused by the movement of foreign particles, blood clot, fat or air, into the pulmonary circulation. Assessment findings: restlessness, apprehensiveness, dyspnea, chest pain, cough, hemoptysis, hypoxemia, crackles. Occurs when the fracture interrupts blood supply to a section of the bone, resulting in bone death. Assessment findings: decreased sensation and pain. Originates in the bone marrow and occurs after a fracture when a fat globule is released into the bloodstream. Prevalence is higher in clients with a long bone fracture. Can occur 48 to 72 hours following an injury. Assessment findings: restlessness, hypoxemia, mental status changes, tachycardia, hypotension, dyspnea, tachypnea, petechial rash over the upper chest and neck, which may fade quickly. Complication: infection and osteomyelitis compartment syndrome, description. These complications can be caused by the introduction of organisms into the bones, leading to localized bone infection. Assessment findings: tachycardia, fever above 101 degrees Fahrenheit, erythema and pain in the area surrounding the infection, leukocytosis and elevated erythrocyte sedimentation rate, ESR. Tough fascia surrounds muscle groups, forming compartments from which arteries, veins, and nerves enter and exit at opposite ends. Occurs when pressure in one or more compartments is increased and results in decreased blood flow, tissue ischemia, and neurovascular impairment. Assessment findings: unrelieved or increased pain in the affected limb, pulselessness late, paresthesia, pain with passive movement, tissue that is distal to the involved area becomes pale, dusky, or edematous. 154. Musculoskeletal disorders, Part E, fractures, hip, femoral, and neck. 155. nclex RN Flash Review. Adult. Description: intrascapular, femoral head is broken within the joint capsule. Assessment findings: femoral head and neck receive decreased blood supply and heal slowly. History of slight trauma, pain in the groin and hip, commonly occurs in women greater than or equal to 60 years of age. Lateral rotation and shortening of leg with minimal deformity. Treatment: nursing interventions, femoral head replacement with prosthesis, threaded pins, total hip replacement or open reduction with internal fixation, or if with femoral replacement. To prevent hip displacement postoperatively, avoid extreme hip flexion. Possible complications: a vascular necrosis of femoral head, non-union, pin complications, dislocation of prosthesis. Description: extracapsular. Fracture is outside the joint capsule. Assessment findings: fracture can occur at the greater trochanter or can be an intertrochanteric fracture. History of direct trauma over trochanter. Occurs in women usually between the ages of 60 and 85. Can occur in younger women with osteoporosis, external rotation, and shortening of leg with obvious deformity, loss of hip motion. Treatment: nursing interventions, open reduction, internal fixation with nail, pin, compression plate with screw. Preoperative treatment includes balance suspension or skin traction to relieve muscle spasms and reduce pain. Possible complications: shortening of the leg, traumatic arthritis, pin migration, bending or breaking of pin, fracture impaction, loss reduction, delayed union or non-union of bone. 156. Musculoskeletal disorders. Part: fractures, types of. 157. nclex RN flash review. Adult. Type: closed or simple comminuted complete compression. Depressed green stick impacted incomplete oblique open or compounded pathological spiral. Transverse description: skin over area remains intact. Bone is splintered or crushed, creating numerous fragments. Bone is separated completely by a break into two parts. Fractured bone is compressed by other bone. Bone fragments are driven inward. One side of the bone is broken and the other is bent. Occurs most commonly in children. Part of the fractured bone is driven into another bone. Fracture line does not extend through the full transverse width of the bone. Fracture line runs at an angle across the axis of the bone. Bone is exposed to air through a break in the skin. Results from weakening of the bone structure by pathological processes such as neoplasia or osteomalacia, also called spontaneous fracture. Break partially encircles bone. Break is straight across the bone. Definition: condition in which urate crystals and infiltrating leukocytes damage intracellular phagolysosomes, causing leakage of lysomal enzymes into the synovial fluid, which causes tissue damage and joint inflammation. Causes: risk factors include male gender, age greater than or equal to 50 years, genetic, familial tendency, prolonged hyperuricemia, elevated serum uric acid level. Assessment findings: pain described as excruciating fatigue, anorexia. Joints appear with erythema, hot and swollen, difficult to move, skin stretched and shiny over joint, subcutaneous nodules, trophy deposits of urate on hands and feet, weight loss, fever, sensory changes, with cold intolerance. Elevated serum uric acid levels, elevated serum WBC, erythrocyte sedimentation rate greater than or equal to 20 millimeters, HR, proteinuria, azotemia. Treatment: nursing interventions. Administer anti-gout medication as ordered, colchicine, phenylbutazone, butazolidine, indomethacin, indozin, allopurinol, xyloprin, absolute rest of affected joint, then gradual increase in activities, prevent kidney damage, increase fluid intake to 2,000 to 3,000 ml, day unless contraindicated, monitor urinary output, instruct the client on the importance of a low purine diet during acute attacks, instruct on dosage and side effects of medications. 158. Musculoskeletal disorders. Part 2, osteomyelitis. 159. Adult. nclex RN flash review. Definition: an infection of the bone, bone marrow, and surrounding soft tissue. Causative organism is commonly Staphylococcus aureus. Initially, an inflammatory response occurs with increased vascularization and edema. Even though the healing process occurs, the dead bone tissue frequently forms a sequestrum, which continues to retain bacteria. This tissue may produce recurrent abscesses for years. Classified as acute sudden onset, may heal in 2 to 3 weeks, or subsequently progress to the chronic form, or chronic a continuous persistent problem or exacerbation of previous problem. Causes: indirect entry of organism, hematogenous, direct injury trauma, surgical procedures, which can occur at any age. Assessment findings: acute tenderness, swelling, and warmth, constant pain in the affected area, drainage from infected site, fever, chills, nausea, night sweats, circulatory impairment. Chronic lasts longer than a month, failed to respond to initial course of antibiotic therapy, drainage from sinus tract or wound, recurrent episodes of bone pain, low-grade fever, local signs of infection. Treatment: nursing interventions, IV or oral antibiotic for 6 to 8 weeks, immobilization of affected area, surgical debridement if indicated, hyperbaric oxygen therapy to stimulate circulation and healing. Definition: decrease in the amount of bone capable of maintaining structural integrity of the skeleton. Loss of bone mass associated with aging increases fragility and risk of fractures. Causes: bone remodeling results in increased bone mass until age 35. Thereafter, bone mass decreases, lack of vitamin D, calcium deficiency, low estrogen levels after menopause, excessive intake of corticosteroids, malabsorption, lactose intolerance, alcohol abuse, renal failure. Assessment findings: back pain radiating to the trunk, skeletal deformities, pathological fractures. Monitor serum calcium, phosphorus, and alkaline phosphatase levels usually normal. Parathyroid hormones may be elevated. Treatment: nursing interventions, provide pain control, prevent fractures, administer medications as ordered, estrogen replacement, calcium, calcitonin, fluoride, alendronate, Fosamax, vitamin D. Instruct the client about the importance of a regular exercise program that includes ROM and weight-bearing exercises and ambulation several times per day. Provide a diet high in protein, calcium, and vitamin D, and express the need to avoid alcohol and coffee. 160. Musculoskeletal disorders, Part 11, reduction, types of rheumatoid arthritis. 161. nclex N-flash review, adult, type close description, annual realignment of bone fragments to previous anatomic position. Traction and countertraction are manually applied to bone fragments to restore position, length, and alignment. When completed while client is under local or general anesthesia. Open and after reduction, traction, casting, external fixation, splints or orthoses, braces, immobilize injured part to maintain alignment until healing occurs. Erection of bone alignment through surgical incision. Normally includes internal fixation of the fracture with wires, screws, pins, plates, intramedullary rods, or nails. Traction if open reduction with internal fixation or if is utilized for intra-articular fractures involving joint surfaces. Early initiation of ROM is necessary. Application of a pulling force to an injured or diseased part of the body or an extremity while counter-traction pulls in the opposite direction. In two most common types are skin and skeletal traction. One of the most common types of traction is Buck's traction. Definition: chronic, systemic, progressive deterioration of connective tissue, synovium of the joints, characterized by inflammation. Joint involvement is bilateral and symmetrical. In the joint, the normal cartilage becomes soft, fissures and pitting occur, and the cartilage thins. Spurs form and inflammation sets in. Severe cases may require joint replacement. Causes: classified as an immune complex disorder. Assessment findings: fatigue, generalized weakness, anorexia, morning stiffness, joint deformity. Bilateral inflammation of joints with the following symptoms: decreased ROM, joint pain, warmth, edema, erythema. Treatment: nursing interventions, corticosteroids, splinting, rest for joint deformity, immobilization, NSAIDs. Utilize moist heat, warm, moist compress, whirlpool baths, hot showers in the morning, provide periods of rest, emphasize proper joint position, encourage assistive devices, elevated toilet seat, shower chair, walker, cane, wheelchair. 162. Musculoskeletal disorders, Part E, traction, G and aerial nursing care, traction skin. 163. nclex N-flash review, adult. 1. Ensure that all the ropes, weights, and pulleys are hanging freely. 2. Keep all lines off the traction ropes. 3. Do not lift the weights for any reason. 4. Avoid jarring the bed or equipment. 5. Complete frequent neurochecks. 6. Complete frequent circulatory checks including color, temperature, pulses, and capillary refill. 7. Perform periodic skin assessments. 8. Keep the body in proper alignment. 9. Monitor for infection, fever, localized warmth, redness, swelling odor, or increased pain. 10. Do not massage the calves. 11. Increase fluid and fiber intake unless contraindicated. 12. Instruct the client to cough and deep breathe. 13. Encourage the client to utilize an overhead trapeze bar. 14. Provide diversionary activities. Definition: a form of traction that is applied mechanically to the bone with pins, wires, or tongs. In place for longer periods than skin traction, this method is used to align injured bones and joints or to treat joint contractures and congenital hip dysplasia. The long-term pull keeps the injured bones and joints aligned. The physician inserts a pin or wire into the bone, either partially or completely, to align and immobilize the injured body part. The amount of weight applied ranges from 5 to 45 pounds. Nursing care: monitor color, motion, and sensation of the affected extremity. Monitor the insertion sites for redness, swelling, drainage, or increased pain, and provide insertion site care as ordered. Definition: a form of traction used for short-term treatment, 48 to 72 hours until skeletal traction or surgery is possible. Tape, boots, or splints are applied directly to the skin to maintain alignment, assist in reduction, and help decrease muscle spasms in the injured extremity. The traction weights are usually limited to 5 to 10 pounds. Cervical or pelvic skin traction may require heavier weights applied intermittently. The client should be positioned with the head of the bed elevated 30 to 40 degrees, and weights are attached to a pulley system over the head of the bed. 164. Musculoskeletal disorders. Part: traction types of 165. nclex RN flash review. Type: bucks extension traction description, and used to alleviate muscle spasms and immobilize a lower limb by maintaining a straight pull on the limb with the use of weights. A boot device appliance attaches the traction. Russell's sling traction and weights, limit 10 pounds, are attached to a pulley and hang freely over the edge of bed. Elevation of the foot of bed is required. A skin traction composed of bucks extension on the foreleg, 3 pulleys at the bottom, and a sling under the knee. Pelvic skin traction affords more freedom of movement than bucks, and utilized to relieve lower back, hip, or leg pain or to reduce muscle spasms. Balanced suspension traction and traction attraction belt is applied snugly over the pelvis and iliac crest, and then the weights are attached. When utilized with skin or skeletal traction to approximate fractures of the femur, tibia, or fibula, when none of force other than the client is employed. When client should be positioned in a low Fowler's position on either the side or the back with a 20-degree angle from the thigh to the bed. Dunlop's traction and protection of the skin from breakdown is imperative. When horizontal traction is used to align fractures of the humerus, vertical traction maintains the forearm in proper alignment. But nursing care is the same as for bucks traction. 166. Neurological disorders. Part 2nd, 167. nclex RN flash review. Adult. Definition: a neuropsychological disorder characterized by the inability to recognize common objects, persons, or sounds in the absence of perceptual disability. There are 3 major types of agnosia: visual agnosia, auditory agnosia, and tactile agnosia. Causes: lesions to the parietal and temporal lobes of the brain, regions involved in storing memories and associations of objects. The condition may arise following head trauma or stroke, or following carbon monoxide poisoning or anoxia. Definition: loss of the ability to read. Definition: inability to perform purposeful movements in the absence of motor problems. 168. Neurological disorders. Part 2nd, autonomic dysreflexia. Bell's palsy. 169. nclex RN flash review. Adult. Definition: syndrome characterized by paroxysmal hypertension, bradycardia, excessive sweating, facial flushing, nasal congestion, pilomotor responses, and headache. Also known as hyperreflexia. The syndrome occurs with spiral lesions above T6 after the period of spinal shock is complete. Causes: triggers include visceral stimulation from a distended bladder or impacted rectum. The syndrome is a neurological emergency and must be treated immediately to prevent the development of a hypertensive stroke. Treatment: nursing interventions. Priority interventions include raising the head of the bed, loosening tight clothing, checking for bladder distension, kinked urinary catheter, fecal impaction, or other noxious stimulus, and administer antihypertensive medications as ordered. Definition: dorsiflexion of the big toe with extension, elicited by firmly stroking the lateral aspect of the sole of the foot. Definition: caused by a lower motor neuron lesion of the 7th cranial nerve. This nerve controls facial muscles on one side of the face, which becomes swollen. As a result, the face feels stiff and half of the face appears to droop, smile is one-sided, and the client's eye resists closing. Causes: infection, trauma, tumor, meningitis, hemorrhage. Assessment findings: loss of taste, flaccid facial muscles, inability to raise eyebrow, frown, smile, close eyelids or puff cheeks, upward movement of eyes when attempting to close the eyelids. Treatment: nursing interventions, apply facial sling to prevent stretching of weak muscles if ordered, encourage facial exercises to prevent loss of muscle tone, promote frequent mouth care, instruct client to chew on unaffected side, protect the eyes from dryness, and prevent injury. Special considerations: recovery usually occurs in a few weeks without residual effects. Neurological disorders. Part D, Brudzinski reflex. Cerebral perfusion par CPP, calculation of 171. Adult, nclex N flash review. Definition: a sign of meningeal irritation, involuntary flexion of the hip and knee when the neck is passively flexed. Definition: test is performed at bedside by introducing cold water into the external auditory canal. If the 8th cranial nerve is stimulated, nystagmus rotates toward the irrigated ear. If no nystagmus occurs, a pathological condition is present. Definition: difference between the mean arterial pressure MAP and the intracranial pressure ICP. This represents the pressure gradient driving cerebral blood flow CBF, and hence oxygen and metabolite delivery. The normal brain autoregulates its blood flow to provide a constant flow regardless of blood pressure by altering the resistance of cerebral blood vessels. These homeostatic mechanisms are often lost after head trauma. Cerebral vascular resistance is usually increased, and the brain becomes susceptible to changes in blood pressure. Those areas of the brain that are ischemic or at risk of ischemia are critically dependent on adequate cerebral blood flow and therefore cerebral perfusion pressure. Usual range is 60 to 100 mmHg. 172. Neurological disorders. Part E, cerebral spinal fluid, recognition testing 4 cranial nerves. 173. Adult, nclex N flash review. 2 ways to verify that cerebral spinal fluid CSF is leaking. 1. Test leaking fluid with a dextro stick. If it is positive for sugar, then it is CSF. Note: if blood is present in fluid, then this is an unreliable way to check for CSF since blood has sugar. 2. Halo or ring sign. Allow leaking fluid to drip onto a 4x4 gauze. Within a few minutes, blood will run into the center. A yellowish ring will encircle the blood if CSF is present. Number ID 3V5V678961120. Name: olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, acoustic, glossopharyngeal, vagus, spinal, accessory, hypoglossal function, smell, vision, upper eyelid elevation, papillary constriction, extraocular movement, downward and inward eye movement, corneal reflex, face and scalp sensation, chewing, lateral eye movement, taste, expression in forehead, eye movement, hearing and balance, taste, swallowing, salivation, gag reflex, swallowing, talking, sensation of the throat and larynx, head rotation, shoulder shrug, tongue movement. Definition: surgical procedure that involves an incision through the cranium to remove an accumulation of blood or tumor. Complications: increased ICP from cerebral edema, hemorrhage, or obstruction of the normal blood flow. Other complications that may develop are hematomas, hypovolemic shock, hydrocephalus, respiratory and neurogenic complications, pulmonary edema, and wound infections. Specific concerns related to fluid and electrolyte imbalances include the development of diabetes insipidus and inappropriate secretion of antidiuretic hormone. Treatment, preparation: assure that preoperative measures include a full explanation to the client and family that informed consent has been obtained prior to the procedure and that the client is prepared to have his or her head shaved as ordered, usually completed in the operating room. Craniotomy preoperative medications may include corticosteroids to reduce swelling, agents and osmotic diuretics to reduce secretions, such as atropine, or glycopyrrolate robenul, agents to reduce seizures, such as phenytoin, dilantin, and prophylactic antibiotics. 174. Neurological disorders. Part E. Craniotomy, postoperative care. 175. nclex RN flash review. Adult. Positioning after the procedure will differ related to the type of surgery area involved. Monitor vital signs every 30 to 60 minutes. Assure proper postoperative positioning per physician's order. Observe for signs and symptoms of increased ICP. Monitor and intervene appropriately if there is a decrease in the client's level of consciousness, visual changes, aphasia, paralysis, or motor weakness. Maintain mechanical ventilation as ordered. Maintain the head of the client in a midline neutral position while avoiding extreme hip or neck flexion. Monitor head dressing as ordered and mark drainage. Notify physician if dressing becomes saturated with blood. Monitor and measure output from drains. Notify physician if more than 30 to 50 ml per shift. Maintain strict intake and outputs I and O. Maintain fluid restriction of 1,500 ml day or as ordered. Monitor serum electrolyte levels. Apply ice packs or cool compresses as ordered and anti-embolism stockings as ordered. Administer anticonvulsants, antacids, corticosteroids, and antibiotics as ordered, as well as analgesics as ordered for pain. Decorticate flexor posturing. Flexure of arms and legs may affect one or both sides, indicates damaged cortex. Decerebrate extensor posturing. Stiff extension arms and legs may affect one or both sides, indicates a brainstem lesion. Definition: difficulty articulating. 170. 6. Neurological disorders. Part 11. Dysphagia. 177. Adult. nclex RN flash review. Definition: dysfunctional swallowing. Definition: impairment of speech and verbal comprehension. Definition: no motor response display in any extremity. 178. Neurological disorders. Part 11. Glasgow Coma Scale. Guillain-Barré syndrome. 179. nclex RN flash review. Adult. Variable response. Eye-opening and spontaneously and to verbal command, to pain and no response even to painful stimuli and no resent, to verbal command and to painful stimuli, localizes pain and flexes, withdraws and flexor, posturing date, extensor posturing, decerebrate, a no motor response to pain-oriented, and converses and disoriented, converses and uses inappropriate words, incomprehensible sounds, to no verbal response score, 43216 motor, response 54321 verbal, response 54321. Highest possible score is 15 points. A score lower than 8 indicates coma. Definition: clinical syndrome of unknown origin involving peripheral and cranial nerves. Causes: usually preceded by a respiratory infection 1 to 4 weeks prior to the onset. A small percentage of clients diagnosed with this syndrome are left with residual disability. Assessment findings: paresthesia, muscle weakness of legs progressing to the upper extremities, trunk and face, paralysis of the ocular, facial, and oropharyngeal muscles, causing marked difficulty in talking, chewing, and swallowing. Assess for breathlessness, shallow and irregular breathing, use of accessory muscles while breathing, any change in respiratory pattern, and paradoxic inward movement of the upper abdominal wall while in a supine position, indicating weakness and impending paralysis of the diaphragm. Increasing pulse rate and disturbances in rhythm, transient hypertension, orthostatic hypotension, possible pain in the back and in calves of legs, weakness or paralysis of the intercostal and diaphragm muscles may develop quickly. Treatment: nursing interventions. Monitor for respiratory distress and initiate intubation and mechanical ventilation as indicated. Treatment is based on client presentation. Special considerations: constant monitoring of these clients is required to prevent life-threatening acute respiratory failure. Full recovery usually occurs within several months to a year after onset of symptoms. 180. Neurological disorders. Part T. Head injury. Head injury. Client education discharge. Instrucu adults. 181. nclex RN flash review. Adult. Definition: a trauma to the skull, resulting in mild to extensive damage to the brain. Immediate complications include cerebral bleeding, hematomas, infection, seizures, and uncontrolled increased ICP. Can be open, such as lacerations, or closed, such as concussion, fractures, and hematomas. The term head trauma is used primarily to signify craniocerebral trauma, which includes an alteration in consciousness, no matter how brief. Causes: motor vehicle accidents, falls, firearms, assaults, sports-related injuries. Assessment findings depends on the type of injury. Assessment findings result from an increased ICP, changing neurological signs, vital signs, airway and breathing patterns, reflexes, headache, nausea, vomiting, visual disturbances, papillary changes, and papilledema, nuchal rigidity, CSF drainage from the ears or nose, seizure activity, posturing. Treatment, nursing interventions. Maintain respiratory status and patent airway. Monitor neurological status and vital signs for signs of increased ICP, pain, and restlessness. Maintain head of bed elevation to reduce venous pressure, prevent neck flexion, initiate seizure precautions, assess cranial nerve function, reflexes, and motor sensory function. Check for CSF drainage. Monitor for drainage from the nose or ears, maybe CSF. Monitor for signs of infection. Prevent complications of immobility. Instruct the client to avoid coughing. Surgical intervention may include a craniotomy. 1. Instruct the client's caregiver to arouse the client every 2 hours for the first 24 hours, or set an alarm clock. 2. Instruct the client to anticipate dizziness and headaches. 3. Instruct the client not to blow his or her nose. Try to prevent sneezing. 4. Instruct the client to use acetaminophen for headaches. 5. Instruct the client not to exercise for 2 or 3 days following injury. 6. Instruct the client to contact a physician if any of the following occur: blurred vision or diplopia, poor coordination in walking or grasping, drainage serous or bloody from the nose, rhinorrhea or ears, otorrhea, forceful vomiting, increased sleepiness, slurred speech, headache that does not respond to medication or continues to get worse, occurrence of a seizure. 182. Neurological disorders. Part E. Head injury, type B as of I. 183. nclex and flash review. Adult. Type concussion, contusion, skull fracture. Description: a jarring of the brain within the skull, with no loss of consciousness. May affect memory, speech, reflexes, balance, and coordination. Transient, self-limiting. Bruising of the brain tissue. Causes multiple areas of petechial hemorrhages. Blood supply is altered in the area of injury, swelling, ischemia, and increased ICP may result. Assessment findings include headache, papillary changes, dizziness, unilateral weakness. May last several hours to weeks. Linear, breaking continuity of bone without alteration of relationship of parts. Low velocity injury is often the cause. Depressed, inward indentation of skull, caused by a powerful blow. Simple, linear, or depressed skull fracture, without fragmentation or communicating lacerations, caused by low to moderate impact. Comminuted, multiple linear fractures with fragmentation of the bone into many pieces, caused by direct high momentum impact. Compound, depressed skull fracture and scalp laceration with communicating pathway to intracranial cavity, caused by severe head injury. Type epidural, hematoma. Description: neurological emergency. Hematoma forms between the dura and the skull from a tear in the meningeal artery or vein, arterial more common. A hematoma quickly forms, leading to an increased ICP, often associated with temporary loss of consciousness, followed by a lucid period, which rapidly progresses to coma. Tentorial herniation may occur without immediate intervention. Subdural hematoma, intracerebral hemorrhage. Subarachnoid hemorrhage, a collection of blood between the dura and arachnoid area, filling the brain vault, usually the result of a serious head injury. Can be acute. Occurs in 24 to 48 hours after injury. Immediate neurological deterioration of the client is noted. Treatment involves craniotomy and evacuation and decompression. Subacute occurs within 48 hours or 2 weeks after injury. Alteration in mental status as hematoma develops. Progression depends on size and location of hematoma. Treatment involves evacuation and decompression. Chronic occurs weeks, months, usually greater than or equal to 20 days post-injury. Often initial injury is forgotten by client. Nonspecific symptoms does progress to altered LOC. Evacuation and decompression may be completed. Treatment may also include diuretics and anticonvulsants. Multiple hemorrhages occur around a contused area of brain tissue. Bleeding occurs directly into the subarachnoid space, which includes the ventricles and ventricular spaces. 184. Neurological disorders. Part E. Hemianopsia, increased intracranial paresur ICP. Definition: blindness in hash review. Definition: blindness in half the visual field. Definition: loss of half of the field of view on the same side in both eyes. Definition: life-threatening situation that results from an increase in any or all of the three components: brain tissue, blood, cerebral spinal fluid, CSF within the skull. Normal ICP ranges from 0 to 15 mmHg. Causes: cerebral edema caused by blunt trauma, fluid and electrolyte imbalances, brain tumors, intracranial hemorrhage caused by epidural or subdural bleeding, subarachnoid hemorrhage, hydrocephalus, cerebral embolism or thrombosis. Assessment findings: early, restlessness, irritability, lethargy; intermediate, unequal pupil responses, projectile vomiting, vital sign changes; late, decreased level of consciousness, decreased reflexes, hypoventilation, dilated pupils, posturing. Treatment: nursing interventions, elevation of the head of bed 30 degrees with head in the neutral position, intubation and mechanical ventilation, ICP monitoring, cerebral oxygen monitoring, maintenance of PaO2 at 100 mmHg or greater, maintenance of fluid balance and assessment of osmolality, maintenance of systolic arterial pressure 100 to 160 mmHg, maintenance of cerebral perfusion pressure, CPP, greater than or equal to 60 mmHg, reduction of cerebral metabolism, for example, high-dose barbiturates. Medication therapy includes osmotic diuretics mannitol, hypertonic saline-4, anti-seizure medications, for example, phenytoin, dilantin, corticosteroids, dexamethasone, decadron for brain tumors, bacterial meningitis, histamine, H2 receptor antagonist, for example, cimetidine, tagamet, or proton pump inhibitor, for example, pantoprazole protonics to prevent GI ulcers and bleeding. 186. Neurological disorders. Part E. Koenig's SI-gen. Mean arterial pressure MAP. Calculation FOR. Meningeal irritation. Signs and D symptoms of. 187. nclex RN flash review. Adult. Definition: loss of the ability of a supine client to straighten the leg completely when it is fully flexed at the knee and hip. Client will experience pain. Indicates meningeal irritation. 2x diastolic plus systolic. Diastole counts twice as much as systole because 2 to 3 of the cardiac cycle is spent in diastole. A MAP of about 60 is necessary to perfuse coronary arteries, brain, and kidneys. Usual range 70 to 110. General findings: irritability, nuchal rigidity, severe constant headache, generalized muscle aches and pains, tachycardia, fever and chills, nausea and vomiting, nystagmus, photophobia, abnormal pupil response and eye movement, Brudzinski sign, Kerning sign, motor response, hemiparesis, hemiplegia, and decreased muscle tone, cranial nerve dysfunction. 3. IV7 and 8 memory changes, short attention span, bewilderment, personality and behavioral changes. Neurological disorders. Part 11. Meningitis. 189. nclex RN flash review. Adult. Definition: an inflammation of the arachnoid and pia mater of the brain and spinal cord. Causes: caused by bacterial and viral organisms. Fungal and protozoal meningitis can occur. Cerebrospinal fluid is analyzed to determine which type is present. Transmission occurs in areas of high population density and in crowded living areas. Transmission of meningitis is by direct contact, including droplets. Predisposing factors include skull fracture, brain or spinal surgery, use of nasal sprays, upper respiratory or sinus infections, or compromised immune system. Assessment findings: general signs of meningeal irritation, red macular rash with meningococcal meningitis, abdominal and chest pain with viral meningitis. Treatment: nursing interventions, monitor vital and neurological signs, assess for signs of increased ICP, perform cranial nerve assessment, monitor for seizure activity, maintain isolation precautions as indicated for bacterial meningitis, Assure urine and stool precautions with viral meningitis. Elevate the head of the bed 30 degrees while avoiding neck and extreme hip flexion. Administer analgesics and antibiotics as ordered. Definition: believed to be autoimmune in origin. Demyelinating disease resulting in the destruction of CNS myelin and consequent disruption in the transmission of nerve impulses. Diagnosis determined by a combination of data. Presenting symptoms: increased white matter density seen on CAT scan, presence of plaque seen on MRI. CSF electrophoresis shows presence of oligoclonal Ig bands. Causes: unknown. Thought to be a complicated interaction of the immune system, environment, infectious disease, and genetics. Assessment findings: optic neuritis, scotomas, speech impairment, swallowing difficulties, impaired bladder and bowel function, unusual fatigue, weakness and clumsiness, gait disturbances, intention tremors, and numbness on one side of the face. Treatment: nursing interventions, orient client to the environment, and teach strategies to maximize vision, initiate avoiding schedule, and encourage adequate fluid intake. High-fiber foods, and a bowel regimen for constipation. Administer steroid therapy and chemotherapeutic medications in acute exacerbations to shorten length of attack. Medication therapy may include ACH, cortisone, cyclophosphamide, Cytoxan, and other immunosuppressive medications. Teach client about infection prevention. Special considerations: symptoms involving motor function usually begin in the upper extremities, with weakness progressing to spastic paralysis. Bowel and bladder dysfunction occurs in 90% of cases, more common in women. 190. Neurological disorders. Part E, myasthenia gravis. 191. Adult. nclex RN flash review. Definition: disorder affecting the neuromuscular transmission of impulses in the voluntary muscles of the body. Considered an autoimmune disease characterized by the presence of acetylcholine receptor antibodies, ACERs, which interfere with neuronal transmission. Causes: the exact cause is unknown. In some cases, it may be associated with tumors of the thymus. Assessment findings: diplopia, ptosis, mask-like affect, weakness of laryngeal and pharyngeal muscles, dysphagia, choking, food aspiration, difficulty speaking, muscle weakness improved by rest, worsened by activity. Clients may experience a myasthenic crisis, attributed to disease worsening, may result in respiratory failure associated with undermedication, or a cholinergic crisis attributed to anticholinesterase overdosage. Symptoms include diaphoresis, diarrhea, and fasciculations. Treatment: nursing interventions, tracheostomy kit at bedside, treatment of myasthenic crisis, schedule nursing activities to conserve energy, instruct client to avoid situations that create fatigue or physical or emotional stress. Bed rest may be implemented. Teach strategies to avoid bladder and respiratory infection. Encourage coughing and deep breathing exercises every 4 to 6 hours. Administer cholinergic medications, pyridostigmine, bromide, mestinon. Special considerations: usually affects females between the ages of 10 and 40 and males over age 60. Advanced cases may experience respiratory failure, bladder and bowel incontinence. Definition: stiff neck. Flexion of the neck onto the chest causes intense pain, a sign of meningeal irritation. Definition: when normal, the client's head is moved from side to side. The eyes look in the direction opposite that of the turning. In contrast, when abnormal, the client's eyes remain in a fixed midline position when the head is turned from side to side. Possible brainstem involvement. Contraindicated until the risk of spinal cord injury is ruled out. Neurological disorders. Part 11. Parkinson's disease. Respiratory patterns abnormal. 193. nclex RN flash review. Adult. Definition: a degenerative disease caused by the depletion of dopamine, which interferes with the inhibition of excitatory impulses, resulting in a dysfunction of the extrapyramidal system. It is slow and progressive, resulting in a crippling disability. Causes: exact causes are unknown, however. It is believed to be linked to genetic and environmental factors. Assessment findings: rigidity of extremities, mask-like facial expressions with associated difficulty in chewing, swallowing, and speaking, drooling, emotional ability, stooped posture and slow, shuffling gait, tremors at rest, pill-rolling movement. Treatment: nursing interventions. Schedule activities later in the day. Instruct client not to rush self-care activities. Encourage rest periods between activities. Instruct client to utilize a walker or cane. Encourage client to speak slowly and clearly. Provide a soft diet if client has difficulty swallowing. Administer anti-Parkinsonian medications as ordered. Special considerations. Debilitation can result in falls, self-care deficits, failure of body systems, and depression. Interventions are directed to providing safety measures. In this disorder, the pathophysiology involves an imbalance between acetylcholine and dopamine, so symptoms are often controlled by administering a dopamine precursor, such as levodopa-dopar. Type Cheyne-Stokes, neurogenic hyperventilation apneustic ataxic cluster description, rhythmic respirations with periods of apnea, can indicate a metabolic dysfunction or dysfunction in the cerebral hemisphere or basal ganglia. Regular rapid and deep sustained respirations indicates a dysfunction in the low midbrain and middle pons. Irregular respirations with pauses at the end of inspiration and expiration indicates a dysfunction in the middle or caudal pons. Totally irregular in rhythm and depth indicates dysfunction in the medulla. Cluster of breaths with irregularly spaced pauses indicates a dysfunction in the medulla and pons. 194. Neurological disorders. Part E, seizure. Seizure, type PEs of GnRL-EZ seizures, I. 195. nclex RN flash review. Adult. Definition, an abnormal, sudden, excessive discharge of electrical activity within the brain. Causes, genetic factors, infection, tumors, trauma, toxicity, metabolic or circulatory disorders. Assessment findings, seizure history, occurrences before, during, and after the seizure, loss of motor activity or bowel and bladder function, or loss of consciousness during the seizure, or a sensation that warns the client of an impending seizure. Prodromal signs, mood changes, insomnia, and irritability, occurrences during the postictal state, sleepiness, headache, loss of consciousness, and impaired speech or thinking. Treatment, nursing interventions, support the ABCs, note the time and duration of seizure activity, apply oxygen, prepare for suctioning. If client is standing or sitting, place the client on the floor and protect the head. Turn the client to the side to allow secretions to drain while maintaining airway. Monitor for urination. Administer anti-seizure medications as ordered. For tonic-clonic seizures, phenytoin dilantin, carbamazepine tegretol, phenobarbital luminol, and fosphenytoin cerebix for absent seizures, ethosuximide, zarantin, valproic acid depakine. Pad side rails. Monitor serum drug levels. Tape oral airway to the head of the bed. Encourage the client to wear a medic alert bracelet. Special considerations. Epilepsy is a disorder characterized by chronic seizure activity and indications of central nervous system or brain irritation. If a client is having a seizure, maintain a patent airway. Do not force the jaw open or place anything in the client's mouth. Medication noncompliance is the most common case of increased seizure activity. Type tonic-clonic absence. Myelonic atonic or akinetic drop attacks description may begin with an aura. The tonic phase involves the stiffening or rigidity of the muscles of the arms and legs and lasts about 10 to 20 seconds, followed by a loss of consciousness. The clonic phase involves hyperventilation and jerking of the extremities and lasts about 30 seconds. Full recovery from the seizure may take several hours. A seizure that lasts for seconds, and the client may or may not lose consciousness. No loss or change in muscle tone is observed. Seizures may occur several times a day. The client may appear to be daydreaming. This type of seizure is common in children, present as a brief generalized jerking or stiffening of extremities. The client may collapse to the ground from the seizure's sudden momentary loss of muscle tone. The client may drop to the ground as a result of the seizure. 196. Neurological disorders. Part E. Seizure, type E as of GnRL-EZ seizures to spinal cord injury SI. 197. Adult. nclex RN flash review. Type simple, partial complex partial description produces sensory symptoms accompanied by motor symptoms that are localized or confined to a specific area. The client remains conscious and may also report having an aura, a psychomotor seizure. The area of the brain most commonly involved is the temporal lobe. The seizure is characterized by periods of altered behavior of which the client is unaware. The client loses consciousness for a few seconds. Definition: disruption in nervous system function, which may result in complete or incomplete loss of motor and sensory function. Changes occur in the function of all physiologic systems. Injury is described by the location of injury to the spinal cord. The most common sites are C5, C6, C7, T12, and L1. Physical assessment should concentrate on respiratory status, especially with injuries at C3 to C5, as the cervical plexus innervates the diaphragm. Damage can range from contusion to complete transaction. Permanent impairment cannot be determined until the edema of the spinal cord resolves, usually by 1 week. Causes: motor vehicle collisions, acts of violence, sports-related injuries, diseases, cancer, arthritis, osteoporosis, spinal tumors. Assessment findings, dependent on the level of injury, based on the lowest spinal cord segment, with intact motor and sensory function. Respiratory status changes, motor and sensory changes below the level of injury, total sensory and motor paralysis below the level of injury, loss of reflexes below the level of injury, loss of bladder and bowel control, urinary retention and bladder distension, presence of sweat, which does not occur on paralyzed areas. Treatment, nursing interventions, emergency management is critical, as improper movement can cause further damage and loss of neurological function. Assess the respiratory pattern and maintain a patent airway. Prevent head flexion, rotation, or extension during immobilization. Utilize proper handling techniques. In cervical injuries, skeletal traction is maintained by use of skull tongs or halo ring. High-dose corticosteroids are often given in the first 8 to 24 hours to control edema. Evaluate for the presence of spinal shock or autonomic dysreflexia and treat appropriately. Watch for paralytic ileus. Suction with caution. 198. Neurological disorders. Part E. Spinal cord injury, specific SSMNT findings, spinal S-hoc and autonomic dysreflexia, differences between. 199. Adult, nclex RN flash review. Type of injury: cervical level injuries, thoracic level injuries, lumbar and sacral level injuries. Assessment findings: injuries to C2 to C3 are usually fatal. C4 is the major innervation to the diaphragm by the phrenic nerve. Involvement above C4 causes respiratory difficulty and paralysis of all 4 extremities. Clients can have movement in the shoulder if the injury is at C5 through C8, and may also have decreased respiratory reserve. Loss of movement of the chest, trunk, bowel, bladder, and legs can occur depending on the level of injury. Leg paralysis, paraplegia, may occur. Autonomic dysreflexia with lesions or injuries above T6 and in the cervical lesions may occur. Visceral distension from a noxious stimulus such as a distended bladder or an impacted rectum may cause reactions such as sweating, hypertension, bradycardia, nasal stuffiness, and gooseflesh. Loss of movement and sensation of the lower extremities may occur. S2 and S3 center on micturition, therefore below this level. The bladder will contract but not empty. Neurogenic bladder. Injury S2 in males allows them to have an erection, but they are unable to ejaculate because of sympathetic nerve damage. Injury between S2 and S4 damages the sympathetic and parasympathetic response, preventing sexual function, erection, and ejaculation. Definition: complete loss of all reflex, motor, sensory, and autonomic activity below the lesion of injury. This is a medical emergency that occurs immediately after the injury. Assessment findings: hypotension, bradycardia, complete paralysis and lack of sensation below lesion, and bowel and bladder distension. Treatment: nursing interventions, imperative to reverse spinal shock as quickly as possible. Spinal cord compression lasting for 12 to 24 hours can result in permanent paralysis. Spinal shock, flaccid paralysis, loss of reflex activity below the level of injury, bradycardia, paralytic ileus, hypotension, sudden onset, severe throbbing headache, severe hypertension, sweating, nausea, flushing above the level of the injury, nasal stuffiness, pale extremities below the level of the injury, dilated pupils or blurred vision, goosebumps, restlessness and feeling of apprehension, autonomic dysreflexia. 200. Neurological disorders. Part E. Stroke, manifestat ions of stroke, tetraplegia, and D. paraplegia. 201. nclex RN flash review. Adult, right brain damage, left brain damage, and paralyzed left side, hemiplegia, left-sided neglect, spatial perceptual deficits, tendency to deny or minimize problems, rapid performance, short attention span, impulsive safety problems, impaired judgment, impaired time concepts, and paralyzed right side, hemiplegia, impaired speech, language aphasias, impaired right-left discrimination, slow performance, caution, awareness of deficits, depression, anxiety, impaired incomprehension related to language, math. Definition: sudden loss of brain function resulting from a disruption in the blood supply to a part of the brain. Classified as ischemic or hemorrhagic. Central nervous system, CNS involvement related to the cause of the stroke. Hemorrhagic type is caused by a slow or fast hemorrhage into the brain tissue. Ischemic type is caused by a clot lodged in one of the arteries of the brain blocking the blood supply that are either thrombotic or embolic in nature. In an embolic stroke, a clot that travels from outside the brain, often the heart, and lodges in a cerebral artery. In a thrombotic stroke, the clot develops in a cerebral artery. Causes: hypertension, previous transient ischemic attacks, TIAs, cardiac disease, atherosclerosis, valve disease, history of arrhythmias, particularly atrial flutter or atrial fibrillation, advanced age, diabetes, oral contraceptives, smoking. Assessment findings: presenting symptoms are related to specific areas of brain affected. General findings: motor loss, usually exhibited as a hemiparesis or hemiplegia, communication loss, exhibited as dysarthria, dysphasia, aphasia, or apraxia, perceptual disturbance that can be visual, spatial, and sensory, impaired mental acuity or psychological changes such as decreased attention span, memory loss, depression, lability, and hostility, incontinence or retention. Treatment: nursing interventions, control of hypertension, maintain proper body alignment while client is in bed, position client to minimize edema, prevent contractures and maintain skin integrity, perform range of motion ROM, encourage to participate in activities of daily living ADLs as able, analyze bladder elimination pattern, initiate speech therapy, teach client that modifications may include a soft diet, pureed foods, thickened liquids, and head positioning, encourage family members to join support groups. Tetraplegia, quadriplegia injury, occurring between C1 and C8, paralysis involving all four extremities. Injury occurring between T1 and L4, paralysis involving only the lower extremities. Paraplegia. Oncology disorders Part E. Breast C. Answer. Breast self-examination BSE, Inster UTIONS FOR, 203. nclex RN flash review. Adult. Definition: classified as invasive when it penetrates tissues surrounding the mammary duct and grows in an irregular pattern. Diagnosis is made by breast biopsy through needle aspiration or by surgical removal of the tumor with microscopic examination for malignant cells. Causes, risk factors, age, family history of breast cancer, early menarche and late menopause, previous cancer of the breast, uterus or ovaries, obesity, high-dose exposure of radiation to the chest. Assessment findings: asymmetry of breast, skin dimpling, flattening, and nipple deviation are suggestive of lesion, skin coloring and thickening, large pores, sometimes called peau d'orange, orange peel appearance, changes in the nipple, discharge from nipple, mass is painless, non-tender, hard, irregular in shape and non-mobile. Majority of malignant lesions are found in the upper outer quadrant of the breast tail of Spence. Treatment: nursing interventions. Surgical interventions include modified radical mastectomy, most common, local excision lumpectomy, radical mastectomy less common, or breast reconstruction. Radiation, hormonal therapy, and chemotherapy are also utilized. 1. While in the shower or bath, when breasts are wet and slippery with soap, examine the breasts. 2. Utilize the pads of the second, third, and fourth fingers to press every part of the breast firmly. 3. Use the right hand to examine the left breast and the left hand to examine the right breast. 4. Using the pads of the fingers on the left hand, examine the entire right breast using small circular motions in a spiral or up and down motion so that the entire breast area is examined. Repeat the same procedure to examine the left breast. 5. Repeat the pattern of palpation under the arm. 6. Check for any lumps, hard knots, or thickening of tissue. Note: perform monthly 7 to 10 days after menses. Postmenopausal clients or clients who have had a hysterectomy should select a specific day of the month and perform BSE monthly on that day. Oncology disorders. Part 11. Lung cancer, 205. nclex RN Flash Review. Adult. Definition: tumor may represent the primary site or may be metastatic from a primary lesion elsewhere. There are two main types: small cell lung cancer, SCLC, and non-small cell lung cancer, NSCLC. Epidermal squamous cell adenocarcinoma and large cell anaplastic carcinoma are classified as NSCLC because of their similar responses to treatment. Diagnosis is made by chest X-ray study, CT scan or MRI, bronchoscopy, and sputum studies that demonstrate a positive cytological study for cancer cells. Causes: cigarette smoking, also exposure to passive tobacco smoke, exposure to environmental and occupational pollutants. Assessment findings: wheezing, dyspnea, hoarseness, chest pain, hemoptysis, blood-tinged purulent sputum, weakness, anorexia, weight loss, hoarseness, and diminished or absent breath sounds. Treatment: nursing interventions vary with the degree extent of malignancy. Radiation may be utilized preoperatively to reduce tumor mass. Surgical interventions include lobectomy, pneumonectomy, and lung-conserving resection. Chemotherapy is also used. Special consideration: treatment may involve all three therapies: radiation, chemotherapy, and surgery. Initial site: bladder cancer, brain tumors, cancer, breast cancer, colorectal cancer, lung cancer, prostate cancer, testicular cancer. Common sites of metastasis: lung, bone, liver, pelvic, retroperitoneal structures, central nervous system, bone, lung, brain, liver, liver-brain, liver bone, spine, lung, liver, kidneys, lung, bone, liver, adrenal glands, retroperitoneal nodes. 206. Oncology disorders, Part E. Testicular C-anchor, testicular self-examination, instir utions foar. 207. nclex RN Flash Review. Adult. Definition: tumors are often malignant and often metastasize quickly. They arise from germinal epithelium from the sperm-producing germ cells or from non-germinal epithelium from other structures in the testicles. Causes: generally unknown, but history of undescended testicles and genetic predisposition have been associated with testicular tumor development. Assessment findings: painless testicular swelling occurs, dragging or pulling sensation in the scrotum, palpable lymphadenopathy, abdominal masses, and gynecomastia may indicate metastasis, back, bone pain, or respiratory distress. Late signs. Treatment: nursing interventions. Surgical interventions includes orchiectomy, performed as soon as possible, retroperitoneal lymph node dissection, if lymph involvement. Medical interventions include postoperative irradiation to the lymphatic drainage pathways and multiple chemotherapy medications. Special considerations: early recognition through self-testicular examination is key. Step 1. Examine using a mirror. Using a mirror, examine the scrotum, looking for any lumps on the skin or swellings inside. Step 2. Feel for differences between the testicles. Cradle the whole scrotum and testicles in the palm of the hand and feel for any differences between the testicles. One is usually larger and lying lower, and this is normal. Step 3. Check for lumps and swellings. Use both hands and gently roll each testicle between thumb and forefinger, checking for any lumps or swellings. Be aware of heaviness or hardness in part or all of the testicle. The testicles should be smooth to touch except for the epididymis, which is a soft, sausage-like tube that lies at the top and back of the testicles and carries sperm to the penis. Note: best time to complete an exam is after a shower. Complete every month. 208. Renal disorders, Part E. Arterial steal syndrome, continuous renal replacement therapy, CRT. 209. Adult, nclex RN Flash Review. Definition: a syndrome that may develop following the insertion of an arteriovenous fistula when too much blood is diverted to the vein and arterial perfusion to the hand is compromised. Symptoms include hand pain, diminished altered sensation, pale, cold hand, diminished or absent radial pulse, and poor capillary filling. Definition: the retention of nitrogenous waste products in the blood. It is a condition in which the patient's blood contains uncommon levels of urea, creatinine, and other compounds rich in nitrogen, and it is also one clinical characteristic of a wider condition known as uremia, which includes other conditions such as acidosis, anemia, hyperkalemia, hypertension, and hypocalcemia. The underlying cause is typically the kidney's insufficient filtering of the blood. Direct causes may include certain antiviral medications, congestive heart failure, extended diarrhea or vomiting, kidney trauma, liver failure, severe burns, or shock. Definition: an alternative measure for treating acute renal failure. The uremic toxins are removed slowly and continuously. This allows for constant maintenance of acid-base and electrolyte balance in an unstable client. Types include CVVH equal to continuous venovenous hemofiltration, CAV equal to continuous arteriovenous hemofiltration, CVVHD equal to continuous venovenous hemodialysis, CAVHD equal to continuous arteriovenous hemodialysis, SCUF equal to slow continuous ultrafiltration. 210. Renal disorders, Part E, cystitis. 211. nclex RN flash review, adult. Definition: a test that evaluates how well the kidneys remove creatinine from the blood. The test requires a blood sample and timed urine specimens. The urine specimen is usually collected for 24 hours, and the blood sample is drawn after the urine collection is completed. The test provides the best estimate of the glomerular filtration rate, GFR. The normal GFR is 125 ml/minute. Definition: a urinary tract infection causing inflammation of the bladder from an infection, obstruction of the urethra, or other irritants. Causes not all-inclusive: allergens or irritants, soaps, bubble bath, perfumed sanitary napkins, bladder distension, calculus, hormonal changes, indwelling catheters, sexual intercourse, urinary stasis, and loss of bacterial properties of prostatic secretions in males. Assessment findings: frequency and urgency, burning on urination, inability to void, voiding small amounts of urine, hematuria, cloudy, dark, foul-smelling urine, abdominal and back pain, malaise, chills, fever, nausea, and emesis. White blood cell count greater than 100,000 cells, MM3 on urinalysis. Treatment: nursing interventions. Obtain urine specimen for culture and sensitivity prior to administering prescribed antibiotics. Increase fluid intake, 3,000 ml day. Administer prescribed medications, may include analgesics, urinary antiseptics, antispasmodics, antibiotics, or antimicrobials. Sitz baths and heat to abdomen as needed. Proper care of indwelling urinary catheter, and avoidance of caffeine products and alcohol. Special considerations: sexually active and pregnant women are most vulnerable to cystitis. Instruct client to take all medications as prescribed, complete entire course of antibiotics, have a urine culture completed following treatment, and follow the measures to prevent reoccurrence. Fistula. A fistula uses the client's own tissue to connect an artery and vein, usually in the forearm. A graft connects an artery to a vein using a piece of synthetic tubing. Grafts take less time to develop, so they can sometimes be used earlier for dialysis, but dialysis grafts may be subject to more clotting and infection rates than dialysis fistulas. Usually a plastic catheter is surgically implanted to allow the dialysis cleansing fluid, dialysate, to enter and leave the peritoneal cavity. In peritoneal dialysis, there is no direct connection to the bloodstream. A short-term solution for emergency dialysis or while waiting for a dialysis fistula or graft to be ready. These are temporary dual-lumen venovenous central venous catheters, CVCs, which are placed into the central vein in the neck or chest or femoral area in an emergency. Graft peritoneal catheter, temporary dialysis catheter. 212. Renal disorders. Part E. Diet. ADID-ASH. 213. nclex RN flash review. Adult. Foods to include meat, fish, oysters, poultry bread, cereal, whole grains, cheese, eggs, cranberries, prunes, plums, tomatoes, corn, and legumes. Outcome. Diet decreases the pH of urine and makes the urine more acidic. Foods to include fruits, except cranberries, tomatoes, prunes, and plums, rhubarb milk, most vegetables, small amounts of trout, beef, salmon, veal, and halibut. Outcome. Diet increases the urine pH and reduces the acidity of urine. Purine high, sardines, herring, mussels, liver, kidney, goose, venison, meat soups, sweetbreads moderate, chicken, salmon, crab, veal, mutton, bacon, pork, beef, ham high, milk, cheese, ice cream, yogurt, sauces containing milk, all beans except green beans, lentils, fish with fine bones, for example, sardines, kippers, herring, salmon, dried fruits, nuts, Ovaltine, chocolate, cocoa high, dark roughage, spinach, rhubarb, asparagus, cabbage, tomatoes, beets, nuts, celery, parsley, runner beans, chocolate, cocoa, instant coffee, Ovaltine, tea, Worcestershire sauce, calcium oxalate. Uric acid is a waste product from purine foods. 214. Renal disorders, Part 11, glomerulonephritis, hemodialysis. 215. Adult, nclex N flash review. Definition: the flow rate of filtered fluid through the kidney, an indicator of renal function. Definition: a group of diseases that damage the glomeruli of the kidneys, commonly caused by an immunological reaction. Inflammation of the glomeruli results from an antigen-antibody reaction produced from an infection or autoimmune process elsewhere in the body. Results in loss of kidney function, can be acute or chronic in nature. The acute form occurs 5 to 12 days following a streptococcal infection. The chronic form occurs after the acute phase or slowly over time. Causes: immunological or autoimmune diseases, history of pharyngitis or tonsillitis 2 to 3 weeks after symptoms, group A beta hemolytic, streptococcal infection. Assessment findings: acute, proteinuria, asymptomatic, hematuria, tea or cola-colored urine due to hematuria, facial or periorbital edema, oliguria, hypertension, azotemia. Chronic symptoms of progressive renal failure. Treatment: nursing interventions, diuretics, antihypertensive medications, antibiotics, plasmapheresis, decreased sodium intake, protein restriction if azotemia is present, decreased foods and potassium, and fluid restriction. Special considerations: complications include chronic renal failure, pulmonary edema, congestive heart failure, and hypertensive episodes. Definition: circulation of the client's blood through a compartment that contains an artificial semipermeable membrane surrounded by dialysate fluid, which removes excess body fluid by creating a pressure differential between the blood and the dialysate solution. 216. Renal disorders, Part E. Hemodialysis, complications of. Peritoneal dialysis, complications of. 217. nclex N flash review. Adult, air embolus, disequilibrium syndrome, electrolyte alterations, encephalopathy, hemorrhage, hepatitis, hypotension, sepsis, shock. Definition: utilization of the peritoneal cavity and the peritoneum as the semipermeable membrane that removes excess fluid, a way to remove waste products from the blood when the kidneys can no longer do the job adequately. During the procedure, blood vessels in the abdominal lining peritoneum fill in for the kidneys, with the help of a fluid dialysate that flows into and out of the peritoneal space. Differs from hemodialysis, a more commonly used blood filtering procedure, in that treatments can occur in the home, at work, or while traveling. Not an option for everyone. With kidney failure, clients must have manual dexterity or a reliable caregiver and the ability to care for themselves at home. Abdominal pain, bladder or bowel perforation, insufficient outflow leakage around the catheter site, peritonitis. Peritoneal, Part E. Renal disorders, peritoneal dialysis, continuous ambulatory pyelonephritis. Renal failure, AC UDARF. 219. Adult, nclex N flash review. Definition: the dialysate is infused into the abdomen and remains there for a specific time period, 2 to 6 hours. The dialysate is removed by gravity drainage after the scheduled period of time. Definition: a type of urinary tract infection that involves inflammation of the renal pelvis, can be acute or chronic in nature. Causes: in acute form, often occurs following an invasive procedure of the urinary tract or is due to the introduction of bacteria into the urethra. It develops a new infection or recurs as a relapse of a previous infection, can progress to bacteremia or chronic pyelonephritis. In chronic form, commonly occurs following chronic urinary flow obstruction with reflux and can lead to renal failure. Assessment findings: acute, nausea, fever, chills, dysuria, headache, flank pain on the affected side, frequency and urgency, costovertebral angle tenderness, cloudy, bloody, or foul-smelling urine. Chronic, proteinuria, azotemia, poor urine concentrating ability. Treatment: nursing interventions, Monitor for elevated temperature. Evaluate vital signs. Increase fluid intake to 3,000 ml day. Monitor urinary output, 1,500 ml 24 hours. Complete daily weight, and provide frequent rest periods. Advocate a high-calorie, low-protein diet. Administer medications as prescribed, analgesics, antipyretics, antibiotics, urinary antiseptics, and antiemetics, and monitor for signs of renal failure. Special consideration. Chronic form is often diagnosed accidentally when the client is being evaluated for hypertension. Definition: the sudden loss of kidney function caused by renal cell damage from ischemic or toxic substances. It occurs abruptly and is reversible. It leads to hypoperfusion, cell death, and decomposition in renal function. The prognosis depends on the cause and condition of the client. Near-normal kidney function may resume gradually. The most common cause is hypotension and parental hypovolemia or exposure to a nephrotoxin. Renal disorders. Part E. Renal failure. ACute. Causes of renal failure. ACute. Clinical manifestat ions of. 221. nclex RN flash review. Adult. Prerenal intrarenal postrenal factors external to the kidneys that reduce renal blood flow and lead to decreased glomerular perfusion and filtration. Caused by intravascular volume depletion, dehydration, decreased cardiac output, decreased peripheral vascular resistance, decreased renovascular blood flow, and parenal obstruction or infection. Conditions that cause direct damage to the renal tissue parenchyma, resulting in impaired nephron function, caused by tubular necrosis, prolonged parenal ischemia, intrarenal infection or obstruction, and nephrotoxicity, for example, aminoglycoside, antibiotics, contrast media, involves mechanical obstruction of urinary output. As the urine flow is obstructed, urine refluxes into the renal pelvis, impairing kidney function. Caused by benign prostatic hyperplasia, prostate cancer, calculi, trauma, and extrarenal tumors. Urinary cardiovascular respiratory hematological neurological fluid and electrolyte imbalances, decreased urinary output, oliguric less than 400 ml day in older clients, may be 600 to 700 ml day. Intrarenal and postrenal failure, fixed gravity, increased sodium in the urine, proteinuria with glomerular membrane alteration, muddy brown casts, when parenal failure, past history of precipitating event, urine-specific gravity may be high urinary sodium concentration and proteinuria. When high output failure, the kidney no longer filters urine, high urinary output, but the urine is dilute and does not contain waste products from filtering. Pericarditis, pericardial effusion, arrhythmias caused by acidosis or hyperkalemia, congestive heart failure, hypotension followed by hypertension. Pulmonary edema related to fluid overload, small respirations due to metabolic acidosis, pleural effusions, anemia, leukocytosis, altered platelet function, leading to bleeding tendencies, seizures, altered mentation, memory impairment, lethargy, fluid retention, hyperkalemia, hyponatremia, metabolic acidosis. 222. Part 2 renal failure. Parts R and flash review. Adult. Medical management, dietary management, dialysis management, identify and treat precipitating causes of ARF, and diuretic therapy and fluid challenges may be initiated. Sorbitol, osmotic cathartic, may be administered with exchange resins to induce diarrhea to eliminate potassium ions. When in sodium polystyrene sulfonate kiexylate, a case exchange resin given by mouth or retention enema to remove potassium from the body. And metabolic acidosis can be treated with IV sodium bicarbonate. And feed dopamine may be administered to enhance renal perfusion. And fluid restriction, monitor intake and output. Monitor serum plasma levels to regulate the intake of protein, potassium, and sodium, and increase intake of carbohydrates and protein of high biological value. And indications: volume overload, bun level greater than 120 milligrams DL, metabolic acidosis, increased potassium with electrocardiographic changes, pleural effusion, and cardiac tamponade. 224. Renal disorders. Part 2 renal failure, acute phases of. 225. Adult, nclex RN flash review. recovery convalescent, onset phase oliguric phase diuretic phase. Phase in urinary output begins with aortic in output begins when the GFR decreases to precipitating a sudden increases. May take up less than 400 event. Onset within to 12 months for renal ml per 24 2 to 6 weeks function to become hours. After oliguric stabilized. Phase. Diuria, increase in and usually some persons up to 10% blood. Urea nit minute loss of renal L day. Urine trogon bun, function. But remaining is very dilute. Creatinine, uric function is sufficient to acid. Potass hypovolemia, maintain a healthy life seum and hypoten. Older adults or less magnesium seon can likely to experience levels and occur due to a return of full kidney, the presence massive fluid function. Of metabolic losses, uncomplications include acidosis, unbun level secondary infection, and duration is 1 stops risk, which is the most canto 3 weeks. IN. Urine mon cause of death. The longer the creatinine duration, the clearance less favorable stabilizes. The recovery, in client at risk, and non-oliguric for hypocarinal failure, lemia, and also referred hyponatremia to as high may last for 1 output failure to 3 weeks. Urine is dilute and renal disease present. These clients usually recover more quickly and have fewer complications. Renal disorders, Part E. Renal failure, chronic CRF. Renal failure, N-flash review, Tiffany disease. It involves progressive, irreversible loss of kidney function such that the kidneys are no longer able to maintain the body environment. It is defined as either the presence of kidney damage or a glomerular filtration rate, GFR, less than or equal to 60 ml/minute for 3 months or longer. Normal GFR is about 125 ml/minute and is reflected by urine creatinine clearance measurements. Medical management, dietary management, dialysis management, renal transplantation induce serum potassium levels. Administer antihypertension medications. Administer diuretics, thiazide, and loop diuretics. On treatment of anemia, erythropoietin, epigen, procrit, aranesp. On treatment of renal osteodystrophy, phosphate binders and supplemental vitamin D, dietary intervention to treat weight loss and both adipose and muscle tissue. On protein restriction, on fluid restriction 600 to 1000 ml, adjust according to urinary output and or dialysis, and sodium restriction. As indicated, diminished renal reserve and normal bun and serum creatinine levels, no signs or symptoms. And healthy kidney tissues compensate for diseased tissue in GFR 60% to 89% of normal. 228. Renal disorders, Part E. Renal failure, chronic, Stage 2. Renal insuffic INC. Renal failure, chronic, Stage 3. ND stage, renal failure. 229. NClex RN, flash review. Adult. Renal insufficiency and GFR is 25% of normal, and mild anemia, and bun and serum creatinine levels are elevated. Azotemia, decreased urinary creatinine clearance, and headaches, impaired urine concentration leading to nocturia, then polyuria. GFR less than 10% of normal, and severe azotemia, and hyperkalemia, hyperphosphatemia, hypernatremia, and metabolic acidosis, and altered renin-angiotensin system. In decreased erythropoietin production, urinary system-specific gravity of urine fixed at 1.010, proteinuria, casts, puria, hematuria, oliguria eventually leads to anuria less than 100 ml 24-hour. Endocrine system hyperparathyroidism, which causes hypocalcemia and hyperphosphatemia, resulting in demineralization of the bones, renal osteodystrophy. Hematological bleeding, anemia, and infection. System cardiovascular congestive heart failure, hypertension, atherosclerotic system heart disease, uremic pericarditis, pericardial effusion. Gastrointestinal anorexia, nausea, vomiting, uremic factor, GI bleeding, GI system peptic ulcer disease, gastritis, metabolic system hyperglycemia, hyperlipidemia, gout, hyponatremia, carbohydrate intolerance, neurological headaches, seizures, sleep disturbances, system musculoskeletal renal osteodystrophy, tissue calcification, system integumentary ecchymosis, uremic frost, yellow-gray discoloration, system pruritus. 230. Renal disorders. Part T. Risk factors. Intrarenal failure, kidney tissue disease. Risk factors. Post-renal failure, obesity problems. Risk factors. Renal failure, renal ischemia. 231. nclex RN flash review. Adult. Risk factor acute tubular necrosis infections diseases that precipitate vascular changes, signs and symptoms, hemolytic blood transfusion. Reaction. Nephritic chemicals, lead, mercury, carbon tetrachloride, nephrotoxic medications, streptomycin, aminoglycoside antibiotics and amphotericin B, radiology contrast material, acute glomerulonephritis, pyelonephritis, CMV, candidiasis, atherosclerosis, diabetes mellitus, hypertension, urinary and renal calculi, bladder cancer, neuromuscular disorders, benign prostatic hypertrophy, urethral strictures, trauma resulting in obstruction. Risk factor circulatory volume depletion, decreased cardiac output, decreased peripheral resistance volume, shifts vascular obstruction, signs and symptoms, hemorrhage, dehydration, pump failure and/or congestive heart failure, especially in older adult, septic shock, anaphylaxis, antihypertensive medications, third spacing of fluid, gram-negative sepsis, hypoalbuminemia, renal artery occlusion, dissection, abdominal aneurysm. Renal disorders. Part 2 specific gravity. Urinary, renal calculi. 233 adult, nclex RN flash review. Definition: a urine test that measures the ability of the kidneys to concentrate urine. Normal value is 1.016 to 1.022, may vary depending on laboratory. An increased reading, more concentrated urine, occurs with insufficient fluid intake, decreased renal perfusion, or increased antidiuretic hormone, ADH. A decreased reading, less concentrated urine, occurs with increased fluid intake, or diabetes insipidus. It may also indicate renal disease, or the kidney's inability to concentrate urine. Definition: stone formation. Anywhere in the urinary tract, the most common location for stones is in the pelvis of the kidney. Stones may be located through radiography of the kidneys, ureters and bladder, intravenous pyelography, CT scanning, and renal ultrasound. Common types of stones include calcium oxalate or phosphate stones, cystine stones, struvite stones, and uric acid stones. Causes: family history, infection, urinary stasis, immobility, dehydration, excessive diuretic usage, dehydration, hypercalcemia, and hyperparathyroidism. Diet high in calcium, vitamin D, protein, oxalate, purines, or alkali. Assessment findings: sudden, sharp, severe abdominal or flank pain, renal or ureteral colic, nausea and vomiting, pallor, and diaphoresis during episodes of pain, fever, hematuria, oliguria, or anuria. Suggests obstruction, treat immediately. Treatment: nursing interventions, monitor vital signs and intake and output. Increase fluid intake to 3,000 ml day, aids in passage of stones. Assess for fever, chills, infection. Initiate intravenous fluid administration as prescribed. Administer pain medications as prescribed. Morphine or hydromorphone dilaudid. Strain all urine. If stone passes, send to laboratory for analysis. Special considerations: complications include recurrent stone formation, infection, or renal failure. Dietary modifications are based on the type of stone present. 234. Renal disorders. Part T. Urinary renal calculi. Dietary anti-medical MNAGMNT of 235. nclex RN flash review. Adult. Stone type: calcium oxalate stones, calcium phosphate stones, cystine stones, struvite stones, uric acid stones. Dietary management: and acid diet, and decrease foods high in calcium and avoid oxalate food sources. An acid diet, and decrease foods high in calcium, phosphate, and vitamin D. Alkaline diet, avoid eggs, cheese, milk, and meat. An acid diet, and decrease foods high in phosphate. Increase fluid intake too. 3L day, unless contraindicated. An alkaline-ash diet, when decreased foods high in purine. Medication management, allopurinol, pyridoxine, vitamin B6, and phosphates, thiazide diuretics, allopurinol, xyloprim, antibiotics, allopurinol, calcium stones, cystine stones, struvite stones, uric acid stones, most common type, occur more often in men than in women, and usually appear between the ages of 20 and 30, recurrent. Calcium can combine with other substances, such as oxalate, the most common substance, and phosphate to form the stone. Oxalate is present in certain foods. Diseases of the small intestine increase the risk of forming calcium oxalate stones. Can form in people who have cystinuria. This type of stone runs in families and affects both men and women, mostly found in women who have a urinary tract infection. These stones can grow very large and can block the kidney, ureter, or bladder. More common in men than in women. Occurs with gout and chemotherapy. 236. Renal disorders. Part E. Urinary system common abnormalities, AS-SMNTI. Urinary system common abnormalities, AS-SMNT. Second 237. Adult. nclex RN. Flash review. Possible etiology and finding description significance. Anuria, technically no urination, acute renal failure, end-stage 24-hour urine output renal disease, bilateral ureteral less than or equal to 100 ml obstruction, chemical cystitis, painful or difficult use of spermicides, diaphragm, urination, excessive douching, dysuria, painful or difficult sign of urinary tract infection, urination, UTI, and interstitial cystitis, and a variety of pathologic conditions, enuresis, involuntary nocturnal symptomatic lower urinary tract urinating disorder, frequency increased incident of acutely inflamed bladder, retin urinating con with overflow, excess fluid intake, hematuria, blood in the urine, cancer of the genitourinary tract, blood dyscrasias, renal disease, UTI, stones in the kidney or ureter, medications, anticoagulants, incontinence, inability to voluntarily, neurogenic bladder, bladder control, discharge of infection, injury to external urine sphincter, possible etiology and finding description significance, nocturia, frequency of urine at renal disease with impaired night concentrating ability, bladder obstruction, heart failure, diabetes mellitus, oliguria, diminished amount of severe dehydration, shock, urine in a given time, transfusion reaction, kidney 24-hour urine output of disease, end-stage renal 100 to 400 ml disease, polyuria, large amount of urine in a diabetes mellitus, diabetes given time insipidus, chronic renal failure, diuretics, excessive fluid intake, retention, inability to urinate, even finding after pelvic surgery, though bladder contains childbirth, catheter removal, excessive amounts of urine, neurogenic bladder, stress, inconta, involuntary urination with weakness of sphincter control, NENS, increased pressure, sneezing or coughing. 238. Renal disorders. Part 2, urinary tract infection, UTI. 239. Nclex of the urine in the bladder and reflux of urine back into the original reservoir are the primary causes of these infections. Some common microorganisms causing the infections include Escherichia coli, most common, Enterococcus, Klebsiella, and Staphylococcus. There are two types, upper and lower. Upper, pyelonephritis, is an inflammation of the renal pelvis and the parenchyma of the kidneys. Lower, cystitis, inflammation, infection of the bladder, and urethritis, which is inflammation of the urethra. 240. Respiratory disorders. Part 11. Acute respiratory distress syndrome, ARDS, asthma. 241. Adult, nclex RN, flash review. Definition: a condition characterized by increased capillary permeability in the alveolar capillary membrane, resulting in fluid leaking into the interstitial spaces and the alveoli, and a decrease in pulmonary compliance. Causes: sepsis, fluid overload, trauma, shock, burns, neurological injuries, aspiration, pneumonia, embolism, shock. Assessment findings: tachycardia, tachypnea, dyspnea, increasing hypoxia not responsive to increased levels of fraction of inspired O2, VO2, refractory hypoxia. Treatment: nursing interventions, identify and treat the underlying cause, maintain oxygenation via high levels of concentration or endotracheal intubation, and mechanical ventilation with positive end expiratory pressure, PEEP, suction client as needed, obtain and evaluate arterial blood gas, ABG results, restrict fluid intake as ordered, evaluate hemodynamic pressure monitoring values, and provide adequate nutritional support to meet the client's increased metabolic needs. Administer diuretics, anticoagulants, paralytics, or corticosteroids as prescribed. Special considerations: clients are treated in the intensive care unit. ABG levels identify respiratory acidosis. Chest X-ray shows bilateral interstitial and alveolar infiltrates. Definition: chronic inflammatory disorder of the airways that causes varying degrees of obstruction in the airways, marked by inflammation and hyperresponsiveness to a variety of stimuli or triggers. Causes recurrent episodes of wheezing, breathlessness, chest tightness, and coughing associated with airflow obstruction that may be resolved spontaneously. It is often reversible. Causes: environmental factors, physiological factors, medications, occupational exposures, and food additives. Assessment findings: restlessness, wheezing or crackles, absent or decreased breath sounds, use of accessory muscles while breathing, tachypnea, hyperventilation, prolonged exhalation, cyanosis, decreased oxygen saturation. Treatment: nursing interventions, acute interventions, place in high Fowler's position, administer O2 as ordered, stay with client to offer support and decrease anxiety, administer bronchodilators as prescribed, auscultate lungs before, during, and after treatment. Special consideration: status asthmaticus is a severe, life-threatening attack that must be treated immediately. 242. Respiratory disorders, Part 11. Breath sounds, 243. nclex RN flash review. Adult. Type location: bronchial tracheovesicular peripheral lung tissue. Bronchovesicular main stem bronchi. Wheezes can be heard anywhere. Raunchy central airways pleural friction rub. Lateral lung field rails can be heard anywhere. Stridor louder in the neck. Description: normal. Loud, high-pitched, harsh. Expiration greater than or equal to inspiration. Normal. Soft swishing, low-pitched, may sound like a breeze. Inspiration greater than or equal to expiration. Normal. Soft, blowing. Inspiration equal to expiration. Abnormal, high-pitched, musical whistling sound may be heard on inspiration and expiration. Abnormal, coarse rumbling, low-pitched snoring sound may be heard with inspiration and expiration. Abnormal, grating or squeaking may sound like pieces of sandpaper being rubbed together, heard on inspiration and expiration. Abnormal, soft crackling, bubbling sound. Abnormal, high-pitched, crowing sound. 244. Respiratory disorders, Part 11. Bronchitis, chronic. Chest physiotherapy, CPT procedure. 245. nclex RN flash review. Adult. Precipitating nursing characteristics, factors, assessment findings, interventions, and chronic and smoking, interalized CYA, lowest FiO2 paucis sputum with nosis BLE to prevent CO2 cough pro and blue retention. Induction on right-sided heart, a monitor for fluid, a daily basis failure overload. For 3 months and distended neck and maintain POW2 Beper-year veins between 55 and 60, and in chronic and crackles and teach pursed lip hypoxia, core and expiratory wheezes, breathing, and pulmonella independent edema, diaphragmatic increased in normal weight or breathing. Mucus, cilia overweight and teach tripod production position, increased administer bronchial bronchodilators, wall thickness corticosteroids, and reduced mucolytics, and sponsiveness antibiotics as of Respira prescribed. Torrey Center to instruct client on hypoxemic the proper use of stimuli, oral and inhaled medications. 1. Perform during morning hours, 1 hour prior to meals or 2 to 3 hours after meals. 2. If the client experiences pain, stop immediately. 3. If the client is receiving tube feedings, stop the feedings and aspirate the residual before beginning therapy. 4. Administer bronchodilator medication 15 minutes before if indicated. 5. Assure there is a layer of material between the hands or percussion device and the client's skin. 6. Position client for postural drainage based on respiratory assessment. 7. Percuss the area for 1 to 2 minutes. 8. Vibrate the same area while the client exhales 4 to 5 deep breaths. 9. Monitor client's respiratory status tolerance for therapy. Stop immediately if cyanosis or exhaustion occurs. 10. Have the client maintain the position for 5 to 20 minutes post-therapy. 11. Repeat in all necessary positions until the client no longer expectorates mucus. 12. Properly dispose of sputum. 13. Assist the client with mouth care post-therapy. 246. Respiratory disorders. Part D. Congestive obstructive pulmonary disease COPD. Definition, Reflash review. Adult. Definition refers to a group of lung diseases that block airflow as clients exhale and make it increasingly difficult to breathe. Emphysema and chronic asthmatic bronchitis are the two main conditions that make up this disease. In all cases, damage to the airways eventually interferes with the exchange of oxygen and carbon dioxide in the lungs. This disease is a leading cause of illness and death worldwide. Causes include long-term smoking, and it can be prevented by not smoking or quitting soon after clients start. This damage to the lungs is irreversible, thus treatment focuses on controlling symptoms and minimizing further lung damage. Precipitating nursing characteristics factors assessment interventions are reduced in cigarette and paint puffers. Lowest VO2 gas exchange. Barrel chest belay to prevent CO2 surface area, environ pursed lip retention. Increased air mint and breathing and monitor for fluid trapping or AQ and distant quiet overload, and decreased capil-passional breath sounds. Maintain POW2 biliary network exposure, wheezes between 55 and 60, increased work, genetic and pulmonary bend teach pursed lip, increased O2 blebs on X-ray breathing and consumption and anorexia, with diaphragmatic weight loss, breathing. Thin and appeared in teach tripod ants position, tripod posy, administer bronchoning chodilators, corticosteroids, mucolytics, and antibiotics as prescribed. Instruct client on the proper use of oral and inhaled medications. 248. Respiratory disorders. Part I. Hemothorax, Legionnaire's disease. 249. Adult, nclex flash review. Definition, presence of blood in the pleural cavity related to trauma or a ruptured aortic aneurysm. 1. Instruct the client to take a sitting upright position. 2. Instruct the client to place his or her mouth tightly around the mouthpiece of the device. 3. Instruct the client to inhale slowly to raise and maintain the flow rate indicator between the 600 to 900 markings. 4. Instruct the client to hold his or her breath for 5 seconds and then exhale through pursed lips. 5. Instruct the client to repeat the process 10 times every hour. Definition, a severe form of pneumonia, lung inflammation usually caused by infection. Causes, Legionella pneumophila and inhaling bacteria. Older adults, smokers, and clients with weakened immune systems are particularly susceptible. Sources of the organism include contaminated cooling water and warm stagnant water supplies, including water vaporizers, water sonicators, showers, and whirlpool spas. Assessment findings, influenza-like symptoms with chills, high fever, muscle aches, and headache that may progress to pleurisy, dry cough, and occasionally diarrhea. Treatment, nursing interventions. Treatment is supportive. Antibiotic therapy may be initiated. Special considerations, the risk for infection is increased by the presence of other conditions. Left untreated, Legionnaire's disease can be fatal. 250. Respiratory disorders. Part E. Lung C. Anchor, MEHN egal ventilation, controls and D settings. I. 251. Adult, nclex flash review. Definition, malignant tumor of the bronchi and peripheral lung tissue. The lungs are a common target for metastasis from other organs. There are two main types of lung cancer based on histological cell type: small cell lung cancer, SCLC, and non-small cell lung cancer, NSCLC. Causes, cigarette smoking, occupational exposure to and/or inhalation of carcinogens. Assessment findings can be nonspecific. Symptoms appear late in the disease. Dyspnea, pain on swallowing, chronic cough, hoarseness, hemoptysis, chest pain, anorexia and weight loss, weakness, recurring fever. Treatment, nursing interventions, radiation, chemotherapy, lobectomy, pneumonectomy, lung-conserving resection. Treatment can include all three therapies: radiation, chemotherapy, and surgery. Controls and settings. Tidal volume, rate, size, fraction of inspired oxygen. FiO2, description: the volume of air that the client receives with each breath. The number of breaths delivered by the ventilator per minute. The volume of air that is 1.5 to 2 times the set tidal volume delivered 6 to 10 times per hour may be initiated to prevent atelectasis. The oxygen concentration delivered to the client, determined by the client's medical status and arterial blood gas ABG results. 252. Respiratory disorders. Part E. nclex ventilation. Controls and D settings. Second. 253. nclex flash review. Adult. Controls and settings. Peak airway inspiratory pressure. Continuous positive airway pressure. Positive end expiratory pressure. PEEP description: the pressure required by the ventilator to deliver a set tidal volume at a given compliance. Monitoring peak airway inspiratory pressure reflects changes in compliance of the lungs and resistance in the ventilator or the client. The application of positive airway pressure throughout the entire respiratory cycle for spontaneously breathing clients acts to keep the alveoli open during inspiration and prevents alveolar collapse, often used as a weaning modality. No ventilator breaths are delivered, but the ventilator delivers oxygen and provides monitor and an alarm system. The respiratory pattern is determined by the client's efforts. Positive pressure is exerted during the expiratory phase of ventilation, which improves oxygenation by enhancing gas exchange and preventing atelectasis. Clients are routinely placed on PEEP initially at 5 centimeters H2O to increase functional residual capacity FRC. Higher amounts of PEEP greater than or equal to 15 increase the chance for the client to experience barotraumas and/or a pneumothorax. Pressure support. Pressure support PS provides a positive pressure that's applied to the airway during inspiration and is used with the client's own spontaneous respirations to augment breathing. 254. Respiratory disorders. Part 11. Mechanical ventilation, modes of pneumonia. 255. Adult. nclex flash review. Controlled assist control. AC synchronized intermittent mandatory ventilation SIMV, least used mode. The client receives a set tidal volume at a set rate, used in clients who cannot initiate respiratory effort. If the client attempts to initiate a breath, the ventilator blocks the effort. Commonly used mode. Tidal volume and ventilatory rate are preset on the ventilator. Ventilator takes over the work of breathing for the client, is programmed to respond to the client inspiratory effort if the client does initiate a breath, and delivers the preset tidal volume when the client initiates a breath, while allowing the client to control the rate of breathing. If the client's spontaneous ventilatory rate increases, the ventilator continues to deliver a preset tidal volume with each breath, which may cause hyperventilation and respiratory alkalosis. Similar to AC in that the tidal volume and ventilatory rate are preset on the ventilator. SIMV permits the client to breathe spontaneously at his or her own rate, and tidal volume between the ventilator breaths can be utilized as the primary mode or as a weaning mode. When used as a weaning mode, the number of SIM breaths is decreased gradually, and the client gradually resumes spontaneous breathing. Definition: an acute inflammatory process caused by a microbial agent. It involves the lung parenchyma, including the small airways and alveoli. The edema associated with inflammation stiffens the lung, decreases lung capacity, and causes hypoxia. It can be community-acquired or hospital-acquired. Causes: predisposing conditions, chronic upper respiratory infections, smoking, aspiration of foreign or gastric content. Viral causes: influenza, parainfluenza. Bacterial causes: Streptococcus pneumonias, Mycoplasma pneumonia, Staphylococcus aureus. Assessment findings: fever, chills, tachycardia, dyspnea, productive cough, thick blood-streaked yellow purulent sputum, chest pains, respiratory distress, rhonchi and wheezing. Treatment: nursing interventions. Position: client in high Fowler's position. Respiratory precautions as indicated: cool mist, O2, postural drainage, administer bronchodilators, antipyretics, antibiotics, bronchodilators, cough suppressants, mucolytic agents, and expectorants as prescribed. Encourage coughing and deep breathing exercises and the use of incentive spirometer, and provide chest physical therapy. Special considerations. Teach the client the importance of proper hand washing, disposing of respiratory secretions properly, and receiving vaccinations such as the flu and pneumonia immunizations. 256. Respiratory disorders, Part 11, pneumothorax, nclex RN flash review. Adult. Definition: presence of air within the pleural cavity. Occurs spontaneously or as a result of trauma. Pressure builds up in the pleural space, lung on the affected side collapses, and the heart and mediastinum shift toward the unaffected lung. There are 3 types: open, spontaneous, and tension. Open occurs when an opening through the chest wall allows the entrance of positive atmospheric air pressure into the pleural space. Spontaneous occurs with a rupture of a pulmonary bleb. Tension occurs from blunt trauma to the chest wall, or mechanical ventilation with positive end, expiratory pressure PEEP, when a buildup of positive pressure occurs in the pleural space. Definition: movement of a thrombus from its original site of origin to the lungs causes prolonged immobility, advanced age, surgery, especially joint replacements of the hip and knee, heart disease, cancer, pregnancy, smoking, obesity, supplemental estrogen. Assessment findings: mild. Mimic those of pleurisy or bronchial pneumonia, dyspnea, pleuritic pain, tachycardia, elevated temperature, cough with hemoptysis, severe chest pain, severe dyspnea leading to air hunger, shallow rapid respirations, sharp substernal chest pain, vertigo leading to syncope, hypovolemia, cardiac dysrhythmias, weakness, severe anxiety, and hypotension. Treatment: nursing interventions, maintain patent airway, place client in high Fowler's position, apply oxygen as ordered, assist with intubation as indicated, monitor pulse oximetry, arterial blood gases, and breath sounds, encourage client to cough and deep breathe. Vital signs every 2 to 4 hours, turn and reposition client as ordered, administer anticoagulants, that is heparin a fourth, diuretics, and narcotic as prescribed. For acute right ventricular failure or refractory hypoxia, administer thrombolytics, that is TPAW, streptokinase treatment with thrombolytic with or without ultrasound, directly into clot. Surgical intervention: femoral vein ligation, pulmonary embolectomy, vein filter, is indicated when client is unresponsive to heparin therapy. Special considerations: prevention measures, ambulate client as soon as possible after surgery, complete range of motion exercises, and apply compression stockings. Respiratory disorders, Part 11. Tuberculosis, TB. Tuberculosis, client education for 259. Adult, nclex RN flash review. Definition: an inflammatory, highly communicable disease that most commonly attacks the lungs, although it can occur in other parts of the body: brain, kidney, liver, joints, intestines, and peritoneum. Causes: Mycobacterium tuberculosis, a gram-positive acid-fast bacillus. Assessment findings: up to 20% of clients may be asymptomatic. Subjective data includes loss of appetite, weight loss, weakness, loss of energy, pain, knife-like in the chest. Client may be asymptomatic, but disease is found through screening measure. Objective data: night sweats, low-grade, late afternoon fever, tachycardia, productive cough with hemoptysis, increased depth of respirations, asymmetrical lung expansion, increased tactile fremitus, and crackles following short cough. Treatment: nursing interventions, administer commonly used medications as directed, isoniazid, rifampin, rifadin, avoid direct contact with sputum, promote nutrition, increase client self-esteem, promote health teaching, and ensure respiratory isolation. Special considerations: respiratory isolation for infectious diseases is critical. Clients must be assessed for their ability to comply with prescribed therapy. Diagnosis is based on a variety of factors, including chest assessment, chest X-ray, quantiferon TB gold test, sputum cultures, and the Mentos skin test. 1. Speak to client and family about the contagious aspect of the infection and provide the client family with information about TB. 2. Relay to client family to follow the medication regimen exactly as prescribed. 3. Discuss with client family the side effects related to the medication regimen and ways of minimizing them to obtain assure compliance. 4. Offer the client family reassurance that after 2 to 3 weeks of medication therapy, they will likely not be able to affect anyone. 5. Reassure the client family that resuming activities gradually is acceptable. 6. Instruct client family about the importance for adequate nutrition in an effort to promote healing. 7. Inform the client and family that respiratory isolation is not necessary because family members have already been exposed. 8. Direct client to cover mouth and nose when coughing and sneezing and to dispose of tissues in a plastic bag. 9. Instruct client that once medication regimen is begun, a sputum culture is needed every 2 to 4 weeks. 10. Inform the client that once the results of 3 sputum cultures are negative, he or she is no longer considered infectious and can resume working. 260. Respiratory disorders. Part 11. Tuberculosis. Risk factors. Causes of nclex review. N greater than or equal between the ages of 22 and 44, and greater than or equal to 65 years of age. Individuals who abuse alcohol or use intravenous drugs. Individuals in institutions, for example, prisons, long-term facilities, and mental health facilities. Homeless individuals, or those from minority, refugee, or lower socioeconomic groups. Individuals with malnutrition, immune dysfunction, human immunodeficiency virus or other infection, or who are immunosuppressed as a result of medication therapy. 262. Obstetrics, antepartum, Part V, ballottement. 265. nclex flash review. Obstetrics, definition, passive movement of the fetus that occurs when the lower segment of the uterine wall is tapped during a bimanual exam. The fetus rises and can be felt as it touches the abdominal wall. Ballottement is a probable sign of pregnancy. 0-1-2-3 cervical dilation, cm 0-1-2-3 to 4 greater than 5 cervical effacement and 5 cervical of 50-60 to 70 greater than 80 cervical consistency firm, medium soft, cervical position posterior mid-position anterior. Presenting part station 3 to 2, 1 plus 1 to plus 2. A total score of 8 or greater indicates that the cervix is ready for induction of labor. Definition, uterine contractions that are mild, irregular, and typically not felt in the back. They begin early in the pregnancy and increase in frequency after 28 weeks. Unlike contractions of true labor, Braxton Hicks contractions do not cause cervical effacement or dilation, and they can be diminished by eating, changing positions, or ambulating. Antepartum. Part 3rd Chadwick sign Goodell sign GTPL. 267. nclex flash review. Obstetrics. Definition, a bluish discoloration of the vagina, cervix, and vulva that can be observed at approximately 6 to 8 weeks gestation. It is considered a probable sign of pregnancy. Definition, a softening of the cervix that can be felt at approximately 6 to 8 weeks gestation. It is considered to be a probable sign of pregnancy. Term definition G gravida, number of times that a woman has been pregnant, including current pregnancy T number of pregnancies carried to term, less than or equal to 38 weeks term, P para number of infants delivered at or above the age of viability, approximately 20 to 24 weeks A. Abortion number of times a pregnancy was ended by abortion, either spontaneous or induced living number of children currently alive. Antepartum, Part 3rd morning sickness, hyperemesis gravidarum, 269, nclex flash review. Obstetrics. Definition, softening of the lower segment of the uterine consistency. It is considered to be a probable sign of pregnancy. Morning sickness, hyperemesis gravidarum signs, and transient nausea, occurring severe nausea and vomiting. Symptoms, anytime during day. Dehydration, usually diminishes after first decreased weight, month but may be present oliguria throughout the pregnancy. Electrolyte imbalance. Treatment dry crackers 15 minutes B cessation of nausea and vomit for getting out of bed. ING. Small frequent meals, IV fluids, water between meals, not electrolyte replacement. With meals. Eating guidelines for morning avoid smells, foods that cause sickness. Nausea. Definition utilized to determine the estimated due date ADAD by employing the following steps. Determine the first day of the woman's last menstrual period, LMP. Add 1 year. Subtract 3 months. Add 7 days to that date. Example, LMP, first day, plus 1 year, subtract 3 months, add 7 days, EDD. March 8, December 8, December 15, December 15. Antepartum, Part 3, Nutrition, Prenatal Visits, Psychological Tasks. 271, nclex Flash Review. Obstetrics. Calories, protein, meat, breads, grains, fruits, vegetables, dairy, folic acid, vitamins, seafoods, to avoid foods to limit increase by 300 calories per day. 2 to 3 3-ounce servings, day 6 to 11 servings, day 2 to 4 servings, day 4 plus servings, day 4 servings, day 600 to 800. MCG, day 70 85 milligrams, day raw or undercooked eggs and meats, raw fish, swordfish, king mackerel, tilefish, shark, soft cheeses, alcohol, street drugs. Tobacco, caffeine to 200 milligrams day. Gestational weeks 4 through 32, 32 to 36, 36, until labor, delivery assessments, frequency monthly, every other week. Weekly urine analysis for albumin, glucose, protein, weight, fundal height. After 12 to 13 weeks, fetal heart rate. After 10 to 12 weeks, signs and/or symptoms of discomforts of pregnancy, signs and/or symptoms of complications, anticipatory guidance. First trimester, second trimester, third trimester, resolve any ambivalence about pregnancy, and maternal acceptance of physical changes, maternal acceptance of impending fatherhood, and development of prenatal attachment, and mother and father image development, repair for birth experience, repair for parenting, accept body image. 270. Antepartum, Part 3rd, Quickening, Signs of Pregnancy. 273. nclex Flash Review. Obstetrics. Definition: quickening refers to the first fetal movements that are felt by the mother. Pregnant women often describe the sensation as a fluttering or bubbling. Quickening occurs between the 16th and 26th weeks of pregnancy, but most frequently is experienced between the 18th and 22nd week. Quickening is considered to be a presumptive sign of pregnancy. Definition: also known as isoimmunization, Rh incompatibility occurs when the pregnant woman is Rh negative and her fetus is Rh positive. Usually the Rh negative woman carries her first Rh positive child without incident, unless she is exposed to the fetal blood. Causes: Rh positive blood cells from the fetus enter the maternal blood circulation, causing maternal sensitization through the formation of antibodies. The antibodies then cross the placenta and enter the fetal bloodstream, causing hemolysis, hypoxia, and fetal death. Assessment findings: anti-D antibody titer of 116 or greater. Treatment: the goal of treatment is to prevent Rh isoimmunization from occurring. RhoGAM is usually given at 28 weeks gestation and after exposure to fetal blood. It is also given within 72 hours of delivery. Special consideration: the woman should also be given a card to carry identifying her as Rh negative. Type: presumptive signs, probable signs, positive signs. Signs: symptoms: breast tenderness, tingling, enlargement, morning sickness, missed period, amenorrhea. Frequent urination, fatigue, quickening, stria gravidarum, stretch marks, Goodell's sign, Heger's sign, Chadwick's sign, ballotment, Braxton Hicks contractions, fetal heart beat, sonographic evidence of fetus, palpation of fetal movement through abdomen. 274. Antepartum, Part 3rd system, cardiovascular system, gastrointestinal system, genitourinary. 275. nclex Flash Review. Obstetrics. Heart rate, oscillatory, blood pressure, blood volume, cardiac output, coagulation increases 10 to 15 beats, min. In second trimester increases 15 to 20 beats, min. In third trimester and split S1 may be noticed, and S3 may be heard after 20 weeks gestation. Considered within normal limits if less than 140/90ths. Increases by approximately 40%. Increases by 50% due to increased tissue demand and increased stroke volume. And in side-lying position increases cardiac output, and a lying on back decreases cardiac output. Uncoagulation factor I increases by 50% to prevent maternal hemorrhage during childbirth, but also puts woman at risk for deep vein thrombosis, DVT. Gums, stomach, intestines, gallbladder, and increased vascularity may cause gums to become edematous and bleed easily. motility decreases, causing an increase in emptying time. As uterine enlarges, it displaces the stomach and further slows emptying time. When acidity decreases, when delayed emptying time may lead to heartburn. Motility decreases, uterine enlargement displaces intestines, slowing peristalsis, when may lead to heartburn, constipation, flatulence, hemorrhoids. Emptying time increases. Increased tendency for gallstones, bladder, kidneys, uterus, cervix, vagina, urinary frequency in the first and last trimesters. Increased glomerular filtration leads to increased filtration of glucose, which sometimes is excreted into urine. Finding more than a trace of glucose in the urine is considered abnormal. Increases in size and softens, and vascularity increases, causing the cervix to take on a bluish hue, Chadwick's sign. And pregnant women may notice bleeding after sexual activity. It develops bluish hue when pregnant women are prone to yeast infections due to increased acidity of vaginal secretions. 270. System. Antepartum. Part 3. System. Integumentary. System. Respiratory. 277. Obstetrics. Stria gravidarum. Linea nigra. Melasma. Palmar erythema. Epilide spider nevi. Stretch marks. Appear as pink or red streaks. Dark line that forms from the umbilicus to the mons pubis. Darkened areas that form on the cheeks and nose after the 16th week. Also known as the mask of pregnancy. Pinkish areas over the palmar surface of the hands. Raised red painful areas on the gums. Bright red angiomas. Rectus abdominis diastasis. Pelvic, sacroiliac, sacrococcygeal joints. Wrist. Separation of rectus abdominal muscle can occur due to stretching of abdominal wall to accommodate increasing size of uterus. Relaxation of the joints causes changes in posture and gait. Relaxation of the pelvis may lead to increased pain in nullipara women. Carpal tunnel syndrome may occur. nclex flash review. Respiratory rate. Epistaxis may increase by 2 breaths per minute above baseline during 3rd trimester. Shortness of breath, SOB, is common due to decreased ability of diaphragm to expand because of increasing size of uterus, may occur due to increased vascularization of upper respiratory tract. 278. Antepartum. Part 3. Weight gain distribution. 279. nclex flash review. Obstetrics. Recommended weight gains. Normal weight pre-pregnancy, 25 to 32 pounds. Underweight pre-pregnancy, 27 to 39 pounds. Overweight pre-pregnancy, 15 to 25 pounds. Weight loss during pregnancy is discouraged. Weight in pounds 2, 4 to 5, 1 to 4, 3 to 5, 7 to 8, 2 to 2.5. 2 amniotic fluid blood volume breasts. Extracellular fluid fetus, average weight, placenta uterus. Remainder of weight gain is deposited in maternal fat stores. 280. Intrapartum, Part E. Amniotic fluid DCH characteristics. Cervical dilation. 281. nclex flash review. Obstetrics. Amount at term character odor color normal. Between 500 and 1000 ml oleohydramnios. Less than 500 ml polyhydramnios, greater than 2000 ml normal. Thin infection, thick normal. Odorless infection, odor present normal. Clear white flecks may be present. Fetal distress. Green or meconium stained abruptio placenta. Port wine infection, yellow. Descent flexion, internal rotation, extension, external rotation, expulsion, downward movement of the fetus. Fetal head bends to chest to present the smallest diameter. Head enters pelvis, then rotates 90 degrees so that the back of the neck can proceed under symphysis. Head passes through pelvis through symphysis pubis. Upward resistance from pelvic floor causes head to extend, allowing occiput, brow, face, and chin to emerge. Turning of shoulders so that they are in antero-posterior diameter of pelvis, the shoulders are then delivered. Birth of entire body. Definition refers to the opening of the cervix from 0 to 10 centimeters to accommodate delivery of the fetus. Cervix dilation occurs during the first stage of labor. Intrapartum. Part 111. Cervical effacement, cesarean delivery, pain relief, non-pharmacological. 283. nclex flash review. Obstetrics. Definition refers to the thinning of the cervix during the labor process. Effacement progressively shortens the cervix until there is no length and it is paper thin. Occurs during the first stage of labor. Definition: surgical birth of the fetus may be planned or unplanned. Causes: placenta previa, premature rupture of membranes prom, transverse or breech presentation. Cephalopelvic disproportion, active genital herpes, previous cesarean birth, fetal distress, preeclampsia, eclampsia, inadequate progression of labor. Assessment findings: ultrasonography reveals malposition of fetus, cephalopelvic disproportion, fetal distress. Nursing interventions: pre-op, educate and provide support to parents. If planned C-section, complete preoperative teaching, begin IV infusion, type and cross-match as ordered. Post-op, fundal checks, check perineal pad and abdominal dressing, ensure mother-infant bonding, monitor vital signs including pain level, encourage cough and deep breathing, as well as early ambulation. Special consideration: allow mother to see, touch, and hold infant as soon after delivery as possible to promote bonding. Relaxation techniques: positioning, focusing and imagery, therapeutic touch, music therapy, support a birthing partner. Most effective in the early phases of labor. Breathing techniques: each type of breathing starts and ends with deep Lamaze method cleansing breaths, includes slow, deep breaths in and out, pant below pattern hee-hee-hoo, and or continuous panting. Intrapartum. Part 3rd, pain relief, pharmacological, passageway passenger. 285. nclex flash review. Obstetrics. Opioids: meperidine, demerol, butorphanol, stadol, nalbuphine, nubane, fentanyl sublimase, may relax cervix, may depress central nervous system of fetus. Meperidine given IM, IV, or intrathecally. Sedative and antispasmodic, given when woman is more than 3 hours from birth to prevent fetal respiratory depression. Regional nerve can lower woman's BP, may slow labor if given before 5 centimeters diblocylation, may decrease bearing down reflex and ability to push. Epidural used in first and second stages usually preserves bearing down reflex. If contractions become less frequent, intense, or shorter in duration, notify MD immediately. Position woman in modified SIMS to receive the epidural. Pudendal nerve short duration, used for actual birth and perineal repair, does block, not depress neonate, but may inhibit bearing down reflex. Definition: one of the 4 P's are major factors that interact for a safe delivery. It refers to the birth canal. The subpubic angle of the pelvis must be wide enough to allow the presenting part of the fetus to pass under it. Pelvic shapes include gynecoid, round conducive to vaginal birth, platypeloid, flat conducive to vaginal birth, android, heart not conducive to vaginal birth, anthropoid, oval not conducive to vaginal birth. One of the 4 P's are major factors that interact for a safe delivery. It refers to presentation: first fetal part entering into pelvic inlet. Cephalic, head first, most common. Breech may need cesarean section, complete, feet and legs flexed, buttocks and feet present. Frank, feet up on shoulders, buttocks present. Footling, one or both feet present. Fetal lie relationship of fetal spine to maternal spine, transverse, shoulder presents. Longitudinal, vertex or breech presentation, attitude relationship of fetal parts to one another. Example: fetal head flexed to chest. Position relationship of presenting part to quadrants within maternal pelvis. Example: anterior occipital on maternal left side, lower. 286. Intrapartum. Part T, powers of labor. 287. nclex flash review. Obstetrics. Definition: one of the 4 P's are major factors that interact to allow a safe delivery. It refers to the strength and effectiveness of uterine contractions. Definition: one of the 4 P's are major factors that interact for a safe delivery. It refers to the woman's emotional state during labor. The emotional response of a woman impacts her physiological and psychological functioning during labor and may impede or facilitate the labor process. Lightning, nesting, Braxton Hicks, decreased weight, bloody show. Cervical changes, rupture of membranes, engagement of the fetal head in the pelvis. Takes place 2 weeks before labor in primiparas, but often not until labor begins in multiparas. May cause increased pressure on the bladder, resulting in urinary frequency. Urge to clean the house, prepare the nursery, or do other things to prepare the nest for the arrival of the baby. increase in strength and frequency. Hormonal changes decrease water retention, passage of blood-tinged mucus from the vagina. Labor may begin in 24 to 48 hours. Cervix is shorter, softer, and may be dilated 1 to 2 centimeters. Maybe a gush or a trickle. Mother should be advised to come to hospital, as labor may begin within 24 hours. 288. Intrapartum. Part E. Stage of labor. First. 289. nclex flash review. Obstetrics. First stage of labor. Latent phase. Active phase begins with onset of true labor and ends when cervix is completely effaced and dilated to 10 centimeters. Contractions are regular with a frequency of 5 to 15 minutes, duration of 10 to 30 seconds, and mild intensity, station 2 to 1. Cervix dilates from 3 or 4 centimeters to 8 centimeters. Fetus descends through birth canal to 0 or +1 station. Contractions 3 to 5 minutes apart with duration of 30 to 45 seconds, moderate intensity. Cervix dilates from 8 to 10 centimeters. Transition phase contractions occur every 1.5 to 2 minutes, last 60 to 90 seconds, and have a strong intensity. Nursing intervention station +1 to +2. Assess vital signs, contractions, fetal heart rate, bladder distension, cervical changes. Keep NPO nothing by mouth. Reinforce breathing, relaxation techniques. Care for symptoms. Administer pain medications as ordered. Provide support. Definition: from cervical dilation of 10 centimeters to delivered infant. Assessment findings: contractions every 2 to 3 minutes, lasting 60 to 90 seconds. Maternal urge to push. Visibility of presenting part. Bulging perineum. Increased bloody show. Nursing interventions: monitor maternal vital signs and fetal heart rate. Pad stirrups. Raise both legs simultaneously into stirrups. Cleanse vulva and perineum as needed. Provide oxygen if decreased fetal heart rate. Encourage mother to take a deep breath before pushing and to push as long as possible with each contraction. Involve father, where to stand, what is occurring. Special consideration: mother may need to be catheterized if distended bladder prevents fetal descent. Definition: delivery of infant to delivery of placenta. Assessment findings: signs of placental separation. Umbilical cord lengthens, uterus rises upward in abdomen and changes shape. Sudden trickle of blood. Nursing interventions: position infant with mother to encourage eye-to-eye contact and bonding. Provide support to parents, splint or support abdomen as mother expels placenta. Inspect placenta to ensure that it is intact. Assess fundus, should be midline and just below umbilicus. Special considerations: maternal trembling common. No clinical significance. Umbilical cord should have 2 arteries and 1 vein. 290. Intrapartum. Part 3rd stage of labor, 4th station. 291. nclex flash review. Obstetrics. Definition: expulsion of placenta 1 to 4 hours after delivery of fetus. Assessment findings: firm fundus, BP returns to pre-delivery level, pulse slightly lower than during delivery. Nursing interventions: assess maternal vital signs, assess amount and character of vaginal blood flow, assess fundus for location, firmness. Assist woman to stand for first of several times and assist with ambulation. Provide comfort and support. Special considerations: lowered blood pressure and rising pulse may be indicative of increased blood loss. Denotes the relationship between the presenting fetal part and the ischial spine of the maternal pelvis. The following table identifies and defines common terms related to station. 0 station presenting part is at level of the spines. 1, 2, 3 station level of presenting part is above spines and cm. +1, +2, +3 station level of presenting part is below spines and cm. High station presenting part is not engaged. Floating presenting part is able to move freely within pelvis. Dipping entering into pelvis. Engaged presenting part pass through pelvic inlet. Fixed no longer movable. Engaged. Definition: to determine the frequency of contractions, time it from the beginning of one contraction to the beginning of the next. To determine the duration of the contraction, time it from the beginning of the contraction to cartopertum. True versus 293. nclex flash review. Obstetrics. True labor, false labor contractions, irregular. Increase in intensity within decreases in intensity with ambulation. Ambulation. Increase in duration and to no changes in duration and frequency. Frequency. and from backspreading to localized in abdomen. Abdomen, cervix and progressively dilates and no cervical changes. Effaces, bloody show when present, not present. 294, postpartum, assessment, nursing, NTRV on S in postpartum period. Parti, bonding phages rubians, fundal assessment. 295, nclex flash review, obstetrics, assessment, nursing interventions and vital signs, intake and outputs, eundo, return of bowel functioning. When fundus, lochia, perineum, episiostomy, hemorrhoids, when breasts for engorgement, cracked or inverted nipples, legs for DVTs. Bonding with infant. Administer Rho-D immune globulin Rhogam if needed, Rh neg mom, Rh pos infant. Perform, teach perineal care, encourage ambulation. Discuss return to sexual activity and contraception if client desires, and teach infant care including breast, bottle feeding, bathing infant, care of cord, and circumcision site if needed, and promote parental infant bonding. Phase taking in, taking hold, letting go description. Mother focused on her needs and on her delivery experience. Mother feels more in control and ready to begin caring for infant. Mother may feel guilty, resentful about the amount of work involved in caring for infant, may feel conflict over role of mother and wife, may develop postpartum blues or postpartum depression. Nursing interventions encourage verbalization, teach infant care, encourage verbalization of feelings, offer positive reinforcement, assess for S, depression, and make appropriate referrals as needed. The fundus is assessed for consistency and location. Findings include immediately post-delivery firm, 1-2 centimeters below umbilicus 12 hours postpartum firm, 1 centimeter above umbilicus 24 hours postpartum firm, 1 centimeter below umbilicus 48 hours postpartum firm, 2 centimeters below umbilicus 9 days postpartum no longer palpable. Special consideration, the fundus moves below the umbilicus at a rate of 1 centimeter per day. If the fundus is soft or boggy, it should be gently massaged with fingertips. 296. Postpartum, Part 111. Lochia. 297. nclex flash review. Obstetrics, definition, refers to the vaginal drainage during the postpartum period. It should be without clots and foul odor. During the first 1 to 3 days postpartum, it should be red in color, lochia rubra. From day 3 through 7, it should be pink, lochia serosa. From day 7 to 10, it should be creamy white, lochia alba. Toba, abruptio pluptio placenta, disseminated intrav ascolar coagulation des. 299. nclex flash review. Obstetrics, definition, separation of placenta from the uterine wall prior to birth of fetus. Causes trauma, preeclampsia, eclampsia, illicit drugs, chronic vascular renal disease. Assessment findings, abdominal pain with dark red vaginal bleeding. Nursing interventions, keep patient on bed rest, monitor vital signs, PT and PTT, central venous pressure and urinary output. Monitor fetus, obtain order for type and cross-match blood for possible transfusion. Administer 4 as per order. Assess for disseminated intravascular coagulation, DIC. Special considerations, 3 types of separation may occur. Complete separation. Partial, only a portion is separated, or central portion is separated, causing blood to pool behind placenta and uterine wall, concealing the bleeding. Definition, deficient hemoglobin synthesis, impairing transport of oxygen. Causes, inadequate maternal iron stores and/or inadequate oral iron intake. Assessment findings, fatigue, headaches, pallor, tachycardia, shortness of breath, hemoglobin less than 10 grams EDL and hematocrit less than 30%, dry skin at corners of the mouth, tongue that is sore and red. Nursing interventions, monitor hemoglobin and hematocrit, instruct client to take iron supplement as ordered, and with vitamin C to increase absorption, but instruct client to avoid taking iron supplement with tea, instruct client to eat foods high in iron, folic acid, and protein. Special consideration, compliance with taking prescription prenatal vitamins, which can prevent anemia. Definition, maternal condition in which simultaneous activation of fibrinolytic and thrombin systems are activated, causing clots in microcirculation and depletion of clotting factors. Causes: abruption, placenta, preeclampsia, eclampsia, amniotic fluid embolism, fetal death, liver disease, sepsis. Assessment findings: excessive ecchymosis, uncontrolled bleeding, hematuria, hematemesis, vaginal bleeding, shock, decreased fibrinogen level, platelet count, and hematocrit with increased PTT. Nursing interventions: assess, monitor vital signs, urinary output, bleeding, and SS shock. Initiate oxygen therapy, administer blood component, therapy as ordered, assist in carrying out MD orders for treatment of underlying cause. Special considerations: complications of DIC include renal failure, report urine output than 30 ml, hour to physician. Part 111. Eclampsia, ectopic pregnancy, gestational diabetes. 301. nclex flash review. Obstetrics. Cause: risk factors include nulliparous women. Assessment findings: severe preeclampsia plus onset of seizure activity or convulsions. Nursing interventions: position patient in left side lying position, maintain patent airway, administer oxygen after seizure, insert oral airway and suction as needed, administer magnesium sulfate and other medications per order, prepare for delivery via cesarean section if needed. Special consideration: seizure activity typically begins with uncontrolled twitching of the mouth. Definition: implantation of the embryo anywhere not inside the uterus. Most common location is fallopian tube. Causes: fertilized ovum's passage through fallopian tubes is slowed or prevented due to fallopian tube obstruction and/or malformation, abdominal adhesions, tubal spasms, previous tubal surgery, diverticuli, or transmigration of ovum to opposite tube. Assessment findings: amenorrhea with slight vaginal bleeding and unilateral pelvic pain, may have referred right shoulder pain, lightheadedness. Nursing interventions: assess vital signs, vaginal bleeding, assess for S. Hypovolemic shock. Administer blood transfusions as ordered, prepare patient for laparoscopic surgery or administration of methotrexate to stop cell reproduction, encourage verbalization and provide support. Special consideration: if patient is Rh negative, may need RhoGAM after treatment or surgery. Definition: inability to produce, metabolize enough insulin during pregnancy. Causes: predisposing factors include maternal age 35 years, obesity, multiple gestation, family history of diabetes. Assessment findings: increased hunger, thirst, urination, yeast infections, urinary tract infections, weight loss, fetus large for gestational age, glycosuria. Nursing interventions: monitor maternal weight, fetal growth, teach, monitor self-glucose testing, diet and exercise regime. S. Management of hypo and hyperglycemic episodes, assess for S as yeast infection and/or urinary tract infection, monitor for hypoglycemic reaction post-delivery, as insulin requirements sharply decline in the first 24 hours after delivery. Special consideration: all women are screened for gestational diabetes during 24 to 28 weeks gestation via oral glucose challenge testing. 302. Part E. Gestational hypertension, HLP-SIND-ROME. 303. nclex flash review. Obstetrics. Definition: a mild type of pregnancy-induced hypertension occurring after 20 weeks of gestation. Causes: risk factors include prima gravida, age less than 19 and greater than 40, diabetes mellitus, Rh incompatibility. Assessment findings: BP greater than 140/90ths on 2 separate readings at least 6 hours apart, but without proteinuria. Nursing interventions: monitor BP, renal function studies, fetal heart tones, and fetal growth. Teach patient self-monitoring of BP, medication regime, frequent rest periods in the left lateral lying position. Special consideration: lack of proteinuria is what distinguishes gestational hypertension from preeclampsia. Definition: gestational hypertension that involves hemolysis, elevated liver enzymes, and low platelets. Causes: women with severe preeclampsia and eclampsia are at higher risk. Assessment findings: Ruki, epigastric or lower chest pain, nausea and vomiting, severe edema, SS preeclampsia, eclampsia. Blood smear reveals hemolysis of red blood cells, thrombocytopenia, elevated liver enzymes. Nursing interventions: assess maternal vital signs and fetal heart rate, assess for complications including hemorrhage, renal failure, hypoglycemia, initiate bleeding precautions, and administer blood products as ordered, administer magnesium sulfate as ordered, prepare woman for delivery. Special consideration: do not palpate abdomen. Definition: disease in which tropoblasts develop abnormally and manifest as a grape-like cluster of cells, also known as tropoblastic disease in molar pregnancy. Causes not known. Assessment findings: vaginal bleeding, fundal height greater than for gestational age, no fetal heart rate, ultrasound reveals snowstorm pattern versus fetus. Nursing interventions: prepare woman for evacuation of hydatidiform mole by vacuum aspiration. Administer oxytocin after delivery per MD order. Instruct in birth control measures to prevent pregnancy for 1 year after evacuation. Encourage verbalization of feelings and provide emotional support. Special consideration: human chorionic gonadotropin HCG levels are monitored for 1 year after evacuation for detection of choriocarcinoma. 304 Parti Hyperemesis gravidarum insium pedenti cervix pelasicenta previa. 305 nclex and flash review. Obstetrics. Definition: intractable nausea and vomiting during pregnancy. Causes unknown. May be related to psychological factors in some women. Assessment findings: intractable nausea and vomiting, weight loss, dehydration, fluid and electrolyte imbalance, confusion, rapid pulse, fruity breath, ketonuria, and proteinuria. Nursing interventions: monitor vital signs, INO, weight and calorie count. Measures to alleviate nausea, including medications such as ondansetron, Zofran, if ordered. IV administration of fluids and electrolytes, NPO, until no vomiting for 24 hours. Client education relating to resumption of oral intake. Eating small, frequent meals of low-fat, easily digested carbohydrates. Eating in a sitting position and remaining in sitting position 30 minutes after meals, and taking liquids between meals versus with meals. Special consideration: once vomiting stops and electrolyte balance is restored, pregnancy usually continues without recurrence. Definition: premature dilation of cervix. Causes: cervical defects in structure or function. Assessment findings: dilation of cervix, usually in 4th or 5th month, vaginal bleeding. Nursing interventions: monitor vital signs and fetal heart rate. Prepare client for cervical circlage. Post-surgical teaching: avoid intercourse, prolonged standing, heavy lifting. Instruct client to report vaginal bleeding or increased uterine contractions to healthcare provider. Special consideration: cervical circlage removed at 37 weeks to allow for normal dilation of cervix in preparation of delivery. Definition: placenta located over or near internal OS. 3 types exist: complete, completely covers internal OS; partial, partially covers internal OS; marginal, margin of placenta, overlaps with internal OS. Causes: exact cause not known. Risk factors include advanced maternal age, previous uterine surgery, multiple pregnancy, or multiparity. Assessment findings: painless bright red vaginal bleeding, previa depicted on ultrasound. Nursing interventions: assess vital signs and fetal heart rate, evaluate bleeding, uterine tone, and contractibility. Assess for hemorrhage. Have oxygen available in case of fetal distress. Initiate bed rest if needed. Prepare client for cesarean delivery, and administer betamethasone if fetus is premature. If bleeding ceases and client is to return home, obtain home care referral. Encourage verbalization of feelings and provide emotional support. Special considerations: monitor for postpartum hemorrhage due to decreased contractibility of uterus. Do not perform vaginal exam. 306. Maternal complications antepartum, Part 111, preeclampsia. 307. nclex flash review. Obstetrics. Definition: one type of gestational hypertension. Causes: exact cause not known. Occurs more commonly in nulliparous women. Assessment findings: preeclampsia, BP greater than or equal to 140/90, proteinuria of 1 gram in 24 hours, edema, weight gain greater than 1 lb per week. Severe preeclampsia, BP greater than or equal to 160/110, proteinuria of 5 grams in 24 hours. Severe edema, Oigira 400 ml or less in 24 hours. Headaches, epigastric pain, hyperreflexia, visual disturbances. Nursing interventions: home management, instruct patient on monitoring BP, fetal movement count, Teach medication regime if prescribed, frequent rest periods or bed rest if prescribed, and reporting of worsening symptoms. Acute care, monitor vital signs and urinary output, edema, fetal heart tones, contractions, assess reflexes and for S, seizure activity and convulsions, initiate seizure precautions, bed rest, limit visitors, medication administration as ordered, antihypertensives, magnesium sulfate. Definition: labor that occurs after 20 weeks gestation, but before 37 weeks gestation. Causes: increased risk with placenta previa, incompetent cervix, premature rupture of membranes prom, urinary tract infection, preeclampsia, eclampsia, larger fetal size, multiple pregnancy, fetal death. Assessment findings: uterine contractions every 10 minutes, for 2 hours despite position change, lower abdominal cramping, dull low back pain, pelvic pressure extending to back and thighs. Nursing interventions: monitor vital signs, uterine contractions, fetal heart rate, bed rest in left lateral lying position, administer IV fluids per order, administer tocolytics per MD order, administer betamethasone if ordered, provide emotional support. Special considerations: teach all pregnant women S, preterm labor, and to promptly report any S's of preterm labor to their healthcare provider. 308. Part E. Amniotic fluid MBOLISM dystocia fetal distress. 309. nclex flash review. Obstetrics. Causes: open venous sinus at placenta site. Risk factors include premature rupture of membranes prom and precipitous labor. Assessment findings: acute onset of respiratory distress, chest pain, hypotension, cyanosis, seizure activity, hemorrhage, hypoxia, fetal bradycardia, fetal distress. Nursing interventions: emergency measures to maintain life, position client on left side, monitor fetal status, administer IV fluids, blood products and medications per order. Prepare for emergency delivery when client stabilizes, provide emotional support to client family. Special consideration: amniotic fluid embolism has a high fatality rate. Definition: difficult prolonged labor. Causes: fetus that is large, malpositioned, or with abnormal presentation. Hypotonic contractions irregular and weak or hypertonic, painful, frequent, and uncoordinated. Cephalopelvic disproportion CPD. Assessment findings: abdominal pain, abnormal contraction pattern, lack of progression of labor, maternal fatigue, maternal tachycardia, fetal distress. Nursing interventions: monitor vital signs, contractions, fetal heart rate, assist with pelvic exam and ultrasound if ordered, administer IV fluids as prescribed, administer oxytocin as ordered, instruct client in relaxation and breathing techniques, monitor color of amniotic fluid, administer pain medication and sedatives as ordered. Special consideration: the condition is addressed by treating the underlying reason for the dystocia. Definition: fetus not tolerating uterine environment. Causes: risk factors include preeclampsia, eclampsia, diabetes, Rh incompatibility, prolapsed cord, factors interfering with functioning of placenta, postterm gestation, hypertonic uterine contractions, dystocia. Assessment findings: fetal heart rate less than 120 or greater than 160, meconium-stained amniotic fluid, variable decelerations and late decelerations, fetal hyperactivity. Nursing interventions: stop oxytocin if being used, place client in left lateral side lying position, administer oxygen, notify physician, prepare for cesarean section. 310. Maternal complications intrapartum, Part E, fetal DMIs, precipitate labor. 311. nclex flash review. Obstetrics. Definition: fetal death. Causes: intrauterine environment not conducive to fetal health, fetal abnormalities. Assessment findings: absent fetal movement, absent fetal heart tones, confirmed with ultrasound. Nursing interventions: encourage client, family to verbalize feelings, and offer support. Support client family religious and cultural practices, including labor and delivery. Encourage family to hold infant, take pictures, make memory box. Special considerations: utilize appropriate verbal and nonverbal communication techniques. Do not use cliches such as "you can always have more," "it is better this way," and "I know how you feel." Definition: the uterus turns inside out during delivery of the placenta. It is also known as uterine inversion. Cause: the placenta fails to detach from the uterus, pulling the uterus inside out as it is expelled. Assessment findings: severe pain, hemorrhage, shock. Uterus may be seen protruding through the vagina. Nursing interventions assist with treatment for shock. Monitor vital signs, monitor for hemorrhage. Special consideration: uterus will be returned to correct position either through the vagina or through laparotomy. Definition: rapid labor that lasts 3 hours. Causes: risk factors include previous labor of short duration. Assessment findings: sudden, intense urge to push, bulging of the perineum, increase in bloody show, rupture of the membranes, crowning of the fetal head. Nursing interventions: call for help, stay with client, offer emotional support, have client pant between contractions, do not attempt to stop delivery. If healthcare provider is not available, deliver baby as follows: put on sterile gloves if available, support fetal head with one hand and apply gentle pressure to head. Deliver between contractions, ensuring cord is not wrapped around neck. Use slight downward pressure to move anterior shoulder under pubic symphysis, suction mouth. Hold infant level with placenta until cord is clamped. Dry infant and place infant on mother's abdomen. Allow placenta to separate and deliver placenta. Special considerations: if infant is delivered before physician arrives, check infant to be sure that it is breathing, and monitor mother closely for hemorrhage. 312. Maternal complications, intrapartum, Part E, premature rupture of bar anus prom. 313. nclex flash review. Obstetrics. Definition: spontaneous rupture of the membranes before onset of regular contractions. Causes: risk factors include lack of prenatal care, poor nutrition, smoking, multiple gestations, uterine infection, incompetent cervix. Assessment findings: blood-tinged amniotic fluid gushing or leaking from vagina. Nursing interventions: verify drainage is amniotic fluid. Nitrazine paper turns blue or amniotic fluid placed on a slide dries into a fern-like pattern. Monitor for onset of contractions, monitor fetal well-being, monitor for infection, maternal fever, tachycardia, increased white blood cells. Special consideration: in-term pregnancy. If labor does not start within 24 hours, prepare to induce labor. Definition: full thickness, separation of the uterine wall and the overlying serosa. Causes: stress on uterus exceeds its ability to stretch. Risk factors include multifetal gestation, large baby, previous cesarean section, fetal malpresentation, tetanic contractions, malapplication of forceps. Assessment findings: complete, sudden sharp abdominal pain, cessation of contractions, vaginal bleeding, shock, absent fetal heart tones. Incomplete, localized tenderness, persistent aching pain, vital signs, fetal heart tones and lack of contractions. Gradually point to maternal and fetal distress. Nursing interventions: report immediately and prepare for immediate cesarean section, oxygen via mask, stat blood type and cross-match. Establish IV line and administer medications, fluids, and blood products as ordered. Insert indwelling catheter. Encourage verbalization of fears and provide emotional support. 314. Maternal complications, postpartum, Part 3 mastitis, postpartum depression. 315. nclex flash review. Obstetrics. Definition: inflammation of the mammary glands. Causes: cracks or fissures on the nipples. Allow organisms from infant's mouth or nose or mother's unwashed hands to enter breast tissue. Assessment findings: localized, reddened, swollen, painful area on breast that is warm to touch, fever, chills, flu-like symptoms. Nursing interventions: instruct client in good hand and breast hygiene. Continue lactation in breastfeeding mothers. Encourage proper latching on and removal of infant from breast. Teach mother application of heat or cold to breast as ordered and medication regime. Special considerations: teach all mothers proper infant, latching on, and removal from breast, as well as proper breast and hand hygiene to prevent mastitis. Definition: a prolonged and intense feeling of sadness and or hopelessness that occurs within 1 year after giving birth. Causes: a combination of physical, emotional, and lifestyle factors. Assessment findings: intense feeling of sadness or hopelessness, crying, difficulty concentrating, loss of pleasure in daily activities, weight changes, sleeplessness, fatigue, decreased energy level, feelings of guilt or worthlessness. anxiety, agitation, thoughts of suicide. Nursing interventions, monitor bonding with infant, appropriate infant development, suicide risk. Teach, encourage compliance with treatment regime, including medications fluoxetine Prozac, sertraline Zoloft, paroxetine Paxil. Encourage verbalization of feelings. Special considerations, teach all mothers postpartum depression and to seek treatment. Assess all postpartum clients for depression throughout the postpartum period. Definition, loss of 500 ml of blood after vaginal delivery or 1,000 ml of blood after a cesarean section within a 24-hour period. Early postpartum hemorrhage occurs in first 24 hours after delivery. Late postpartum hemorrhage occurs 24 hours to 6 weeks after delivery. Causes, uterine atony, retained placenta, vaginal lacerations, DIC. Assessment findings, bleeding from vagina, can be sudden gush or prolonged seepage, with sufficient blood loss will exhibit hypovolemic shock, restlessness, dizziness, lightheadedness, increased pulse, narrowing pulse pressure, pallor, decreased urinary output. Nursing interventions, if uterus is soft and or boggy, massage uterus, notify physician, monitor vital signs, blood loss via peri-pad count, level of consciousness, hematocrit and hemoglobin, administer IV fluid, blood products, and/or oxytocin as ordered. Special consideration, uterine atony is the #1 cause of postpartum hemorrhage. 316. Maternal complications, postpartum. Part 3rd puerperal infection, uterine atony. 317. nclex flash review. Obstetrics. Definition, infection of the birth canal and other structures during the postpartum period. Causes, presence of microbes along with predisposing factors such as prolonged, difficult labor, cesarean section, frequent or unsanitary vaginal examinations, retained placenta, hemorrhage, episiotomy or lacerations. Assessment findings, temperature of 102 degrees Fahrenheit that lasts for 2 consecutive days, chills, headache, malaise, restlessness, anxiety. Nursing interventions, monitor vital signs, I&O, drainage, encourage bed rest, frequent voiding, teach, encourage frequent peri-pad changes and proper perineal hygiene, administer antibiotics and analgesics as per order. Special considerations, whether or not mother can continue to breastfeed is dependent on the antibiotic being administered and the overall condition of the mother. Definition, failure of myometrium of the uterus to contract. Causes, risk factors include multiple gestations, injury to birth canal, magnesium use during labor, rapid delivery, delivery with forceps or vacuum assisted, retained placenta fragments, dystocia, endometritis. Assessment findings, soft or boggy uterus. Nursing interventions, gently message uterus if ineffective, notify physician, administer oxytocin if ordered. Special considerations, normally, contraction of the myometrium of the uterus compresses blood vessels in the uterus to prevent bleeding. If left untreated, uterine atony can lead to postpartum hemorrhage. 318. Maternal medication. Part 3. Antenatal corticosteroids, ergot alkaloids. 319. nclex flash review. Obstetrics. Example medications: betamethasone, cellstone, dexamethasone. Uses adverse reactions used when preterm delivery is imminent to increase production of fetal surfactant in order to accelerate maturation of fetal lungs and decrease subsequent incidence of respiratory distress syndrome, RDS, in the preterm infant. Suppression of maternal immune system, pulmonary edema, elevated blood sugar in women with diabetes. Nursing interventions administered IM in repeated doses, once every 24 hours x2 or every 12 hours x4, depending on medication given. Special consideration, labor must be stopped long enough for repeated doses of the corticosteroid to be administered and produce desired effect. Example medications: methylorgonavine, methergine. Postpartum hemorrhage. Uses adverse reactions: GL, nausea, CP, bradycardia, arrhythmias, severe hypertension, myocardial infarction, respiratory depression, GU, uterine cramping, tetany, neuro, confusion, seizures. Nursing interventions: close monitoring of blood pressure if BP elevated. Special consideration: hold medication and notify physician. Contraindicated during pregnancy and in clients with cardiovascular disease. Category: use central nervous system depressant and anticonvulsant. Prevent, stop preterm labor. Adverse reactions: nursing interventions: special prevent. control seizures in women with preeclampsia and eclampsia, toxicity in the newborn, depression of reflexes, respiration, decreased urinary output, hypotension, pulmonary edema. Monitor closely for signs of toxicity, suppressed patellar reflex, respiratory rate less than 12 min, urinary output less than 30 ml/hour. Keep antidote calcium gluconate readily available. Considerations: stop infusion 2 hours before delivery, often administered in the first 24 to 48 hours postpartum for women with preeclampsia or eclampsia. 320. Maternal medication, Part 111. Opioids, prostaglandins, Rogam. 321. NCLEX RN Flash Review. Obstetrics. Example medications: hydromorphone, Dilaudid, promethazine, Phenergan, fentanyl, Sublimase, nalbuphine, Nubain. Uses relieve labor pain. Adverse reactions: nursing interventions, special consideration: dizziness, nausea, and vomiting. Decreased blood pressure, respirations. Sedation, somnolence, seizures, stupor, coma. Diaphoresis, confusion. Obtain drug history. Do not use if history of opiate dependency. Monitor respirations and hold medication if 12 min. Monitor fetal heart rate. Keep antidote Narcan readily available. Example medications: prostaglandin E, dinoprostone, Cervidil, Prepidil. Uses ripening of cervix for labor induction. Labor induction. Adverse reactions: nursing intervention, special consideration: nausea, diarrhea, stomach cramps, hyperstimulation of uterus, fetal distress, headache, hypotension, fever, chills. Have client void prior to administration. Keep client in supine or lateral position after administration, 30-60 minutes. Gel, 2 hours vaginal insert. Oxytocin can be administered 6 to 12 hours after cessation of prostaglandin. Category: immune globulin. Use adverse reactions, nursing intervention, special consideration. Prevent isoimmunization in Rh-negative clients with potential actual exposure to fetal Rh-positive blood. Elevated temperature. Administer IM, usual dose 300 micrograms. Administer at 28 weeks gestation and within 72 hours of delivery. Not effective once client develops positive antibody titer. 322. Maternal medication, Part 3rd tocolytics. 323. nclex Flash Review. Obstetrics. Example medications use adverse reactions. Nursing interventions, special considerations: indomethacin, indocin, terbutaline. Stop uterine contractions and prevent preterm delivery. Depends on specific medication. Have client assume lateral position to decrease cervical pressure. Monitor vital signs: fetal well-being, contractions, dilation, urinary output. Provide support to client and family. Do not use in women with severe preeclampsia or eclampsia when gestational age greater than 37 weeks or cervical dilation is greater than 4 centimeters. Example medications uses adverse reactions, nursing interventions, special consideration: oxytocin, pitocin, induction or augmentation of labor, postpartum hemorrhage, uterine hypertonicity rupture, hypotension followed by rebound hypertension. Arrhythmias. Monitor blood pressure, contractions, fetal heart rate closely. Administer 4 with additive piggybacked at port closest to 4 insertion site. Monitor closely for postpartum hemorrhage, as uterus may become soft or boggy when uterine stimulant wears off. 324. Fetal development, Part, Month 3. 325. nclex Flash Review. Obstetrics. Fertilization, conception, zygote, blastocyte, embryo, egg, 23 chromosomes, and sperm, 23 chromosomes unite, creating zygote, 46 chromosomes, or 23 pairs. Undergoes rapid cell division and becomes a mass of cells called a blastocyte. Travels through fallopian tubes and implants into uterus 7 to 10 days after fertilization and is called an embryo. By end of the month is the size of a grain of rice. Embryo week 5, weeks 6 to 8. Fetus divides into 3 layers. Ectoderm develops into brain, nerves, skin, hair, nails, tooth enamel. Mesoderm develops into bones, muscles, blood, heart, kidneys, reproductive system, part of lungs, Endoderm develops into other part of lungs, liver, intestines, urinary tract. Embryo forms two grooves. One end becomes a head, while the other becomes a tail. Head differentiates from tail. Bumps mark arms and legs. Tiny hands and feet start to develop. Heart develops and starts to beat. Tongue, teeth, and eyelids start to form. Umbilical cord developed, called a fetus from 8 weeks until end of pregnancy. Developmental milestones, weight, length, fetal heart rate can be detected with Doppler. Body uncurls from C position. Tail disappears. Reproductive system forming. Eyelids, earlobes, limbs, digits continue to form. 1 ounce, 3 inches. 326. Fetal development. Part 3rd, month 5, month 6. 327. nclexrn, flash review. Obstetrics. Developmental milestones, weight, length, fetus can hear. Major organs complete but not functional. Swallows, kicks, may do somersaults, 6 ounces, 7 inches. Developmental milestones, weight, length, mother may experience quickening baby's movements. Lanugo develops, vernix gaseosa develops, sucks thumb, meconium forming, 10 to 16 ounces, 7 to 10 inches. Developmental milestones, weight, length, heartbeat heard with stethoscope, essential organs fully formed, bones become harder, reacts to noises, facial features more recognizable, 1.5 to 2 pounds, 10 to 13 inches. 328. Fetal development, part 3, month 7, month 9, part 3 in inches. Obstetrics. Developmental milestones, weight, length, brain sections form for distinct functions. Taste buds develop. Protective fat begins to develop, able to blink. Eyes remain open for short periods of time. Testicles move to groin in males, 2.5 to 3.5 pounds, 11 to 16 inches. Developmental milestones, weight, length, brain develops rapidly. All organs except lungs mature. Skin starts to smoothen. Fingernails grow past fingertips. Limited room for movement. Settles into head down position. 4 to 6 pounds, 16 to 18 inches from head to toe. Developmental milestones, weight, length, lungs mature. Assumes birth position. Lightening may occur. Fat layers thicken. Vernix gaseosa and lanugo begin to disappear. Labor begins. 6 to 8 pounds on average, 20 to 22 inches on average. Fetal development. Part 3. Fetal circulation. 331. Obstetrics. Uteropla circulation. Ovary path. Brings oxygen-rich blood from mother to intervillous spaces via uterine arteries and then back to maternal circulation via veins. Oxygen-depleted blood from fetus transported by umbilical arteries and oxygen-rich blood returned to fetus via umbilical vein. Shunts fetal blood from right atrium to left atrium, bypassing lungs. Shunts fetal blood from pulmonary artery to aorta. Oxygen-rich blood from umbilical vein to fetal inferior vena cava. Right atrium to foramen ovale to left atrium to left ventricle to aorta. Some blood from right atrium goes to right ventricle to pulmonary artery to ductus arteriosus to aorta. Oxygen-depleted blood to umbilical arteries. 332. Fetal assessment, Part E. Fetal heart rate acceleration. Fetal heart rate, EA Raleigh deceleration. Fetal heart rate, late deceleration. 333. nclexrn flash review. Obstetrics. Fetal accelerations are a healthy response to fetal movement. They are considered a reassuring sign in the fetus. Definition: slowing of the fetal heart rate FHR that occurs in conjunction with maternal contractions. Causes: compression of fetal head during labor. Assessment findings: slowing of FHR 20 to 30 beats per minute under baseline. Nursing interventions: benign event, reassure patient that fetus is not at risk, continue to monitor and document FHR. Special consideration may progress to variable deceleration. Definition: decreased fetal heart rate in response to decreased blood flow during contractions or a structural defect in the placenta. Nursing interventions: turn mother on left side, administer oxygen by mask, increase IV fluid rate per standing order, notify physician. 334. Fetal assessment, Part E. Fetal heart rate variability. 335. nclexrn flash review. Obstetrics. Definition: a fluctuation in heart rate that represents the interaction between the sympathetic and parasympathetic nervous systems. Interaction between the two systems results in changes in the fetal heart rate. Variability indicates that both systems are working. 3rd month, 6th month normal rate can be heard via Doppler, can be heard via stethoscope, 120 to 160 beats per minute. Definition: measurement from the top of the maternal symphysis pubic notch to the top of the fundus in centimeters. According to M. McDonald's rule, the measurement in centimeters will approximate the weeks of gestation. It is an indirect measurement of fetal growth. 336. Fetal assessment. Part 3rd Leopold maneuvers. 337. nclex flash review. Obstetrics. First maneuver: face mother's head. Palpate uterine fundus. Determine fetal body part at fundus. Second maneuver: continue facing mother's head. Palpate with one hand on each side of fundus. Determine location of fetal spine and extremities. Third maneuver: face mother's feet. Palpate above symphysis pubis. Determine fetal presenting part. Determine if fetal descent has occurred. Fourth maneuver: continue facing mother's feet. Exert gentle downward pressure on fetal head. Palpate presenting part between thumb and forefinger. Determine if cephalic versus breech presentation. 338. Neonate assessment. Part 111. 339. nclex flash review. Obstetrics. Definition: cyanosis of hands, feet, and perioral area in the newborn due to immature circulatory system. It is a common and benign finding in the newborn. Sign 012, heart rate absent less than 100. Min. Respirations absent, weak cry, hypoventilation, strong cry, muscle tone, flaccid, some flexion, active motion reflex, no weak cry, grimace, strong cry, or withdrawal, irritability response, color pallor, cyanotic pink body with blue extremities, completely pink. Evaluated 1 and 5 minutes after birth. Score of 8 to 10, no interventions required. 4 to 7, gentle stimulation, administer oxygen. 0 to 3 requires resuscitation measures. Definition: edema of the soft tissue of the head that crosses over suture lines. It is a benign condition that resolves a few days after birth. 340. Neonate assessment. Part 111. Cephalhematoma. 341. nclex flash review. Obstetrics. Definition: swelling in the head between the bone and periosteum. It does not cross suture lines. It usually resolves in 6 weeks and requires no treatment. Definition: small white or yellow benign lumps on the neonate's gums or hard palate. They are caused by retained secretions and resolve on their own. Definition: soft spots located on the anterior and posterior portion of the fetal head that enable the head to mold in order to pass through the birth canal. Anterior fontanelle diamond shape 3-4 centimeters firm, flat closed by end of 18 months. Posterior fontanelle triangular shape 0.5 to 1 centimeter firm, flat closed by end of 2nd month. Bulging fontanelles, increased intracranial pressure, sunken fontanelles, dehydration. 342. Neonate assessment. Part E, harlequin color, CHNGs. 343. nclex flash review. Obstetrics. Definition: a benign change in the neonate's skin color where one half of the neonate's skin turns dark pink or red and the other half turns pale. The division can be vertical, as if a line is drawn from the center of the neonate's forehead to the pubis, or horizontally, as if a line was drawn across the abdomen. These color changes are due to the neonate's instability and the reactivity of its blood vessels. Definition: when infant is moving from lying to sitting position, head droops forward or backward. This is a normal occurrence due to lack of control, strength of the neck muscles. It should be nearly gone by 12 weeks and should completely disappear by 20 weeks. In its most severe form, it may occur in infants with Down syndrome, brain damage, and/or hypoxia. Head, eyes, ears, nose, throat, and mouth neurological fontanelles soft, able to turn head to side if placed on same surface. Head lag, blue or slate gray. Permanent eye color established at 3 to 12 months. Tearless crying. Doll's eyes normal for first 10 days. Pinna flat against side of head, top of ear parallel or above inner canthus of eye. Obligatory nose breathers. No cleft in palate. Scant saliva. Pink lips. reflexes present and not hyperreflexive. 344. Neonate assessment, Part E, head to toe, head to chest, ratio head to toe, ERT and lungs, head to toe, abdomen, genitalia, spine, extremities. 345. nclex flash review, obstetrics. Definition: the circumference of the neonate's head compared to the circumference of the chest. The head circumference should be 1 to 3 centimeters greater than that of the chest. If the head circumference is greater than 3 centimeters larger than the chest circumference, increased intracranial pressure or hydrocephaly might be indicated. Head circumference less than 1 centimeter larger than the chest circumference can be indicative of molding, anencephaly, and/or closed suture lines. Heart sounds apical impulse, point of maximal impulse. Respiratory rate abdominal, 110 to 160 min. Murmurs are common, but every murmur should be referred to physician for further evaluation. Fourth intercostal space, 30 to 50 min. Slight retractions are normal. Neonates are abdominal versus chest breathers. Abdomen cylindrical in shape. Bowel sounds present few hours after birth. Umbilical cord white and gelatin-like, begins to dry within 1 to 2 hours after delivery. Umbilical cord with 2 arteries and 1 vein. Liver palpable 1 inch below costal margin. Genitalia male, testes descended. Urinary meatus at penile tip. Scrotal edema may be present for first few days after birth. Female, vaginal discharge may be present. Spine straight and intact. No dimpling or hair tufts. Extremities bow-legged and flat feet. Polydactyl and/or syndactyl not present. Acrocyanosis may be present. Extremities in flexed position. Neonate assessment, Part 111, Lanugo-meconiamelia. 347. nclex flash review, obstetrics. Definition: fine, downy hair that develops during the 5th month of gestation to protect the fetal skin. It begins to disappear during the 9th month of gestation. It is considered normal for the infant to be born with some remaining, and it will disappear on its own. The amount with which the infant is born depends on the length of gestation. Greater gestational age equates to a lesser amount. Definition: the first stool passed by the neonate. It is tarry in consistency and black or dark green in color. When meconium is noted in the amniotic fluid, it is considered a sign of fetal distress and can lead to respiratory difficulties in the neonate. Definition: small white bumps appearing over neonate's nose, chin end, or cheeks. These are due to sebaceous glands being clogged. They are considered benign and will disappear on their own. 348. Neonate assessment, Part 3, molding, reflexes. 349. nclex flash review, obstetrics. Definition: oblong shape of the neonate head, caused by pressure on the head as it passes through the birth canal. This occurs due to the cranial suture lines and fontanelles, allowing the cranial plates to move during the birthing process to narrow the diameter of the head to facilitate the birthing process. Definition: blue to slate gray marks on the neonate's buttocks, back, and legs that resemble bruises. They are a benign color variation and are more prevalent in Native American, African American, Asian, and Hispanic neonates. They usually disappear by age 2. Babinski grasping Moro, startle rooting, stepping sucktonic neck, fencing toes fan upward. Neonate grasps healthcare provider's finger when placed in palm. When neonate is lowered suddenly or startled by a loud noise, neonate extends arms and legs and then abducts them. When side of cheek is brushed gently, neonate turns head and opens mouth. Neonate moves feet in a stepping motion when held upright with soles of feet touching flat surface. When nipple, pacifier, or clean gloved finger is placed in neonate's mouth, neonate begins to suck. When neonate's head is turned to one side, neonate extends arm on that side and flexes opposite arm. 350. Neonate assessment, Part 111. 351. nclex flash review, obstetrics. Definition: white cheesy substance that forms a protective coating over the fetal skin. It develops during the 5th gestational month and begins to disappear during the 9th month. The amount remaining at birth is dependent on gestational age. It is considered a normal finding. 352. Neonate care, Part 111. breastfeeding tips, circumcision care, umbilical cord. 353. nclex flash review. Obstetrics, latching on release hygiene, sore, cracked nipples, engorgement, caloric needs, brush infant's lower lip with nipple. When infant opens his or her mouth widely, guide nipple and areola into mouth. Insert a clean finger into side of infant's mouth to release suction. Remove nipple and areola from mouth. Wash daily with warm water. Do not use soap on the nipples, as this may lead to cracking. May express a few drops of breast milk and apply to nipples to prevent dryness. Ensure infant is latching on correctly. Rotate position of infant each feeding. Crack nipples. Expose to air 20 minutes after each feeding. Breastfeed frequently. Apply warm, moist heat 20 minutes before each feeding. Apply ice between feedings for 20 minutes. Mother should increase calories by 200 to 500 Bailey. Nursing interventions first 24 hours after circumcision. Teach parents daily care check for bleeding. If bleeding occurs, apply pressure with sterile gauze. Allow first dressing to fall off naturally. Apply diapers loosely. Monitor urination. Do not place neonate with petroleum dressing under radiant warmer due to risk for burns. Cleanse with warm water. Do not use baby wipes due to alcohol content. Apply petroleum jelly or antimicrobial ointment per hospital policy. Change diapers every 4 hours. Notify practitioner if redness, swelling, or discharge is present. Arteries, vein clamping, daily care infection. Falling off, there should be 2 arteries in 1 vein. Keep cord clamp for first 24 hours after birth. Varies by hospital policy protocol, but may include cleansing around cord and application of drying agent or antimicrobial agent. Parents should be taught to monitor for and report signs of infection, including moistness, oozing, discharge, redness around insertion site. Cord shrivels and dries and eventually falls off in approximately 7 to 10 days. 350. 4. Neonate complications. Part 3. Drug-dependent neonate. Hyperbilirubinemia. 355. nclex flash review. Obstetrics. Definition: infant dependent on the drug mother used during pregnancy. Cause: repeated intrauterine absorption of drug from maternal blood. Assessment findings: depends on amount and type of drug used by mother, but includes irritability, hyperactivity, tremors, exaggerated reflexes, difficult to console, sweating, acrocyanosis, convulsions, respiratory distress, hunger, mental retardation, developmental delays. Nursing interventions: position lying on side, head-dependent position, suction excess secretions with bulb syringe, decrease environmental stimuli, collect urine for toxicology studies, mitts on hands, administer medications such as morphine sulfate, methadone, or phenobarbital as ordered. Definition: permanent damage experienced by fetus from exposure to maternal alcohol consumption. Cause: maternal alcohol consumption. Assessment findings: epicanthal folds, small mandible and/or chin, long thin upper lip, irritability, difficult to console, poor feeding, high-pitched cry. Nursing interventions: reduce environmental stimuli, maintain hydration and nutrition, administer sedatives as ordered, provide emotional support to mother. Definition: yellow discoloration of the skin due to excess bilirubin in the neonate's blood. Causes: immaturity of the neonate's liver makes it slow to process the byproduct of red blood cell breakdown, bilirubin, leading to buildup of bilirubin in the blood. Assessment findings: yellow discoloration of the skin that starts at the face and moves down to the chest and then legs. Physiological jaundice starts the 3rd or 4th day of life and resolves by the 7th day. Bilirubin levels do not exceed 12 milligrams DL. Pathological jaundice starts within first 24 hours of life. Bilirubin levels exceed 17 milligrams DL. Nursing interventions: monitor jaundice and bilirubin levels. Maintain feedings and offer extra feedings or water to neonate. Teach administer phototherapy as ordered. Reassure parents. Special consideration: neonate stool may appear green due to excreted bile. 356. Neonate complications. Part 111. Hypoglycemia. Hypoglycemia, nclex glucose level less than 40 milligrams, DL less than 45 milligrams. Cause: supply. Risk increase for infants of diabetic mothers, preterm and postterm infants, infants small for gestational age, and infants of mothers with preeclampsia. Assessment findings: sweating, unstable temperature, high-pitched and shrill cry, tachypnea, jitteriness, lethargy, tremors, convulsions. Nursing interventions: administer oral or intravenous glucose as per order. Special consideration: monitor for rebound effect after administration of glucose. Definition: resultant blockage of the neonate's airway from inhaling meconium mixed into the amniotic fluid. Cause: fetal distress during labor. Assessment findings: meconium-stained amniotic fluid, cyanosis, limpness, increased respiratory effort, apnea, grunting, tachypnea, low APGAR score, coarse crackling lung sounds. Treatment: suction nose and mouth as soon as head is delivered. Tracheal suctioning may be needed. Chest therapy, antibiotics. Special considerations: meconium aspiration may lead to aspiration pneumonia, cerebral palsy, mental retardation, seizures, pneumothorax. Definition: risk factors: neonate born before 37 weeks, gestation, multiple pregnancy, adolescent pregnancy, low socioeconomic status, lack of prenatal care, smoking, substance abuse, cervical incompetence, placenta previa, preeclampsia, eclampsia complications, respiratory distress syndrome, intraventricular hemorrhage, retinopathy of prematurity, patent ductus arteriosus, necrotizing enterocolitis, apnea of prematurity. 358. Neonate complications. Part 3rd, respiratory distress syndrome. 359. nclex flash review. Obstetrics. Definition: a lung disorder that primarily affects premature infants. Causes: insufficient production of pulmonary surfactant to coat the alveoli in order to keep them open for gas exchange, the alveoli close, leading to atelectasis, increased effort to breathe. Risk factors include premature birth, fetal hypoxia, and maternal diabetes. Assessment findings: increased respiratory rate and effort, retractions, crackles on auscultation, nasal flaring, cyanosis, tachypnea, expiratory grunt. Nursing interventions: ensure adequate thermoregulation, provide warmed, humidified oxygen via hood, nasal prongs, continuous positive airway pressure, or mechanical ventilation per order, suction when necessary with bulb syringe, provide emotional support for parents. Special consideration: assess and treat for respiratory and metabolic acidosis. Neonate medications. Part 111, eye prophylaxis. 361. Obstetrics, nclex flash review. Lung, Suarfact N, TS. Example medications. Ointments use adverse reactions, nursing implications. Special considerations: erythromycin 0.5%, tetracycline 1%, silver nitrate 1%. Protection from N, gonorrhea, and C, trachomatis. Chemical conjunctivitis. Administer within 1 hour of birth. Administration required by law. Example medications use adverse reactions, nursing implications: Paractant, calfactant, Paractant alpha. Prevention, treatment of respiratory distress syndrome RDS in neonates. Bradycardia, oxygen desaturation, pulmonary hemorrhage, mucus plug. Administer via endotracheal tube. Do not suction for 2 hours after medication administration. 362. Pediatrics General, Growth and Development, Part IV, Developmental Periods, Theo Rists, Eric Erickson. 365. NCLEX RN Flash Review, Pediatrics General, Prenatal Infancy Toddler Preschooler Elementary School Age Adolescent Young Adult Middle Adult Older Adult Conception, to birth 0 to 12 months, 1 to 3 years, 3 to 5 years, 6 to 10 years, 11 to 18 years, 19 to 35 years, 36, 64 years, 65 and over. Cephalocaudal proximodistal growth proceeds from the head down to feet. Example: head grows more than body during first 5 months gestation. Growth occurs from the center of the body outward. Example: infant gains control of arm movements, then finger movements. Infant, toddler, preschooler, elementary school age, adolescent, young adult, middle adult, older adult. Trust versus mistrust. Autonomy versus shame and doubt. Initiative versus guilt. Industry versus inferiority. Identity versus role confusion. Intimacy versus isolation. Generativity versus stagnation. Integrity versus despair. Growth and development. Partive. Theorists, SCMU, N.D. Freud. Theorists, Lawrence Kohlberg. Theorists, Jean Piaget. 367. nclex RN Flash Review. Pediatrics General. Age 0 to 1 year, 1 to 3 years, 3 to 6 years, 6 to 12 years, 13 to 18 years. Stage oral sensory. Focuses on mouth and need to suck. Anal urethra. Focuses on learning to control bowels. Phallic locomotion, self-centered attention. Identifies with parent of opposite sex. Superego develops. Latency suppresses sexual desires to focus on skill achievement. Genitality seeks mature sexual pleasure with partner. Age 0 to 3 years, 3 to 6 years, 6 to 12 years, 13 plus years. Stage phase preconventional punishment and obedience orientation. Preconventional self-interest orientation. Conventional good boy nice girl orientation, law and order orientation. Post-conventional social contract orientation, universal ethical principle orientation. Age levels of development 0 to 2 years, sensoromotor, understands cause and effect, understands object permanence, understands night and day. Pre-operational thought, attributes life to inanimate objects, sees self as center of the world, understands only one piece of information at a time, uses pretend play, follows rules. 7 to 12 years, concrete operational thought, understands more than one piece of information at a time, focuses on present, realistic understanding of world. 12 plus years, formal operational thought, thinks abstractly, cultural practices help child develop rules and develop sense of what is right or wrong. 2 to 7 years, developmental milestones. Partive, infant, fine gross motor infant, language cogative social to Diedler, fine gross motor. 369. nclex RN Flash Review. Pediatrics General. Age 0 to 3 months, 4 to 6 months, 7 to 9 months, 10 to 12 months. Fine motor, hands open and at midline. Transfers objects from one hand to the other. Pincer grasp. Takes objects out of container. Scribbles gross motor, lifts self up on forearms from prone position. Rolls from back to front. Supports weight on extended arms. Sits independently. Pulls to standing position. Language cognitive social 0 to 3 orients to voice. Regards toys. Social smile. Recognize smiles. Nizes mother. 4 to 6 vocalizes pleasure. Focuses on action of discriminates months and displeasure. Ject, searches briefly for toy strangers. Moved out of sight. 7 to 9 babbles. Non-spine covers partially hidden, smiles at mirror month civic mama and toy. Repeats actions to age. Feeds self with data. Repeat consequences. Fingers. 10 to 12 waves bye-bye. Plays peekaboo. Shakes increasing aware month specific data rattle for attention. Nests of strangers. And mama. Age 13 to 15 months, 16 to 18 months, 19 to 24 months, 25 to 33 months. Fine motor, scribbles spontaneously, stacks 2 blocks, puts pegs in pegboard, begins to work puzzles, stacks 6 blocks, imitates vertical pencil stroke, copies a circle, strings beads. Gross motor, walks alone, throws ball, stands, squats and stoops, kicks large ball, walks up steps using non-alternating feet, jumps in place, walks on tiptoes. 370. Developmental milestones. Part 4th, toddler, language, cognitive, social, preschoolers play. 371. nclex RN Flash Review. Pediatrics General. Age 13 to 15 months, 16 to 18 months, 19 to 24 months, 25 to 33 months. Language follows one-step commands. Verbalizes 2 to 6 words. 7 to 20 words. Points to body parts. 2-word combinations. Points to pictures. Understands the prepositions on, under, and or behind. Cognitive pretend play emerges. Pretend and imaginative play. Symbolic use of materials. Baby bed in a shoebox. Categorizes objects by color, shape or function. Counts. Social adaptive, cooperates with dressing. Drinks well from cup. Imitates household chores. Uses fork, takes off coat. Feeds self without a mess, bathes with assistance, puts on pants, shoes. Age 3 years, 4 years, 5 years, plays solitary or parallel play. Puppets, large ball, sand and water, rides tricycle. Imaginative and dramatic play, imaginary playmates, dresses up, enjoys crayons, paints, books, realistic play, enjoys musical instruments, runs, jumps, rides bicycle, chooses friends with like interests. Language vocabulary 900 to 2,000 words, knows first and last name, talks to self. Vocabulary 1,500 to 3,000 words, uses I, asks questions, counts to 5. Vocabulary of 2,100 to 5,000 words, repeats sentences of 12 or more syllables, can tell story accurately. Type of play solitary, parallel, associative, cooperative, age infant, toddler, preschooler, school age. Description plays alone. Enjoys presence of others, but is focused on own activity. Plays alongside, but not with others. Example, 2 boys playing with trucks, but no interaction with each other. Plays together with others, but no group goal. Follows organized rules, definite leader-follower relationship. 372. Assessment. Part 4th. Abdomen, genitalia, head, eyes, ears, nose, mouth. 373. NCLEX RN Flash Review, Pediatrics General. Abdomen, male genitalia, female genitalia prominent in standing and supine positions until the age of 4 years. Prominent when standing until puberty. Bowel sounds every 10 to 30 seconds. Use child's hand under yours during palpation if child is ticklish. Rigid abdomen almost always emergent problem. Foreskin retracts. Urinary meatus at tip of glans penis. No discharge. Testis palpable in scrotum. No vaginal discharge. Internal exam recommended ages 16 and over or when sexually active. Head, eyes, ears, nose, mouth. Normocephalic. Symmetrical outer canthus aligns with tip of pinna. Epicanthal folds common in Asian children. Acuity, 1 year, 22/100ths, 2 years, 20/70ths, 5 years, 20/30ths, 6 years, 20/20ths, tympanic membrane intact, pearly gray color. Gently pull pinna down and back for otoscopic exam. Low set ears suggest mental retardation. Infants are nose breathers. Turbinates pink and without edema. Tonsils large, reach maximum between 10 and 12 years. No cleft in palate. Motor function, gait, spine, hand preference develops around 4 years of age. Genu varum, bow-legged, ages 1-2 years. Genu valgum, knock-kneed, ages 2 to 7 years. Lumbar curve develops at 12 to 18 months. Newborns have flexed position. 374. Assessment. Part delta iota. Neurological reflexes. Skin. 375. NCLEX RN Flash Review. Pediatrics General. Reflex stepping, Moro, startle, rooting, palmar grasp, tonic neck, fencing, plantar grasp, sucking, Babinski. Age disappears 2 months, 3 months, 3 to 4 months, 3 to 4 months, 4 to 6 months, 8 to 10 months, 10 to 12 months. Converts to adult response by 2 years. Normal findings: cafe au lait, spot hemangioma, strawberry port wine stain, lesion free, soft, warm, good turgor. Light brown birthmark that is round or oval in shape. May appear at birth or first years of life. 1 is common, but more than 6 can be indicative of neurocutaneous disease. Birthmarks that are made up of increased blood vessels appear red, blue, or purple in color, increase in size over first 8 months of life, eventually will fade, disappear, but takes years. Dark red or bluish birthmark that is usually large with irregular borders and occurs on the face and scalp, does not fade with time. Teeth, chest, lungs, sounds, heart sounds begin to erupt at 4 to 6 months. All teeth erupted by 36 months. Begin losing baby teeth by ages 5 to 6. Anterior to posterior ratio 1:2. Abdominal breathers under age of 7 may have hyperresonance due to thin chest wall. Respiratory rate 20 to 28 for ages 2 to 10, 12 to 20 for ages 10 to 18. Innocent murmurs common. Sinus arrhythmia common. Apical impulse occurs in 4th intercostal space until age 7. 376. Assessment. Partiv. Vaccination schedule, ages 0 to 6. For all, without stipulations regarding high-risk statuses. Vaccination schedule, ages 7 to 18. For all, without stipulations regarding high-risk status. 377. NCLEX RN Flash Review, Pediatrics General, age greater than 1, 2, 4, 6, 9, 12, 15, 18, 19 to 23, 2 to 3, 4 to 6, vaccine, hepatitis. Mos, 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 Most years most Hep 8, second dose Hep B, third dose rotavirus, RV to 8 MOAs, diphtheria, tetanus, DTaP, pertussis, see footnote 2, DTaP, Haemophilus, Hib, influenza type B, inactivated IPV, poliovirus, influenza, measles, mumps, rubella, IPV, influenza, yearly, MMR, see footnote 3, MMR, varicella, see footnote 4, varicella hepatitis, a HEPA 2 doses, 1. First dose given at birth, 2. The fourth dose may be administered as early as age 12 months, provided at least 6 months have elapsed since the third dose, 3. The second dose may be administered before age 4 years, provided at least 4 weeks have elapsed since the first dose. 4. The second dose may be administered before age 4 years, provided at least 3 months have elapsed since the first dose. Age. Vaccine at 7 to 10 years, 11 to 12 years. Diphtheria, tetanus, pertussis. 1 dose if indicated, 1 dose human papillomavirus, see footnote 1, 3 doses MCV4, meningococcal hepatitis B, inactivated poliovirus, measles, mumps, rubella, varicella, 13 to 18 years. 1 dose if indicated, complete 3 dose series MCV4 catch-up immunization catch-up. Administer Hep B series 3 doses for those not previously vaccinated catch-up. Administer IPV series 3 doses for those not previously vaccinated. Catch-up. Administer MMR series 2 doses for those not previously vaccinated catch-up. Administer varicella series for 2 doses, those not previously vaccinated. Third dose 6 months after the first dose, at least 24 weeks after the first dose. 2. The final dose in the series should be administered at least 6 months after the previous dose. 3. The minimum interval between the 2 doses of MMR vaccine is 4 weeks. 4. For persons aged 7 through 12 years, the recommended minimum interval between doses is 3 months. However, if the second dose was administered at least 4 weeks after the first dose, it can be accepted as valid. For persons aged 13 years and older, the minimum interval between doses is 4 weeks. 378. Pediatrics, disorders, part lambda, child abuse general. 381. nclex flash review. Pediatrics, disorders. Facts: children less than 1 year old at highest risk for physical abuse, abuse often associated with a crisis or stressful event. Assessment findings varies according to type of abuse. Nursing interventions: approach child slowly and at eye level, assess injuries and document findings, allow child to verbalize feelings, thoughts, reassure child that abuse is not his or her fault, report suspected abuse to proper authorities. If working with parents in follow-up care, assist in the identification of stressors and appropriate management, and refer parents to appropriate community support systems. Type of abuse: physical shaken baby syndrome, neglect, psychological sexual symptoms, unexplained injury or incongruous history of injury, bruises and fractures at varying levels of healing, bruises circling extremity, burns to extremities with specific shapes and patterns, hyperalertness when caregivers give directions, overeagerness to please, frightened by adults, intracranial hemorrhage from vigorous shaking, swelling of head, bulging fontanelles, old dirty clothing, poor hygiene, lack of adult supervision, fatigue, poor school attendance, hunger, poor self-esteem, acting out behaviors, sucking, biting, rocking, poor academic performance, lack of friends and involvement in after-school activities, self-defeating, mutilating behaviors, suicide ideation, bruises, bleeding in genital anal area, changes in sleep pattern, poor self-esteem, sexually transmitted diseases, abnormal discharge, odor from genitals, enuresis. 382. Cardiovascular disorders. Part 5th. Aortic stenosis, atrial septal defect, coarctation of aorta. 383. nclex flash review. Pediatrics, disorders. Definition: narrowing of aortic valve that decreases blood flow from the left ventricle. This causes blood to be shunted from the left to the right side of the heart. Causes: progressive wear and tear of bicuspid valve, present since birth, congenital, wear and tear of the aortic valve in elderly, scarring of aortic valve due to rheumatic fever as a child or young adult, Assessment findings: congested cough, diaphoresis, fatigue, tachycardia, tachypnea. Treatment: surgery. Nursing interventions: monitor vitals, pulse oximetry, intake and output. Cardiac assessment for early signs of decomposition. Daily weight, high-calorie diet with easy-to-digest food. Keep head elevated, may place infant in car seat to do this. Special consideration: while infant is usually acyanotic, may present with mild cyanosis. Definition: birth defect resulting in an abnormal opening between the right and left atria of the heart. Causes: congenital birth defect. Assessment findings: infant may be asymptomatic or may have difficulty feeding, exercise intolerance, oliguria, pale, cool extremities, tachycardia, periods of cyanosis, jugular vein distension, peripheral edema, and/or symptoms of respiratory distress. Treatment: closure of the opening via cardiac catheterization or open repair with bypass surgery. Nursing interventions: monitor vital signs, assess for signs and symptoms of congestive heart failure, and/or decreased cardiac output, weigh daily, provide small, frequent feedings to conserve energy, administer oxygen, medication, and fluid restrictions as prescribed. Special consideration: repair of defect is usually done before the child reaches school age. Definition: narrowing of the aorta near the ductus arteriosus. Cause: congenital birth defect. Assessment findings: blood pressure is higher in the upper extremities than the lower extremities, bounding pulses in arms, cool lower extremities, weak absent femoral pulses, headaches, nosebleeds, dizziness, signs of congestive heart failure or decreased cardiac output. Nursing interventions: monitor blood pressure and pulses in all extremities, assess for decreased cardiac output. Congestive heart failure: administer oxygen and medication as prescribed. Treatment: angioplasty with balloon, surgical management via resection, and end-to-end anastomosis of constricted section. Special consideration: cardiac bypass surgery is not usually necessary. 384. Cardiovascular disorders. Part 5: congestive ERT failure. Hypoplastic left ERT sin Dr. Almi Jones criteria. 385. nclex flash review. Pediatrics disorders. Definition: the heart is unable to effectively pump the blood volume needed to meet the infant's child's metabolic needs. Cause: usually caused by a congenital heart defect that then leads to congestive heart failure. Assessment findings: tachypnea, tachycardia, cyanosis, difficult feeding, edema, diaphoresis, signs, symptoms of respiratory distress, ascites, jugular vein distension, oliguria, weight gain, poor growth. Nursing interventions: monitor vital signs and respiratory status, elevate head of bed, maintain strict intake and output, decrease stimulation, small frequent feedings, administer oxygen, digoxin, diuretics, angiotensin-converting enzyme inhibitors, sedatives as ordered. Definition: underdevelopment of left side of heart. Cause: congenital birth defect. Assessment finding: symptoms progress from mild cyanosis and symptoms of congestive heart failure to severe decrease in cardiac output and eventually cardiac collapse. Treatment: requires mechanical ventilation with administration of prostaglandin E1 to ensure adequate blood flow until surgical intervention is completed. Transplantation may be considered. Special consideration: without intervention, hypoplastic left heart syndrome is fatal. Definition: used to diagnose rheumatic fever, consists of two categories: major criteria and minor criteria. Major criteria include carditis, painful joints, involuntary movements, chorea, erythema marginatum, and subcutaneous nodules. Minor criteria include fever, elevated sedimentation rate, positive C-reactive protein, and prolonged PR interval. According to Jones criteria, the child must have evidence of preceding streptococcal infection of the throat, plus exhibit 2 of the major symptoms, or 1 major and 2 minor symptoms for a diagnosis of rheumatic fever to be made. Cardiovascular disorders. Part 5th patent do C2S arteriosus, pulmonary artery stenosis, rheumatoid heart disease RHD, rheumatoid fever RF. 387. nclex flash review. Pediatrics disorders. Definition: abnormal opening between the aorta and pulmonary artery that causes blood from the aorta to be shunted to the pulmonary artery. Causes: congenital disorder where the ductus arteriosus fails to close after the birth. Assessment findings: machine-like murmur, widened pulse pressure, bounding pulses, difficulty feeding. exercise intolerance, oliguria, pale, cool extremities, tachycardia, periods of cyanosis, jugular vein distension. Nursing interventions, monitor vital signs, assess for signs and symptoms of congestive heart failure and/or decreased cardiac output, weigh daily, provide small frequent feedings to conserve energy, administer oxygen, medication and fluid restrictions as prescribed. Treatment, medication indomethacin, indocin, cardiac catheterization, or surgical intervention to close defect. Special consideration, infant may be asymptomatic except for machine-like murmur. Definition, narrowing of the pulmonary artery leads to decreased pulmonary blood flow and right ventricular hypertrophy. Cause, congenital birth defect. Assessment findings, heart murmur, exercise intolerance, oliguria, pale, cool extremities, tachycardia, periods of cyanosis, jugular vein distension, peripheral edema, and/or symptoms of respiratory distress, may also be asymptomatic. Treatment, dilation of constricted area via cardiac catheterization or surgical management. Nursing interventions, monitor vital signs, assess for signs and symptoms of congestive heart failure and/or decreased cardiac output, weigh daily, provide small, frequent feedings to conserve energy, administer oxygen, medication, and fluid restrictions as prescribed. Definition, inflammatory disease that can cause permanent damage to the heart valves with the mitral valve and aortic valve most commonly involved. Causes, RHD is a complication of rheumatic fever. RF typically occurs 2 to 6 weeks after a partially treated or untreated streptococcal throat infection. Assessment findings, RHD, shortness of breath, fatigue, chest pain, tachycardia, palpitations, prolonged PR interval. RF, joint pain, irregular involuntary movements, chorea, fever, erythema marginatum, rash common in RF, elevated sedimentation rate and antistreptolysin titer, subcutaneous nodules over joints. Nursing interventions, RF, monitor vital signs, administer aspirin and antibiotic therapy as ordered. Teach parents home medication management, aspirin toxicity. Need to complete antibiotic therapy, including monthly prophylactic antibiotic if ordered. RHD, assess for decreased cardiac output and congestive heart failure, administer digoxin and diuretics as ordered. Special consideration, child may need prophylactic antibiotic therapy for dental work, infections, and invasive therapies. 388. Cardiovascular disorders, Part 5th Tetralogy of Fallot, transposition of great vessels. 389. nclex flash review, pediatrics disorders, definition, abnormality of the heart that involves 4 defects, ventral septal defect, pulmonary stenosis, overriding aorta. Aorta is over and above ventral septal defect and right ventricular hypertrophy. Cause, congenital birth defect. Assessment findings, TET or blue spells, hypoxic episodes relieved by squatting or knee chest position. Spells often occur during feeding and crying. Cyanosis, murmur, clubbing of fingers, poor growth. Treatment, surgical management via palliative shunt or complete repair. Palliative shunting is done to increase blood flow to pulmonary artery when child is unable to undergo repair. Nursing interventions, during TET or blue spells, calmly place child in knee chest position, administer 100% oxygen via face mask, morphine sulfate, IV fluids per physician order, document occurrence, preceding event, actions taken, and infant's response. Definition, reversal of aorta with the pulmonary artery so that the aorta leaves the right ventricle and the pulmonary artery leaves the left ventricle. Cause, congenital heart defect. Assessment findings, acutely cyanotic at birth due to lack of communication between systemic and pulmonary circulatory systems. If the child also has a ventral septic defect, patent ductus arteriosus or atrial septal defect cyanosis may be less severe. Treatment, administration of prostaglandin E to keep ductus arteriosus patent, atrial septostomy via cardiac catheterization to create an atrial septal defect until surgery can occur, surgical resection of aorta and pulmonary artery, then reattachment in correct anatomical positions to correct circulation. Nursing interventions, administer medications per physician order, and prepare infant for cardiac catheterization or surgery, provide emotional support to parents. Special consideration, transposition of the great vessels is considered a medical emergency. Definition, pulmonary artery, Aorta and coronary arteries form one arterial trunk, and the aortic and pulmonary valves are combined into one truncal valve. A large ventral septal defect is also present. Cause: congenital heart disease stemming from failure of the aorta and pulmonary artery to divide during the embryonic period. Assessment findings: loud continuous murmur, characteristic click from closing of truncal valve, mild cyanosis, signs and symptoms of congestive heart failure. Treatment: requires surgical correction, usually within the first months of life. Nursing interventions: monitor vital signs, assess for cyanosis. Signs: symptoms of congestive heart failure, administer oxygen medications per physician order, provide emotional support to parents. 390. Cardiovascular disorders, part lambda, ventral septal defect VSD, 390. 1. nclex flash review, pediatrics, disorders. Definition: abnormal opening between the right and left ventricles that causes blood to be shunted from the left ventricle to the right ventricle. Can lead to left ventricle enlargement and pulmonary congestion. Cause: congenital heart defect. Assessment findings: small VSD may be asymptomatic, loud murmur, tachypnea, diaphoresis, fatigue, underweight, tiring before feeding complete, symptoms of congestive heart failure. Treatment: small VSDs typically close without treatment. Larger VSDs are treated with digoxin and diuretics until surgical repair occurs. Surgery usually performed between 3 and 12 months of age. Surgical closure may be completed via cardiac catheterization or bypass surgery. Nursing interventions: monitor vital signs, assess for signs and symptoms of congestive heart failure and/or decreased cardiac output, wait daily, provide small frequent feedings to conserve energy, administer oxygen, medication, and fluid restrictions as prescribed. Special consideration: most common congenital heart defect. 392. Endocrine disorders, part L, dehydration, fever, 393. nclex flash review, pediatrics, disorders. Definition: loss of extracellular fluid leading to fluid and electrolyte imbalance. Causes: vomiting, diarrhea, burns, hemorrhage, adrenal insufficiency. Assessment findings: weight loss, increased pulse, depressed or sunken anterior fontanelle, decreased blood pressure, dry mucous membranes, decreased urinary output, decreased or absent tears. Treatment: treatment of underlying cause and correction of fluid and electrolyte imbalance. Oral rehydration via Pedialyte, Infolite, or similar product for mild to moderate dehydration, IV hydration, and electrolyte replacement for severe dehydration. Nursing interventions: assess vital signs, intake and output, monitor for signs of dehydration, administer fluid and electrolytes per order. Special considerations: athletic drinks like Gatorade and Powerade should not be utilized due to their high carbohydrate and low electrolyte concentrations. Fruit juices and carbonated beverages should also be avoided. Definitions: type 1, inability of the pancreas to produce insulin, causing altered ability to metabolize carbohydrates and lipids. Type 2, inability of the body to utilize insulin effectively due to insulin resistance. Causes: combination of genetic, autoimmune, and environmental factors. Obesity increases risk for type 2 diabetes. Assessment findings: polydipsia, increased thirst, polyphagia, increased hunger, polyuria, increased urination, enuresis, weight loss, fatigue, nausea and vomiting, headaches, fruity-smelling breath. Treatment: blood glucose monitoring, diet and exercise counseling and management, augmentation of insulin production via medication type 2, insulin administration via subcutaneous injections or pump type 1. Nursing interventions: monitor glucose levels and administer insulin as ordered. Teach child and caregivers home management of diabetes, including medication or insulin administration, monitoring and recording of glucose levels, nutrition and exercise guidelines, signs, symptoms, and management of hyperglycemia, sick day management. Special consideration: type 2 diabetes is on the rise in children and adolescents. Definition: elevation of body temperature to greater than 38 degrees Celsius or 100.4 degrees Fahrenheit. Causes: viral or bacterial infection. Assessment findings: elevated temperature, skin that is warm and or flushed, diaphoresis, lethargy. Nursing interventions: assess vital signs and foresigns, symptoms of dehydration, administer cool compress to forehead, tepid sponge bath, administer acetaminophen or ibuprofen per order, avoid use of aspirin due to risk for Reye syndrome. Special considerations: temperatures in children fluctuate throughout the day and with activity and emotional distress. The axillary or tympanic route should be utilized to take the child's temperature until the child is greater than 5 or 6 years of age. 394. Endocrine disorders. Part Lambda. Phenylketonuria. 395. nclex flash review. Pediatrics disorders. Definition: blood level of phenylalanine to greater than 20 mg DL. Toxic levels of phenylalanine lead to central nervous system damage. Cause: autorecessive genetic disorder. Assessment findings: phenylalanine blood level greater than 20 mg DL. Seizures, frequent vomiting, failure to gain weight, musty odor of urine, irritability, hyperactivity. Treatment: restriction of phenylalanine intake. Nursing interventions: monitor growth and development, teach parents to limit child's phenylalanine intake through special formulas and avoidance of meat and dairy products, as well as products containing aspartame. Special considerations: newborn screening is required by law. Screening is completed using the Guthrie test. If the test is completed prior to 48 hours after birth, it should be repeated before the child is 14 days of age. 396. Gastrointestinal disorders. Part L: appendicitis, celiac disease. 397. nclex flash review. Pediatrics disorders. Definition: inflammation of appendix, small sac at end of cecum. Causes: blockage of appendiceal lumen from feces, parasites, enlarged lymph tissue, trauma to abdomen. Assessment findings: pain that starts in the periumbilical area and then moves to right lower quadrant of the abdomen. Rebound tenderness, pain upon removal of hand during deep palpation, referred pain, anorexia, nausea, vomiting and/or diarrhea, elevated white blood cell count, abdominal guarding, fever. Treatment: surgical removal of appendix. Nursing interventions: monitor vital signs, assess for signs and symptoms of peritonitis. Sudden relief of pain followed by increased pain, increased fever, progressive abdominal distension, pallor, chills, increased heart rate, and increased respirations. Definition: accumulation of glutamine in the blood due to intolerance of gluten protein component of wheat, barley, rye, and oats. This leads to damage of the small intestine's mucosa and subsequent malabsorption. Cause: genetic disorder. Assessment findings: chronic diarrhea, clay-colored, foul-smelling, greasy stool due to large amounts of unabsorbed fat, steatorrhea, anorexia, weight loss, irritability, abdominal distension. Treatment: avoidance of gluten in the diet. Nursing interventions: nutritional consultation for gluten-free diet, reinforce need to eliminate gluten from diet by eliminating wheat, barley, rye, and oats. Allow parents to verbalize feelings relating to gluten-free diet and provide emotional support. Special considerations: second most common cause of malabsorption in children. Definition: abnormal opening in the lip and/or palate, unilateral, cleft located on one side of lip and/or palate. Bilateral, a cleft is located on both sides of the lip and/or palate. Cause: congenital abnormality where the soft tissue or bony structure of the lip and/or palate fails to fuse during embryonic development. Assessment findings: ranges from slight notch to complete separation of lip palate. Treatment: surgical correction. Nursing interventions: assess extent of cleft via visualization and palpation with gloved finger. Assess infant's ability to suck, swallow, feed. Keep infant in upright position for feedings and keep bulb, syringe, and suction equipment at bassinet crib. Allow parents to verbalize feelings and provide emotional support. Encourage parental bonding with infant. 398. Gastrointestinal disorders. Part 5th: esophageal atresia, tracheoesophageal, fistula, Hirschsprung's disease. 399. nclex flash review. Pediatrics disorders. Definition: a condition in which the esophagus does not fully develop, causing it to end before it reaches the stomach. Esophageal fistula is a fistula that develops between the trachea and esophagus. Esophageal atresia and esophageal fistula typically occur together. Cause: congenital abnormality. Assessment findings: copious frothy bubbles in mouth, coughing, choking, cyanosis, abdominal distension, increased respiratory distress during and after feedings, Treatment, surgical repair. Nursing interventions, monitor vital signs and respiratory status, maintain NPO, nothing by mouth status, suction mouth secretions as needed, administer oxygen and IV therapy, antibiotics, and parental nutrition as ordered. Keep head elevated. Special consideration, high risk for aspiration pneumonia. Definition, absence of the parasympathetic nerve ganglion cells in the large intestine, causing severe constipation and intestinal blockage, also known as congenital aganglionic megacolon. Cause, congenital disease. Assessment findings, newborns, not passing meconium stool, bloody diarrhea, vomiting dark green or brown emesis, abdominal swelling, gas, reluctance to breast or bottle feed. Toddlers, older children, foul-smelling stool, fever, lack of energy, anemia, retarded growth, gas, bloody diarrhea, abdominal swelling, inability to pass stools without use of laxatives, enemas, severe constipation. Treatment, surgery, temporary colostomy to allow for bowel rest followed by removal of a ganglionic bowel section with anastomosis of normal bowel and reversal of temporary colostomy. Nursing interventions, monitor for signs and symptoms of bowel obstruction. Nursing measures to prepare child for surgery. Teach caregivers ostomy management. Encourage verbalization of feelings and provide emotional support. Definition, intestinal parasite that causes gastrointestinal distress, prevalent in crowded environments. Cause, protozoa. Assessment findings, abdominal cramps, constipation alternating with loose stools, anorexia, steatorrhea, vomiting. Nursing interventions, educate caregivers and children on proper hand washing and sanitary practices. Encourage compliance with prescribed medication regime, metronidazole, tinidazole, nitazoxanide, or albendazole. Special consideration can spontaneously resolve in 4 to 6 weeks. Gastrointestinal disorders, part lambda, intestinal parasites, pinworms, intussusceptions, omphalosal. 401. nclex Flash Review. Pediatrics, disorders. Definition, intestinal parasite that causes gastrointestinal distress present in temperate climates. Causes, swallowing eggs of pinworms, most often occurs when someone with pinworms scratches around anus, getting the eggs on his or her hands, and then touches a surface or handles food that is later touched or eaten by the child. Assessment findings, perianal itching, scratching, restlessness, disturbed sleeping patterns, enuresis. Nursing interventions, teach caregiver and child proper hand washing. Encourage all family members to comply with prescribed medication regime Vermox, Pinrid, Albenza. Special considerations, pinworms can be visually detected via inspection of anus with flashlight after child is asleep for 2 to 3 hours, often diagnosed via tape test, which consists of placing loop of transparent tape in child's perianal area and removing it in the morning for analysis. Definition, one part of the intestine is prolapsed into another, blocking passage of food or causing the prolapsed portion of the intestine to die. Causes not known. Assessment findings, sudden loud crying, colicky abdominal pain drawing up of knees to chest, vomiting bile-stained emesis, bloody mucus stools, current jelly stools, hypo or hyperactive bowel sounds, distended abdomen, fever, shock. Treatment, hydrostatic reduction, pressure from air or fluid is used to release the prolapsed intestine, surgery. Nursing interventions, assess vital signs, monitor for signs of shock, administer antibiotics and IV fluids as prescribed, insert nasogastric ing tube if ordered, monitor for return of normal bowel functioning post-treatment. Definition, congenital malformation where abdominal contents herniate outside of the abdomen, usually in the umbilical area. Abdominal viscera are covered with a protective sac. It is caused by a failure of the intestines to re-enter the abdominal cavity during the 7th week of gestation, and it is treated via surgery. 402. Gastrointestinal disorders, Part L. Poisoning, aspirin, acetaminophen, corrosives. 4SR Flash Review. Pediatrics, disorders. Definition, ingestion, inhalation, or exposure to substance that interferes with the body's normal functioning, causing harm to the body. Causes, most pre-adolescent episodes occur as accidents within the home. Assessment findings vary by poisoning agent. Treatment varies by poisoning agent, may include syrup of ipecac, induces vomiting, use less common, contraindicated for corrosive substances. Gastric lavage, Used to empty the stomach within 1 to 2 hours of ingestion. Contraindicated for corrosive substances. Activated charcoal decreases amount of toxic agent absorbed by GI system. Cathartic agents hasten expulsion of the substance by increased GI motility. Antidotes vary by type of poisoning. Nursing interventions monitor vital signs, airway, breathing, and circulation. Administer oxygen. Assist in identification of poison and administration of ordered treatment. Educate all parents on modification of the home for child safety during infancy before the child can crawl. Special consideration for toddlers and preschoolers. Poisoning is the 4th leading cause of death and the leading cause of injury. Poison acetaminophen, Tylenol, acetylsalicylic acid, aspirin. Corrosive symptoms: general nausea, vomiting, weakness, malaise, confusion, diaphoresis, drowsiness. Hepatic, jaundice, right upper quadrant, abdominal pain, stupor, increased liver and bilirubin levels. Note: hepatic symptoms may be irreversible. Nausea, vomiting, tinnitus, hyperpnea, fever, confusion, sweating, seizures, oliguria, coma. Burning in mouth, throat, stomach, vomiting, drooling. Treatment: administration of N-acetylcysteine mucomist may be diluted in juice or soda to increase palatability. Activated charcoal cathartics dilute corrosive with water or milk, do not induce vomiting. 404. Part Lambda. Poisoning lead. 405. nclex Flash Review. Pediatrics. Disorders. Definition: accumulation of excessive levels or toxic levels of lead in the blood. Causes: commonly occurs through ingestion of lead-contaminated objects such as loose paint chips, pottery, or ceramic ware, or inhalation of lead dust within the environment. Assessment findings: bone pain, constipation, increased intracranial pressure, changes in behavior or motor activity, weight loss, vomiting, peripheral neuritis, lead lines in gums. Treatments: chelation therapy, administration of calcium disodium edentate EDTA. Nursing interventions: assess vital signs, administer 4 fluids, chelation therapy, medications as ordered. If EDTA prescribed, administer IM into large muscle mass to decrease pain. Monitor calcium levels, intake and output, hydration and kidney functioning. Teach parents preventive measures, medication administration, and need for continued follow-up. Special consideration: screening occurs by assessment of blood levels of lead. Guidelines vary by state, but screening generally occurs between ages of 1 and 2 or earlier if in high-risk area. Definition: enlargement of the muscles surrounding the pylorus, causing a narrowing of the pyloric canal and blocking of food passage from stomach to intestines. Cause: progressive thickening of muscles surrounding pylorus. Assessment findings: symptoms typically begin at 3 weeks of age and include vomiting that progresses from mild regurgitation to projectile, hunger after vomiting, decreased stools, constipation, mucus or bloody stools, dehydration symptoms, electrolyte imbalance. Treatment: replace fluids and electrolytes, pyloromyotomy, surgical procedure where muscles surrounding pylorus are cut to relieve constriction. Nursing interventions: monitor vital signs, emesis, intake and output, assess for signs and symptoms of dehydration and electrolyte imbalances, assist in preparation of child and family for pyloromyotomy. Gastrointestinal disorders: Part Lambda, vomiting, diarrhea. 407. nclex Flash Review. Pediatrics disorders. Vomiting, diarrhea causes increased intracranial pressure, infectious diseases, antibiotic virus, toxic ingestion, food intol, therapy, intestinal parasites, errants, obstruction in GI tract. Inflammatory bowel disease, food allergies, rotavirus. Concerns: aspiration, dehydration. Assessment characteristics of emesis: characteristics of stool, S, aspiration, dehydration, fluid hydration, fluid and electrolyte imbalance. Nursing: maintain patent airway, monitor vital signs, stool, intake intervention, store vital signs, emesis, force of and output, S, dehydration, vomiting, intake and output, and electrolyte imbalance, S, dehydration and electrolyte dehydration. Provide oral rehy imbalance, provide oral dration, provide IV hydration if rehydration. Ordered. Orders: genitourinary disorders, Part L. Cryptorchidism, enuresis, epispadias, hypospadias, 409, nclex RN flash review. Pediatrics disorders. Definition: failure of one or both of the testes to descend into scrotal sac, usually self-resolves during first year of life. If not, surgery or orchiopexy may be performed. Definition: child is unable to control bladder function even though child is of age to have bladder control or had control previously. Causes: delayed maturation of central nervous system, sleep disorders, urinary tract infections, other organic causes. Assessment findings: primary nocturnal enuresis, bedwetting at night in child who has never been dry throughout night. Child is unable to sense, awaken from full bladder. Secondary acquired enuresis, occasional wetting after period of bladder control, may occur during night or day. Dysuria, urgency and/or frequency may also occur. Nursing interventions assist in assessment for underlying disease process, such as urinary tract infection. Encourage limited fluids at night, voiding prior to going to bed. Encourage verbalization of child's and caregivers' feelings, concerns. Provide emotional support. Promote child self-esteem. Special considerations. Bedwetting is common in childhood. Primary nocturnal enuresis usually self-resolves as the child matures. Definition: congenital defect where urethral opening of the penis is abnormally placed. Circumcision is not usually performed, and surgical correction of the defect is usually conducted prior to the age of toilet training. Epispadias, opening is on dorsal side of penis. Hypospadias, opening is located on ventral side of the penis. 410. Genitourinary disorders, part lambda, glomerulonephritis. 411. nclex RN flash review. Pediatrics disorders. Definition: kidney disorder where there is injury to glomerulus from inflammation. Causes: immunologic reaction, most likely antigen antibody to group of streptococci elsewhere in the body. Assessment findings: morning edema in face and periorbital area. Urinary output that is decreased, cloudy or bloody. Proteinuria, lethargy, preceding infection or fever. Elevated blood urea nitrogen (BUN) and serum creatinine. Anorexia, fatigue, irritability, headaches. Nursing interventions assess vital signs, weight, intake and urinary output. Limit activities during acute phase. Administer medications as ordered. Diet restrictions of sodium and protein as ordered. Definition: presence of microorganisms in the urinary tract causing infection. Causes: most common cause is Escherichia coli. Assessment findings: vomiting, fever, poor feeding, failure to gain weight, diaper rash, enuresis, abdominal or back pain, blood in urine. Nursing interventions: encourage fluids, teach prevention, wiping from front to back especially in girls, changing stool-soaked diaper immediately, teach caregivers signs, symptoms of urinary tract infection, and when to notify healthcare professional. 412. Head, eye, ear disorders, part 5th conjunctivitis, pink eye. 413. nclex RN flash review. Pediatrics disorders. Definition: inflammation of the conjunctiva in the eye. Causes: neonatal, chemical irritation or infection such as maternal chlamydia. Childhood, allergy or bacterial, viral infection. Assessment findings: itching, burning, red eyes, photophobia, discharge from eyes. Nursing interventions: cold compresses to eye, reduced lighting, prevention of eye rubbing, administer prescribed eye ointments from inner to outer cannula, teach caregivers proper hand washing after touching child's eye, encourage use of separate towel, washcloth and pillowcase for infected child. Special considerations: child should not attend daycare or school until infection is resolved or until 48 hours after treatment is initiated, depending on school district, state policy. Definition: inflammatory infection of the middle ear. Causes: bacteria. Assessment findings: fever, pain, tugging at ears, dependent on child's age. Otoscopic examination reveals red, bulging eardrum, enlarged lymph nodes. Nursing interventions: teach home management, taking antibiotics as prescribed, including complete course of therapy, avoidance of bottle feeding infant in a supine position to decrease risk for otitis media. Special considerations to perform otoscopic exam on a young child: gently pull the pinna down and back. Definition: infestation of the head with pediculus humaniscapitis. Spread: head-to-head contact or contact with hat, comb, bedding, or other personal item from infected person. Assessment findings: persistent itching of the scalp, mild fever, malaise, presence of louse or nits, oval-shaped eggs. Treatment: pediculicides, permethrin nix, lindane quell, scabiene, and removal of nits. Nursing interventions: teach caregivers hair care, wash child's hair with regular shampoo, then apply pediculicide according to manufacturer's instructions. Following application: wet hair should be combed with fine-tooth comb to remove all nits. Work with small sections of the hair from the scalp outward. Teach cleansing of all potentially contaminated items by washing in hot water greater than 120 degrees Fahrenheit, having items dry cleaned or placing them in sealed bag for 2 weeks. Soak combs and brushes in rubbing alcohol or boiling water. Vacuum floors and furniture. 414. Hematological, immune system disorders. Part L. Allergies. 415. nclex flash review. Pediatrics disorders. Cause: IgE antibodies react with the substance, releasing histamines and causing visible signs and symptoms of a reaction. Assessment findings: nausea, vomiting, diarrhea, blood in stools, itchiness, hives, wheezing, coughing, sneezing, runny nose. Anaphylactic: swelling of lips, mouth, throat, tightening of throat, difficulty breathing, wheezing, coughing. Nursing interventions: anaphylactic symptoms, administer epinephrine and diphenhydramine per order. General: educate caretaker and child on avoidance of foods containing allergen and or reduction of exposure to environmental allergens. Teach anaphylactic signs and symptoms and management. Include use of EpiPen if ordered. Allow caretaker and child to verbalize feelings and fears related to allergy and provide support. Prevention: encourage breastfeeding for the first 6 months. Encourage avoidance of cow's milk, eggs, fish, and peanuts during first year. Special considerations: common food allergens include milk, eggs, soy, wheat, tree nuts, fish, shellfish, peanuts. Small amounts of allergen can be transmitted through breast milk and cause a reaction. Definition: a group of disorders in which a deficiency of specific coagulation proteins causes bleeding. Common types include a factor V8 deficiency and B. Christmas disease factor IX deficiency. Causes: genetic X-linked recessive disorder, mutation of specific gene. Assessment findings: excessive or abnormal bleeding, bleeding after circumcision, nosebleeds, joint swelling, pain, warmth or tenderness, tendency to bruise easily, prolonged PTT. Treatment: A. Frozen factor V8 cryoprecipitate, desmopressin acetate, DAVP. B. Concentrated factor IX. Nursing interventions: monitor for S. bleeding, institute bleeding precautions, administer replacement factors as ordered, elevate, ice, and immobilize impacted joints, encourage avoidance of contact sports and the use of helmets, knee pads, and elbow pads for bike riding and skating. Teach signs, symptoms of bleeding and management of same. Teach home administration of factors if administration is to be done at home. 416. Hematological, immune system disorders. Part L. Leukemia. 417. nclex flash review. Pediatrics disorders. Definition: a cancer of the white blood cells in which production is increased, causing release of blast cells, immature blood cells versus mature white blood cells into the blood. Causes: virus, chemical exposure, genetics, radiation ionizing. Assessment findings: blood enemesis, bloody stools, hematuria, bone, joint pain, fatigue, history of frequent infections, low-grade fever, swelling of lymph nodes, petechia, bruising, blue-purple circles under eyes, blast cells in bloodstream, white blood cell count 10,000. Treatment: chemotherapy, radiation therapy, bone marrow transplant, transfusions. Nursing interventions: monitor vital signs and intake outputs. Teach, encourage high-protein diet with no raw fruits or vegetables. Encourage avoidance of people with infectious diseases. Perform interventions appropriate for treatment being administered. Encourage verbalization of caregivers and child's feelings. Offer emotional support. Definition: disorder in which body makes sickle-shaped red blood cells that contain hemoglobin S versus hemoglobin A and have a decreased capacity to carry oxygen to the tissues. Causes: genetic, African Americans are at higher risk. Assessment findings: fatigue, pallor, shortness of breath, dizziness, abdominal pain, joint pain, lethargy, irritability, fever, enlarged spleen, jaundice, decreased growth. Vaso-occlusive crisis, clumping of cells in circulation. Dactylitis, hand-foot syndrome, tender, warm, and swollen hands and or feet. Sequestration crisis, pooling of blood in the spleen. Enlarged spleen, jaundice. Aplastic crisis, decreased production of red blood cells. Nursing interventions, assess vital signs, hydration, oxygenation, administer pain medication. IV fluids as ordered. Promote elevation of joints. Do not elevate head of bed more than 30 degrees. Encourage high-protein diet. Encourage receipt of flu, pneumonia, and meningococcal vaccinations. Teach prevention of activities that promote crisis, including high altitudes, excessive exercise, deep-sea diving, use of aspirin. Encourage treatment at early signs of infectious disease, dehydration. 418. Integumentary disorders, part lambda, acne vulgaris, acne, eczema. 419. nclex flash review, pediatrics, disorders. Definition: common skin disease of adolescents characterized by eruption of papules and or pustule on face, chest, and or back. Causes during teen years: sebaceous glands increase in size and production of sebum. The epithelial cells lining skin follicle become more cohesive and accumulate sebum and dead skin cells, effectively clogging the skin pore. Assessment findings: papules and or pustules on face, chest, back. Nursing interventions: teach adolescent proper skin hygiene, avoidance of popping acne pimple, and correct administration of skincare treatment plan, including medications, topical creams, and cleansing agents. Definition: macerations and lesions in the perineum. Causes: prolonged contact with urine or feces, reaction to foods. Assessment findings: red, macerated skin with lesions. Nursing interventions: assess for symptoms of candidiasis, yeast infection, such as beefy red erythema with satellite lesions. Teach caregiver importance of changing diapers when soiled, cleansing thoroughly with wipe or gentle soap and water, application of barrier ointment or cream after skin is dried, exposure of affected skin to air several minutes each day. Special considerations: candidiasis, yeast infections require treatment with prescription antifungal cream, ointment. Definition: inflammation of the epidermis. Causes: associated factors include family history of eczema, allergies, asthma. Assessment findings: redness, scales, minute papules, lesions that weep, ooze and or crust, itchiness. Nursing interventions: teach child and caregiver to avoid excessive bathing and exposure of skin to harsh soaps and detergents. Encourage lubrication of skin after bathing. Teach prescribed medication regime including antihistamines, topical corticosteroids, antibiotics if infection occurs. Encourage short, clean nails. Teach signs, symptoms of skin infection and management of same. Integumentary disorders, part lambda, impetigo. 421. nclex flash review. Pediatrics disorders. Definition: superficial bacterial skin infection. Causes: Staphylococcus aureus or Streptococcus pyogenes, methicillin-resistant Staphylococcus aureus MRSA. Assessment findings: lesions, itchiness, burning, redness, non-bullous, small fluid-filled blisters that erupt and then form a tan or yellow-brown crust. Bullous, large blisters filled with clear fluid that turns cloudy. Blisters not as likely to erupt. Nursing interventions: teach child and caregiver to allow lesions to air dry. Administer medications such as topical ointments and antibiotics as prescribed. Use warm saline soaks to remove crusting. Keep child's fingernails short and clean. Use of separate towels and linens and proper hand washing technique. 422. Musculoskeletal disorders, part 5th, Barlow, M. Maneuver. 423. nclex flash review. Pediatrics disorders. Definition: with infant lying supine, flex hips to 90 degrees. Place index and middle finger of greater trochanters and thumb at inner thigh inguinal crease. Gently adduct hip while applying gentle downward force. If a click is heard or felt, it is considered a positive response and is indicative of a hip dysplasia. Definition: abnormal development of the hip during fetal period or childhood, in which the femur is positioned incorrectly in the acetabulum, results in affected leg being shorter than non-affected leg. Treatment usually consists of open or closed hip reduction. Definition: autoimmune disease causing inflammation of the joints. Causes: interaction of genetic, environmental, and immunological factors. Assessment findings: stiffness and immobility of joints in the morning, joint pain, muscle pain, fatigue, malaise, lymphadenopathy, fevers, salmon pink, migratory rash in late afternoon or evening, periods of exacerbation and remission of symptoms. Treatment: nonsteroidal anti-inflammatory drugs NSAIDs, slow-acting anti-rheumatic drugs SARDs such as sulfasalazine, methotrexate, corticosteroids. Nursing interventions: assess range of motion and strength, apply heat or cold therapy, position joints to relieve pain and provide support, teach, encourage adherence to prescribed medication regime, avoidance of contact sports and high-impact activities, alternating periods of activity with periods of rest. 424. Musculoskeletal disorders. Part Lambda. Muscular dystrophy Duchenne's, scoliosis. 425. nclex flash review. Pediatrics, disorders. Definition: disease that involves progressive muscular deterioration and generally results in death. Mostly affects males. Causes: genetic defect in the X chromosome that interferes with dystrophin production, resulting in the breakdown of the muscle fibers. Assessment findings: pelvic weakness, delayed motor development, waddling, walking on toes, marked lordosis, muscle weakness, wasting progressing from proximal to distal muscles. Gower's sign: having to use hands to push self up from squatting position. Nursing interventions: encourage verbalization of feelings, fears, provide emotional support, assist child in maintaining self-esteem and reaching potential, offer parents genetic counseling, refer to physical therapy and appropriate community resources, teach caregivers prevention of respiratory infections, and promote healthy diet and weight. Special consideration: there is no known cure for muscular dystrophy. Definition: performed by flexing infants' hips and knees to 90 degrees. The healthcare provider then places index fingers on greater trochanters and applies gentle pressure while abducting infants' legs. If a click is heard or felt, it is considered a positive response and can be indicative of posterior dislocation of the hip. Definition: lateral curvature of the spine accompanied by rotation of the vertebral column, may be structural primary deformity or functional secondary to another problem. Findings usually include unequal hip or shoulder heights, prominent scapula, curved spinal column, asymmetry of the back. Treatment can involve electrical stimulation, bracing, or surgery. 426. Neurological, cognitive disorders. Part Lambda. Attention deficit, hyperactivity disorder, ADHD, autism. 427. nclex flash review. Pediatrics disorders. Definition: learning disorder with characteristic inattention, hyperactivity, and/or impulsivity. Causes unknown, but risk increases with first-degree relative with the disorder. Assessment findings: inability to concentrate, easily distracted, appears to ignore instructions, tasks, or assigned chores, does not complete tasks, underachievement in school, excessive fidgeting, disruptive in classroom, interrupts others, impulsive. Treatments: pharmacotherapy and behavioral therapy. Nursing interventions: educate caregivers on prescribed medication regime and home interventions, development of routines, clear, concise rules with appropriate consequences, assign one task at a time, break large tasks into smaller parts, educate on schoolwork interventions, copies of school books at home, use of colored markers to highlight books, close communication with child's teachers. Allow child and caregiver to verbalize feelings, fears, provide emotional support, promote child self-esteem. Definition: a developmental disorder that interferes with child's ability to communicate and interact with others. Causes: possibly genetic with environmental trigger, not caused by childhood vaccinations. Assessment findings: poor eye contact, failure to respond to name, poor communication skills, bizarre body movements, sing-song voice, robot-like voice, sensitivity to tactile stimulation, altered response to pain, solitary play, behavior or play rituals, awkward gait, rocking, waving hands, banging head into objects. Nursing interventions: when caring for an autistic child, incorporate the caregivers in the planning of care. Find out child's routines, likes and dislikes. Response to pain, self-care needs, allow caregivers to verbalize feelings, provide emotional support. 428. Neurological, cognitive disorders. Part Lambda, cerebral palsy types. 429. nclex flash review. Pediatrics disorders. Definition: non-progressive neurological disorder that appears in infancy or early childhood and causes permanent motor dysfunction. Causes abnormality in the section of the brain that controls motor movement, arising from congenital malformation or anoxia of the brain before, during, after birth. Assessment findings vary based on muscle responses: hypotonia, floppiness, diminished reflexes, hypertonia, rigidity, spasticity, scissoring of lower legs, exaggerated reflexes, athetosis, involuntary writhing motions, ataxia, uncoordinated muscle movement, wide-based gait. Nursing interventions assist in early recognition and implementation of early interventions to maximize child's potential. Assess child's developmental level, encourage communication and interactions appropriate for child's developmental age. Teach caregiver feeding methods to prevent aspiration, such as upright position and support of lower jaw. Coordinate multidisciplinary care team including physical therapist, occupational therapist, speech therapist, nutritionist, and orthopedics. Allow family to verbalize feelings, offer emotional support. Refer to appropriate community agency support groups. Type hemiplegia, diplegia, quadriplegia involves one side of body, upper extremities with greater dysfunction than lower. Both sides of body involved, lower extremities with greater dysfunction than upper. All four extremities involved equally. 430. Neurological, cognitive disorders, part lambda, hydrocephalus, neural tube defects. 431. nclex flash review, pediatrics, disorders. Definition: increased retention of cerebral spinal fluid within ventricles of the brain. Causes: obstruction of blood flow between ventricles, increased risk with Dandy-Walker syndrome, spina bifida, meningitis. Assessment findings: infants shrill cry, bulging fontanelle, widening suture lines, sunset eyes. Older children: change in level of consciousness, headache, vomiting, irritability, seizures, lethargy. Both decrease pulse, increase blood pressure. Nursing interventions: pre-op, elevate head of bed, prepare for surgical insertion of shunt from ventricle to peritoneum. Post-op, assess for signs of shunt malfunction, signs of increased intracranial pressure. Assess for signs of infection. Teach client to watch for signs of increased intracranial pressure and to report immediately to physician, as shunt will need to be revised. Special consideration: although shunt is designed to grow with child, the child will eventually outgrow shunt and need to have it replaced. Encephaly cranioschisis, exencephaly, encephalocellus, spina bifida absence, or decreased size of cerebral hemispheres. Death usually occurs due to respiratory failure. Protrusion of neural tissue through skull defect. Brain is totally exposed or protruding from skull defect. Sac-like protrusion of brain and meninges through skull defect. Posterior vertebral arch fails to fuse or fails to close. 432. Part 5th rise syndactyromy. 433. nclex flash review. Pediatrics disorders. Definition: a disorder where cerebral edema and fatty changes in the liver occur after a viral illness, linked to use of aspirin in children. Therefore, acetaminophen is the preferred medication. Children and teenagers with flu-like symptoms or chicken pox should never be given aspirin. Definition: birth defect of the central nervous system in which there is incomplete development of the spinal cord or its covering. Causes: failure of the neural tube to close during the first 28 days of gestation. Folic acid deficiency has been linked to spina bifida. Assessment findings vary by type. Nursing interventions: assess for hydrocephalus, measure head circumference daily, assess for signs of meningeal irritation such as fever and nuchal rigidity. If meningocele or myomeningocele is present, position infant on abdomen, cover defect with normal saline dressing, prepare infant for surgery, allow parents to express feelings and fears, provide emotional support. Type occulta cystica definition: failure of posterior vertebral arch to fuse without protrusions of the meninges. Failure of posterior vertebral arch to fuse resulting in protrusion of the meninges. Symptoms: dimple or small depression noted at fifth lumbar vertebra or first sacral vertebra, may have abnormal gait and or difficulty controlling bowel and bladder. Meningocele, sac-like herniation of the meninges and cerebral spinal fluid through a hole in the vertebrae, neurological deficits usually not present. Myelomeningocele, sac-like protrusion of meninges, cerebrospinal fluid, nerves and a portion of the spinal column, neurological defects evident. Neurological, cognitive disorders, part lambda, trisomy 21, Down syndrome, 435, nclex flash review. Pediatrics disorders. Definition: congenital disorder characterized by having an extra copy of chromosome 21, causes distinct physical attributes and decreased cognitive capabilities. Cause: incorrect, incomplete, division, replication of chromosome 21. Assessment findings: inner epicanthal eye folds, upper outer slant of eyes, flat and broad nose, protruding tongue, short neck, simian crease, palmar crease presenting as an unbroken line traveling straight across palmar surface, mental retardation, often accompanied by structural, functional, cardiac, and gastrointestinal disorders. Nursing interventions: allow parents to verbalize feelings and offer emotional support, assess for feeding problems, cardiac and respiratory issues, delays in growth and development, refer to physical therapy, occupational therapy, speech therapy, and social services as needed. Special considerations: trisomy 21 may be diagnosed during pregnancy via amniocentesis. Maternal serum alpha protein testing and fetal ultrasound may indicate Down syndrome during pregnancy but are not considered to be diagnostic tests. 436. Respiratory disorders, part L, asthma, bronchopulmonary dysplasia. 437. nclex flash review. Pediatrics disorders. Definition: reactive airway disease, in which smooth muscles around the bronchi and bronchioles contract, causing a narrowing of the airway passages and/or causing the airways to become edematous and clogged. Causes: exposure to triggers such as allergens and cold air. Assessment findings: tightness in the chest, cough, wheezing, retractions, decreased breath sounds, progressively worsening shortness of breath. Nursing interventions: monitor respiratory status including pulse oximetry, respiratory effort, and lung sounds. Administer oxygen, IV steroids, and nebulizer treatments per physician order. Obtain blood gases per order. Teach home management including identification, avoidance of asthma triggers, correct use of metered dose inhaler, and management of acute episodes, including when to seek emergency care. Special consideration: parents should be taught to use fast-acting bronchodilators for symptomatic treatment. Definition: chronic lung condition of newborns characterized by pulmonary changes such as bronchiolar metaplasia and interstitial fibrosis. Causes: risk factors include premature birth, long-term use of oxygen therapy, need for ventilator after birth. Assessment findings: increased respiratory effort, nasal flaring, sterno retractions, increased respirations, elevated heart rate, crackles, rhonchi, wheezes, atelectasis. Nursing interventions: monitor vital signs, assess cardiopulmonary status, provide oxygen or ventilator therapy as ordered, administer medications as ordered, surfactant, diuretics, corticosteroids, bronchodilators. Teach parents home management, including oxygen therapy, tube feedings, and prevention of respiratory infections. Allow caregivers to verbalize feelings, fears, offer emotional support. Definition: swelling and inflammation of the upper airway, leading to difficulty breathing and a barking cough. Causes: viral infection is the most common cause. Assessment findings: barking cough, inspiratory stridor, elevated temperature, cold-like symptoms prior to onset. Treatment: most cases of mild croup are managed at home with cool mist humidifier therapy. Moderate croup is managed through the emergency department with cool mist, aerosolized treatments, steroids. Severe croup is treated with nebulized racemic epinephrine and hospitalization. Nursing interventions: monitor vital signs, oxygen saturations, administer aerosolized treatments and medications as prescribed, provide cool mist or oxygen as ordered, assess hydration status, and encourage intake of cool fluids. Special consideration: symptoms are often worse at night. Respiratory disorders, Part V, cystic fibrosis. 439. nclex flash review. Pediatrics disorders. Definition: chronic disease of lung and digestive system in which thick, viscous mucus is produced, causing clogging in the lungs and obstruction in the pancreas. Cause: genetic. Assessment findings: salty tasting skin, frequent respiratory infections, chronic productive cough, greasy, bulky, foul-smelling stools, wheezing, dyspnea, cyanosis, barrel chest, newborn meconium ileus, intestinal obstruction, delayed onset of puberty. Nursing interventions: monitor vital signs, respiratory status, weight, signs of intestinal obstruction, blood glucose levels, encourage consistent administration of pancreatic enzyme replacements with meals and snacks, encourage deep breathing exercises and chest physiotherapy or use of oscillating vest to loosen mucus, encourage adherence to high-protein, high-calorie diet with added salt, encourage verbalization of feelings, fears, provide emotional support, refer to appropriate community agencies. Definition: life-threatening infection with inflammation and edema of the epiglottis. Causes: bacterial infection. Assessment findings: extension of neck into a sniffing position, difficult and painful swallowing, increased drooling, restlessness, stridor, fever, cough, sore throat, tripod position when sitting. Treatment: emergency endotracheal intubation or tracheotomy. Nursing interventions: monitor vital signs and oxygenation, decrease child's anxiety, stress. Do not use tongue blade to inspect throat as this could cause epiglottis spasms and airway occlusion. Prepare child caregiver for endotracheal intubation or tracheotomy. Allow caregiver to verbalize feelings, fears, offer emotional support. Definition: bronchiolitis is a lung infection with production of thick mucus that causes occlusion and spasms of the bronchioles and small bronchi. The most common cause in children is RSV, a contagious disease spread by droplets of the virus sneezed or coughed into the air by an infected person. 440. Respiratory disorders. Part 5th, Sudidin and FNT Death Syndrome SIDS. Death Syndrome SIDS risk reduction. nclex flash review. Pediatrics disorders. Definition: sudden, unexplained death of a healthy infant after being put to sleep. Causes: not known, but risk factors include low birth weight, history of siblings with syndrome, maternal smoking during pregnancy, sleeping in non-safe sleep environment. Assessment finding: death of the infant. Nursing interventions allow caregivers to verbalize feelings of loss, guilt, anger, provide emotional support, allow caregivers to cuddle infant and say goodbye, assist caregivers in contacting clergy if desired, refer to appropriate community agencies. Risk reduction techniques include placing infant on back to sleep, avoidance of bed sharing, use of a crib with a firm mattress and a fitted sheet tied around mattress, avoidance of pillows, blankets, stuffed animals, bumper pads in crib, avoidance of soft surfaces for sleeping, such as couches, waterbeds, sofas, adult beds, toddler beds, breastfeeding, offering clean pacifier for sleep if breastfeeding, offer pacifier after breastfeeding firmly established, dressing infant in light clothing and keeping room temperature at a comfortable level. 442. Pediatrics, medication. Pediatrics, medication. Part 6 calculations. Intravenous Barrett sets. 445. nclex flash review. Pediatrics, medication. Pounds to kilograms, kilograms to pounds, milligrams per kilogram per day. mg kg day, milligrams kilograms dose divide the child's weight in pounds by 2.2, lbs 2.2 equal to weight in kilograms. Multiply child's weight in kilograms by 2.2 kgx 2.2 equal to weight in pounds. Milligrams to be administered multiplied by the child's weight in kg equals the total mg per day. mg x kg equal to milligrams per day. Divide milligrams per day by number of doses to be given per day to get mg for each dose, milligrams per day. Number of daily doses equal to mg per dose. Developmental stage infant, toddler, preschooler, elementary school age, adolescent, needle length, preferred location. Vastus lateralis, deltoid, rectus femoris. Vastus lateralis, rectus femoris, ventral, gluteal dorsal, gluteal deltoid. Vastus lateralis, ventral, gluteal dorsal, gluteal deltoid. Vastus lateralis, rectus femoris, ventral, gluteal dorsal, gluteal deltoid, 5 to 8 inch, 1 inch, 1 inch, 1 to 1.5 inches, 1 to 1.5 inches. Definition: microdrip set used for IV medication administration via piggyback to ensure exact delivery of small volumes of fluid. Delivers 60 GTT/ml with a total capacity of 100 to 150 milliliters. 446. Pediatrics medication, Part V. Metered dose inhalers administration of. Nasal drops, otic drops administration of. 447. nclex RN flash review. Pediatrics medication. Administration technique. Have child exhale. As child is inhaling, administer medication. Have child hold breath 5 to 10 seconds. Have child exhale. Use of spacer with metered dose inhaler. Have child exhale. Administer medication just prior to child inhaling. Have child inhale and hold breath for 5 to 10 seconds. Have child exhale. Have child inhale and hold breath 5 to 10 seconds. Have child exhale. Nasal medications, otic medications, and place child with head carefully hyperextended. For younger child, have caregiver hold child on his or her lap with head extended over lap. Have caregiver restrain child as needed. Administer nose drop, being careful not to let dropper touch nair. And have child remain with head hyperextended for 1 minute. And have child lie on side with affected ear exposed. Younger child may be placed on caregiver's lap. Have caregiver restrain child as needed, and gently pull pinna down and backward young child, or up and outward older child. Administer medication. Have child remain on side for 1 minute. Techniques for administration: mix suspensions thoroughly before pouring. Use firm, matter-of-fact approach. Use oral plastic syringe or measured medicine spoon, dropper, medicine cup, or nipple without the bottle attached, depending on child's developmental age. When using a dropper or oral syringe, direct liquid to the back and side of mouth, give in small quantities, and allow child to swallow. Small child may be placed across lap with child's dominant arm under adult's arm. Child's head should be cradled in non-dominant arm. Administer medication slowly, directing liquid to the back and side of mouth. When using nipple without bottle, be careful to keep nipple full of medication to prevent air being taken in. Pediatrics medication. Part 6. Subcutaneous injections. 449. nclex RN flash review. Pediatrics medication. Location: procedural tip center third of lateral aspect of upper arm. Abdomen, center third of anterior thigh. Pinch subcutaneous tissue to prevent injection into muscle. 450. Mental health. Anxiety disorders. Anxiety. 453. nclex RN flash review. Mental health. Terms: anticipatory anxiety, worry or fear about what will happen next. Anxiety trait: responding to non-stressful situations with anxiety over a long period of time. Anxiety state: client loses control of his or her emotions in response to a stressful situation. Free-floating worry or fear that is always present and may be a comp anxiety nighed by a feeling of dread. Mild, moderate, severe panic, worry or fear that is a part of living. It is perceived to be normal and can even produce positive outcomes by motivating or creating growth in an individual. Individual focuses on immediate concern and is selectively inattentive to other concerns. Belief that something bad is going to happen, unable to focus on anything else. Dread, terror, and/or sense of impending doom. Perception becomes distorted. Rational thought is lost. Definition: unrealistic worry or excessive worry that occurs majority of the time, manifests with physical symptoms, and is not caused by substance abuse and/or another medical condition. Cause: multiple theories including 1. Anxiety is a learned response. 2. Stems from cultural factors. 3. Genetic component. 4. Biological component. Assessment findings varies by level of anxiety but includes elevated blood pressure and pulse, diaphoresis, hyperventilation, anorexia, sleep disturbances, dizziness, fatigue, inability to concentrate, pacing, nervous habits, decreased productivity, forgetfulness, inability to concentrate, withdrawal. Treatments. Interventions are based on level of anxiety and include medication, cognitive behavioral therapy, individual psychotherapy, and complementary therapies such as guided imagery, massage, and meditation. Nursing interventions utilize a non-judgmental approach, assist client in meeting basic needs if needed, provide calm, non-stimulating environment, allow client to verbalize feelings, Administer medications as ordered. 454. Anxiety disorders. Part 7th. Obsessive-compulsive disorder. 455. nclex flash review. Mental health. Definition: recurrent unwanted thoughts and fears that lead to repetitive behavior. Causes: theories include changes in body chemistry, brain function, such as insufficient serotonin, and behavior-related habits that were learned over time. Assessment findings: obsessions, involuntary, unwanted, repeated thoughts or images. Compulsions: repetitive behaviors, often centers on themes such as cleanliness. Treatment: selective serotonin reuptake inhibitors, SSRIs, cognitive behavioral therapy. Nursing interventions: use calm, non-judgmental approach, provide safe environment for client to perform compulsive activity, but encourage client to decrease amount of time engaged in activity. Assist client in finding the meaning, reason for compulsive activity. Assist client in identifying fear and allow client to verbalize feelings. Administer medications as ordered. Definition: repeated attacks of intense fear or dread accompanied by physical symptoms that develop suddenly without warning and intensify within 10 minutes of onset. Causes: appears to have a genetic component and tends to occur during periods of life transitions. Assessment findings: palpitations, chest pain, diaphoresis, dizziness, chills, hot flashes, tachycardia, shortness of breath, tingling or numbness in hands and feet, nausea, fear of impending doom. Treatments: medication, individual and group therapy. Nursing interventions: utilize a non-judgmental approach. Assist client in meeting basic needs if needed. Provide calm, non-stimulating environment. Allow client to verbalize feelings. Distract client from symptoms of panic attack. Administer medications as ordered. Special consideration: underlying medical conditions such as mitral valve prolapse, hypoglycemia, hyperthyroidism, and use of stimulants need to be ruled out. 456. Anxiety disorders. Part 7th. Phobia. Post-traumatic stress disorder. 457. nclex flash review. Mental health. Definition: intense, irrational fear that results in avoidance of an object, activity, or situation. Causes: multi-factor, including genetics, biological component, and/or precipitating traumatic event. Assessment findings: symptoms occur when confronted with feared object, activity, situation, and include intense fear or dread, desire to get away, chest pain, palpitations, shortness of breath, tremors, feeling of impending doom, tingling or numbness in hands and feet. Nursing interventions: use calm, non-judgmental approach. Provide non-stimulating environment. Assist client in identifying fear. Allow client to verbalize feelings. Administer medications as ordered. Definition: severe anxiety after experiencing, seeing, or learning about a traumatic event. Cause: traumatic event. It is not known why some people exposed to a traumatic event develop post-traumatic stress disorder and others do not. Assessment findings: flashbacks, reliving experience, and/or nightmares relating to experience. Anxiety: attempts to avoid thinking, talking about event, emotional numbness, anger, irritability, sleep disturbances, hyperawareness, difficulty concentrating, difficulty maintaining close relationships. Treatment: SSRIs and anxiolytic medication, cognitive behavioral therapy. Nursing interventions: use calm, non-judgmental approach. Allow client to verbalize feelings, details of the event. Assist client in looking at event objectively. Administer anti-anxiety and antipsychotic medications as ordered. 458. Cognitive disorders. Part 7th. Alzheimer's disease. 459. nclex flash review. Mental health. Definition: physical changes in the brain leading to gradual loss of mental abilities, including executive functioning and memory impairment, progresses to disturbances in language, mood, personality, and motor functionality. Causes: combination of genetic, lifestyle, and environmental factors that lead to plaques, beta amyloid protein bundles that interrupt brain cells' ability to communicate, and tangles, twists of tau protein that inhibit transportation of key nutrients to brain cells, which lead to brain cell death and characteristic shrinkage of the brain. Assessment findings: mild confusion, inability to organize thoughts, repetition of questions, statements, forgetting family member names, misplacing items, becoming lost in familiar places, anger, irritability and depression, disturbances in swallowing, bowel bladder control, and muscle functioning. Nursing interventions approach client in a manner that allows client to retain dignity, keep communication clear and concise, allow client and caretaker to verbalize feelings, orient client to environment as needed, assist in management of activities of daily living as needed, administer medications as prescribed, consult social services as needed. Definition: disorders that involve loss of previous memories, inability to create new memories, and loss of ability to learn new information. Causes may be caused by a medical condition, exposure to environmental toxin, or substance abuse. Assessment findings: lack of orientation, confusion, inability to learn new information or create new memories, loss of memory of recent events. Nursing interventions provide safe environment, communicate with clear and concise statements, and allow for verbalization of feelings. Definition: reversible state of attention and cognitive deficits precipitated by a definable event cause. Causes: substance abuse, substance withdrawal, metabolic imbalances, infectious diseases, dementia. Assessment findings: apathy, withdrawal, agitation, abnormal behavior that worsens at night, disorganized thinking, sleep disturbances, incoherent speech. Nursing interventions ensure safe, non-stimulating environment, assess degree of cognition impairment, institute measures to help client relax, administer medications per order. Special consideration: treatment should begin with correction of underlying pathology. Cognitive disorders. Part 7th Vascular Dementia. 461. nclex Flash Review. Mental health. Definitions: irreversible damage to brain tissue that leads to impairment in cognition, memory, and personality. Causes: narrowed blood vessels in brain from conditions such as diabetes, high blood pressure, and/or stroke. Assessment findings: confusion, difficulty concentrating, memory loss, labile emotions, weakness, unsteady gait, wandering at night, decreased ability to organize thoughts. Nursing interventions provide calm, safe environment, allow client and caretaker to verbalize feelings, assist patient with lifestyle choices, including diet and exercise, assist client in managing underlying disease. 462. Delusional disorders. Delusional disorders, general. Delusional disorders, type E as of. 463. nclex Flash Review, mental health. Definition: disorders characterized by fixed, lifelike false beliefs not generally accepted by those in the client's culture. Causes: risk factors include low self-esteem, isolation, sensory deficits, severe stress, immigration, issues with trust and fear. Assessment findings: delusions, hallucinations consistent with delusions. Findings vary by type of delusional disorder. Nursing interventions establish trusting therapeutic relationship, set client goals, explore events triggering delusions, avoid arguing the reality of the delusion with client, administer medication as prescribed. Delusional disorders subtype: key characteristics: conjugal jealousy, belief that significant other is unfaithful. Erotomania believes the existence of spiritual, emotional love from a person with an elevated social status. Grandiose client believes he or she has an unrecognized talent or megalomania insight. Persecutory client believes there is a conspiracy against him or her. Somatic belief that body parts are disfigured, non-functioning. 464. Dissociative disorders. Dep Arzo null is at ION disorder. 465. nclex Flash Review. Mental health. Definition: loss of one's personal reality via repeated or persistent feelings that things are not real. Dreamlike state, feeling that one is observing oneself from outside the body. Cause might be linked to imbalance of neurotransmitters, may be triggered by life-threatening event, fatigue, meditation, hypnosis, anxiety, severe pain, may also have no apparent trigger. Assessment findings: feeling of detachment from body or mind, perceived self outside of body, feeling numb or robotic, impaired social functioning. Nursing interventions assist client to identify depersonalization as a coping mechanism, provide support, assist client in developing supportive relationships, teach effective self-management skills. Definition: blocking out of certain information leading to loss of recall of personal information, memories, and/or traumatic event. Causes may have a genetic link, usually triggered by a traumatic event. Assessment findings: sudden onset of inability to remember personal information, memories, and/or traumatic event. Nursing interventions: encourage verbalization of feelings of distress. Assist client in recognizing that memory loss is a defense mechanism. Provide support. Encourage development of supportive relationships and healthy coping mechanisms. Special consideration: memories still exist, but client has blocked their recall. Definition: client has at least two distinct identities that control his or her behavior. Different identities may have different physical characteristics, mannerisms, speech patterns, and/or gender identities. Causes: physical or sexual abuse. Traumatic event occurring when the client was younger than age 15. Assessment findings: presence of two or more distinct personalities. Inability to remember events from a preceding time period, finding oneself somewhere and not knowing how one got there. People consistently knowing client that the client does not remember meeting. Purchases that client does not remember buying. Guilt, shame, low self-esteem, hallucinations, depression, self-mutilation, suicidal thoughts, substance abuse. Nursing interventions: establish trusting therapeutic relationship, assess risk for self-harm and/or suicide, and implement precautions as needed. Encourage verbalization of feelings and of painful past experiences. Explore coping mechanisms. Focus on client's strengths. Assist client in recognizing each personality and working toward integration. Assist in identification of emotional responses to stress and development of healthy responses. 466. Eating disorders. Anorexia nervosa. 467. nclex flash review. Mental health. Definition: deliberate starvation or purging of self and a refusal, inability to maintain normal body weight. Causes: multifactor. Risks include adolescence, low self-esteem, model child syndrome, sexual abuse, genetics, distorted body image. Assessment findings: body weight less than 85% of normal weight for age, height, intense fear of gaining weight, preoccupation with thoughts of food, amenorrhea, depression, withdrawal from activities, insomnia, dry, flaky skin, constipation, decreased pulse and blood pressure, arrhythmias, lack of concern about symptoms. Nursing interventions: establish trusting relationship, contract for amount of food to be eaten and/or weight to be gained, provide one-on-one support, encourage verbalization of feelings and perceptions of appearance, assist in identification, development of healthy coping mechanisms. Special considerations: third most common chronic illness in adolescence. Highest incidence involves high-achieving teenage girls. If left untreated, can be fatal. Prevalence increasing in adult women. Definition: purging type. Episodic periods of rapid consumption of large amounts of food in less than 2 hours, followed by purging through induced vomiting and laxative abuse. Non-purging type. Episodic periods of fasting and excessive exercise. Causes: common traits include viewing self as unlovable, inadequate, and/or unworthy, strong desire to please others, strong desire to be perfect, thin, loved, and/or accepted. Assessment findings: binge eating, self-induced vomiting, abuse of laxatives, low self-esteem, mood disturbances, self-perception determined by body shape and weight, eroded tooth enamel, irregular absent menses, arrhythmias. Russell's sign: bruised or calloused knuckles from inducing vomiting. Nursing interventions: establish trusting relationship, contract for amount of food to be eaten, prevent client from using bathroom within 2 hours of eating to prevent purging, provide one-on-one support, encourage verbalization of feelings and perceptions of appearance, assist in identification, development of healthy coping mechanisms. 468. Mood disorders, bipolar disorder. 469. nclex flash review, mental health. Definition: disruptive condition where client experiences periods of depression followed by periods of euphoria. Causes: increased risk associated with immediate family member with bipolar disorder, drug and alcohol abuse, periods of high stress. Assessment findings: manic phase, euphoria, decreased sleep, racing thoughts, impulsive actions, agitation, risky behavior, rapid speech. increased energy, lack of inhibition, spending sprees, increased sex drive. Depressive phase, feelings of helplessness, hopelessness, suicidal thoughts, decreased alertness, sleep disturbances, poor hygiene, difficulty in thinking clearly, lack of interest in sex, apathy, increased absences from work or school. Nursing interventions approach clients with acceptance, honesty, empathy, patience, and consistency, provide for physical needs such as rest, activity, nutrition as needed, assess suicide risk, and implement suicide precautions if needed. Definition: persistent feelings of sadness that interfere with the ability to eat, sleep, and enjoy activities that were once enjoyed. Causes: associated with biological, genetic factors, hormones, life events, and early childhood trauma. Assessment findings: mild, feelings of sadness that interfere with ability to engage in normal activities. Moderate, feelings of helplessness, low energy levels, sleep disturbances, changes in appetite, weight, decreased concentration. Severe, feelings of hopelessness, helplessness, and worthlessness, flat affect, changes in appetite, weight, sleep disturbances, constipation, loss of interest in sex, fatigue, inability to concentrate. Nursing interventions: offer support by being with client, assess for level of depression, assess sleep, elimination, nutrition, and risk for suicide, implement suicide precautions if needed, use non-demanding approach to client interactions, allow client to verbalize feelings, initiate, implement safety contract with client, administer medications per order. Special considerations: depressed clients are at increased risk for suicide. Suspect thoughts of suicide if depressed client suddenly has improved mood or relation. 470. Mood disorders. Part 7, suicide. 471. nclex RN flash review. Mental health. Definition: taking of one's own life. Causes: risk increased by depression, previous suicide attempt, alcohol abuse, psychosis, drug abuse, individuals with lack of social support and/or a chronic illness. Assessment findings: the majority of potential victims give a clue before taking their lives, including talking about death, wanting to be dead, giving away cherished possessions, verbalizing feelings of helplessness and hopelessness, or saying that they want to harm themselves. Nursing interventions: assess risk by asking clients if they have ever thought of harming themselves, taking their lives. If yes, ask if they have a plan for how they will take their lives. If client deemed at risk, implement suicide precautions, which may vary by organization but generally consist of someone staying with client at all times and removal of objects with which client could harm themselves. Special consideration: the more concrete the plan and the more available the tools for carrying out the plan, the more likely the client will attempt suicide. 472. Personality disorders. Part B. Anti-TLP-personality disorder. nclex flash review. Mental health. Definition: disorder in which client has total disregard for others' rights and has a track record of manipulating, exploiting, or violating others. Causes: believed to be linked to genetic factors and/or history of abuse as a child. Assessment findings: destructive tendencies towards self and others, lack of remorse, manipulative behavior, ability to act witty and charming when desiring to do so, substance abuse, impulsiveness, history of breaking the law, inability to maintain personal relationships. Nursing interventions: assess risk for self-harm, harm to others, provide safe environment, establish environment where client, but not maladaptive behavior, is accepted, encourage client to verbalize feelings, assist client identification of choices, actions that have caused difficulties, assist client in exploration of alternate coping mechanisms. Definition: impulsive, unpredictable behavior that leads to unstable mood swings, interpersonal relationships, self-identity, and cognition. Causes: unknown but seem to be a combination of environmental and neurobiological factors. Assessment findings: impulsive behavior relating to gambling, shopping, sex, and substance abuse, intense emotions, inability to maintain relationships, moodiness, low self-esteem, dysfunctional lifestyle, destructive behavior, frantic effort to avoid abandonment. Nursing interventions: assess risk for self-harm, harm to others, provide safe environment, establish environment where client, but not maladaptive behavior, is accepted, encourage client to verbalize feelings, avoid reinforcement of manipulative behaviors, Assist client in exploration of alternate coping mechanisms. Definition: chronic disorder in which client relies too much on others to meet emotional and physical needs. Causes: not known. Assessment findings: difficulty making everyday decisions, clingy, demanding behavior, difficulty expressing disagreement, going to excessive lengths to obtain nurturing from others, fear of losing people on whom the client depends. Nursing interventions: establish trusting relationship, allow client to verbalize fears, assist client to make increasingly larger decisions and assume responsibility for self. Help client identify manipulative behaviors, assist client in finding alternate coping mechanisms. 474. Part PA. Paranoid personality disorder. 475. nclex flash review. Mental health. Definition: disorder that involves having an unwarranted and unrelenting mistrust and suspicion of others. Causes: not known. Assessment findings: suspiciousness and mistrust of others, emotional distance, feelings of being deceived, disturbed sense of reality, low self-esteem, isolation, viewed as hostile, stubborn, and argumentative, reacts poorly to criticism. Nursing interventions: establish therapeutic relationship, help client to identify negative behaviors that interfere with relationships, encourage socialization, assist in identification of positive behaviors and social skills. 476. Schizophrenia disorders. Schizophrenia disorders overview. General principles. 477. nclex flash review. Mental health. Definition: a group of disorders involving loss of reality and marked disturbances in thought, perception, and/or behavior. Causes: unknown combination of genetic, environmental, and biological factors. Assessment findings: positive distortion of normal functions, delusions of persecution or grandeur, agitation, aggressive behavior, bizarre dress or behavior, hallucinations. Negative decrease in normal functions, lack of energy, withdrawal, difficulty thinking abstractly, lack of spontaneity, flat affect, lack of self-initiated behaviors. Disorganized, cognitive deficits, disorganized, incoherent speech, repetitive, rhythmic gestures. Nursing interventions: establish trusting relationship, provide safe environment, offer clear, consistent, concise communications, assist client in meeting basic physical needs, administer medication as ordered. For clients with hallucinations, do not challenge clients with reason or reality orientation. Auditory hallucinations: do not encourage clients to verbalize what the voices are telling them to do. 478. Sexual disorders. Part 7th. Gender dysphoria, paraphilias. 479. nclex flash review. Mental health. Definition: disorder in which there is strong self-identification or desire to be a member of the opposite sex. Strong discomfort with assigned gender. Causes: theories include genetic abnormality, hormone imbalance during fetal and childhood development, bonding deficits experienced in childhood. Assessment findings: expressed desire to be, live as member of opposite sex, disgust with genitals, self-loathing, hatred, dressing as member of opposite sex, preoccupation with appearance, suicidal ideation, isolation, depression, and anxiety. Treatments: hormonal therapy, sex reassignment surgery, group and individual therapy. Nursing interventions: establish therapeutic relationship through caring, non-judgmental approach, allow patient to verbalize feelings and fears, provide support, assist in client identification of strengths and positive aspects of self, assess risk for suicide, and implement precautions as appropriate. Definition: sexual disorder, where unusual sexual imagery or acts are utilized to achieve sexual excitement, involves non-human subjects, suffering, humiliation of oneself or partner, children, and/or non-consenting adults. Causes: not known. Assessment findings: utilization of non-human subject, child, non-consenting adult, and/or suffering, humiliation to achieve sexual excitement, guilt and shame, disturbances in body image, sexual dysfunction, lifestyle changes to make object method of excitement more accessible, emotional immaturity, need to prove masculinity, exhibitionists, poor self-concept, fear of sexual relationship that could cause rejection. Treatment, behavior, cognitive, and individual therapy. Nursing interventions utilize non-judgmental approach, encourage client to identify feelings associated with sexual behavior, imagery. Definition: a sexual disorder presenting as a disturbance in one or more phases of the sexual response system, and/or the presence of pain during intercourse not related to a physical cause. Causes. Contributing factors include drugs, alcohol use, endocrine disorders, trauma, surgery, infections, medications, and pregnancy. Assessment findings varies by type of sexual dysfunction but includes decreased sexual desire, inability to become aroused, inability to maintain erections in men, painful intercourse, poor self-concept, social isolation, anxiety, and fear of rejection. Treatment varies with type of sexual dysfunction, but includes medication adjustments, surgical implants, treatment of underlying medical conditions, vaginal dilators, and couples therapy. Nursing interventions provide safe, non-judgmental relationship, encourage verbalization of feelings, discuss, teach, alternate way of achieving sexual intimacy. 480. Sexual disorders. Part 7th. Sexual dysfunction. Types of. 481. nclex Flash Review. Mental health. Sexual dysfunction disorder definition: sexual desire hypoactive, lack of sexual desire, causing distress to disorder's client or client's partner. Aversion: when confronted with sexual opportunity, client experiences fear, disgust, anxiety. Sexual arousal females: little or no feelings of arousal. Disorders male: inability to obtain or maintain adequate erection, male erectile disorder, also known as erectile dysfunction. Orgasmic disorders: recurrent episodes of inhibited orgasm after adequate period of arousal excitement. Category includes premature, inhibited, retarded ejaculation. Sexual pain disorders: dyspareunia, recurrent genital pain during after intercourse, vaginismus, vaginal spasms that interfere with sexual intercourse. And 482. Somatoform disorders. Somatoform disorders, overview, general principles. 483. nclex Flash Review. Mental health. Definition: a group of disorders that manifest as involuntary physiological symptoms that have no organic basis. Clients experience loss of function that significantly disrupts daily life and causes emotional distress. Causes: believed to have both biological and genetic factors. Assessment findings: involuntary physical symptoms without organic basis, impairment in occupational, social, or other daily functioning. Increased preoccupation with health, including demand for unnecessary tests, failure to comply with treatment plans, traveling from healthcare provider to healthcare provider, excessive use of analgesics. Nursing interventions: establish a trusting, non-judgmental therapeutic relationship, encourage verbalization of feelings, assist client in moving focus from symptoms, assist client in identification of psychosocial needs being met by feeling unwell, assist in the development of alternate coping mechanisms. Special considerations: although no organic reason exists for the client's physical symptoms, the symptoms are real to the client and cause significant distress and therefore should not be simply dismissed. Definition: a type of somatoform disorder in which there is a pervasive feeling of ugliness due to imagined or greatly exaggerated physical defect, negatively impacts clients' social, occupational, or life functioning, also referred to as imagined ugliness. Definition: a type of somatoform disorder with motor, sensory symptoms that are suggestive of a neurological condition, as anxiety is unconsciously converted into functional deficits. Terms: label indifference. Client shows lack of appropriate concern for symptoms and does not manifest symptoms of anxiety. The symptoms of anxiety are transformed into symptoms that mimic physical ailments. Pseudoneurological manifestation. Symptoms are present and resolve based on presence of life stress trigger. Somatoform disorders. Hypochondria. 485. nclex Flash Review. Mental health. Definition: a type of somatoform disorder in which physical complaints are exaggerated to the point that client experiences impairment in social or occupational functioning. Clients with this type of somatoform disorder typically travel from one healthcare provider to the next, as they feel that they are not receiving appropriate medical attention. Definition: a type of somatoform disorder in which clients experience pain that has no physical basis, or that exceeds the level generally expected for the level, type of injury, significant impairment of social and/or occupational functioning occurs. Two subcategories exist, associated with psychological factors. The onset, severity, exacerbation, and/or maintenance of pain are significantly impacted by psychological factors. General medical conditions have no role or a minimal role in the onset. Associated with both psychological factors and general medical condition, pain is due to general medical condition that is focus of presentation of symptoms and that is significant enough to warrant clinical attention. However, psychological factors impact the onset, severity, exacerbation, and/or maintenance of the pain. Definition: a type of somatoform disorder in which client complains of multiple symptoms involving multiple organs. It stems from a severe anxiety where emotions and/or conflicts are expressed through significant multiple system symptoms. 486. Substance abuse, alcohol dependency, ABSE. 487. Definition: primary, chronic disease in which individual experiences impaired ability to control alcohol consumption and/or is preoccupied with alcohol despite disruption in physical, emotional, and/or social functioning. Causes: combination of genetic, familial, and environmental factors. Assessment findings: dependency, tolerance, withdrawal symptoms when alcohol is discontinued, spending significant amount of time obtaining, drinking, or recovering from the effects of alcohol. Abuse, recurrent episodes of drinking in situations where it is hazardous or where it results in the failure to fulfill obligations and/or causes alcohol-related legal problems. Nursing interventions encourage verbalization of feelings, assist client in recognition of misuse of alcohol, provide psychotherapy, refer client to Alcoholics Anonymous, encourage adherence to prescribed medication regime, including vitamin supplements, nutritional guidance. Definition: a type of amnesia caused by a deficiency of B-complex vitamins, including thiamine and B12, caused by poor nutritional habits associated with alcoholism. Symptoms include disorientation, loss of short-term memory, confabulation, and inability to learn new skills. Definition: degenerative condition of the brain caused by thiamine deficiency from poor nutritional intake associated with alcoholism. Symptoms include double vision, lack of coordination, decreased cognition, and involuntary rapid eye movements. 488. Substance abuse, alcohol withdrawal. 489. nclex flash review, mental health, symptoms, early withdrawal, delirium, onset hours 48 to 72 hours, duration 24 to 48 hours, 2 to 3 days, signs, symptoms, headache, anxiety, irritability, hyperalertness, sleep disturbances, shaky feeling, hand tremors, elevated heart rate, seizures 7 to 48 hours, agitation, anxiety, diaphoresis, disorientation, hallucinations, delusions, elevated heart rate and blood pressure, panic, vomiting, diarrhea, paranoia, coma. Nursing interventions: monitor vital signs, provide non-stimulating atmosphere, reorient, implement seizure precautions, stay with patient who is hallucinating. Administer medications, including benzodiazepines, anticonvulsants, and thiamine as ordered. Definition: a screening tool for alcoholism that consists of 4 questions. C. Have you ever felt that you should cut down on your drinking? A. Have people annoyed you by criticizing your drinking? G. Have you ever felt bad or guilty about your drinking? E. Have you ever had an alcoholic drink first thing in the morning eye-opener because of a hangover or just to get the day started? 2 positive responses to these questions indicate that further screening diagnostics should be completed. Definition: regular use of substances that impact central nervous system functioning, resulting in behavior deviations and physiological and psychological dependence. Causes: combination of psychological, environmental, biological, and genetic factors. Assessment findings vary according to substance under consideration. Nursing interventions monitor vital signs, level of consciousness, electrolytes, overdose, withdrawal, provide adequate rest, nutrition, and hydration. Administer medications per protocol or order. Confront client's denial of problem and placement of blame on others. Identify stressors. Assist in the development of alternative coping mechanisms. 490. Substance abuse, substance cocaine, substance hallucinogenic, 491. nclex flash review. Mental health. Overdose withdrawal symptoms, special considerations, dilation of pupils, elevated blood pressure, tachycardia, cardiac arrhythmias, cardiac arrest, nausea, vomiting, diarrhea. Apathy, irritability, confusion, prolonged periods of sleep, depression. Effect is short-lived, leading to increased use. Tolerance can develop within days. Examples: short-term effects, long-term effects, overdose withdrawal symptoms, special considerations. LSD, PCP, DMT, mescaline, psilocybin mushroom. Increased sensory awareness and visual imagery, nausea, disrupted coordination, anxiety. May intensify or precipitate psychosis, panic, psychosis, flashbacks, impaired judgment. No withdrawal symptoms. Protect from self-injury, reduce sensory stimuli. Examples: short-term effects, long-term effects, overdose, withdrawal symptoms, special consideration, narcotics, codeine, morphine, meperidine, opiums, heroin, methadone, opium, sedation, euphoria, decreased pain, impaired cognition and coordination, decreased appetite, weight loss, impotency, respiratory and circulatory arrest, unconsciousness, coma, death. Watery eyes and nose, dilated pupils, diaphoresis, decreased appetite, abdominal cramps, nausea, vomiting, hallucinations, delusions, increased pulse and respirations. Naloxone Narcan may reverse respiratory depression from overdose of narcotics. Substance abuse, substance sedatives, substance abuse. Important terminology. 493. nclex flash review. Mental health. Examples: short-term effects, long-term effects, overdose withdrawal symptoms, special considerations, barbiturates, benzodiazepines. Relaxation, drowsiness, sleep induction, decreased anxiety, decreased mental alertness, weight loss, irritability, drowsiness, lethargy, confusion, coma, death. Agitation, increased anxiety, sleep disturbances, seizures, depression, abdominal cramps, tremors. Treat overdose with activated charcoal, gastric lavage, or flumazenil for benzodiazepine overdose. Examples: overdose withdrawal symptoms, special considerations, benzedrine, dexedrine, methadrine, methylphenidate, Ritalin. Increased respirations, restlessness, tremors, confusion, aggressiveness, hallucinations, panic. Depression, fatigue, hypersomnia, restlessness. May develop paranoid delusions. Term: substance use dependence, habituation, tolerance, withdrawal. Definition: ingestion of prescription drug, over-the-counter medication, alcohol, nicotine, or illicit drug. Intermittent or continuous, cravings for a substance, leading to repeated use, misuse of the substance. Refers to the client's ability to obtain desired effect from a substance. Client requires increasing amount of substance to obtain desired effect. Clinical symptoms produced from a cessation in the use of a substance. Therapeutic communication, therapeutic communication, phases of therapeutic communication techniques. 495. nclex flash review. Mental health. Initiating, orienting, working phase, termination phase. Nurse sets stage by ensuring privacy and begins to build trust and rapport. Assessment of needs and communication preferences is conducted. Therapeutic contracts are established. Discussion conducted on mutually set goals. Identification of coping mechanisms, perceptions, and supports occurs. Alternative behaviors are explored. Identification of progress and need for further referrals is conducted. When goals have been met, the nurse ends the relationship. It is not unusual for clients to exhibit anxiety or regression during this phase and may attempt to prolong the relationship. Planning for the termination of the relationship should begin during the initiation stage. Acknowledgement, clarification, focusing, giving information, offering of self-open-ended questions, statements, recognition of client's effort, behavior, and/or communication. Example: I noticed that you initiated the conversation today. Used to ensure understanding of client's statements. Example: I am not sure of what you are saying. Helping client to concentrate on or expand on a given topic. Example: it appears that you are worried about losing your job. Presenting factual information. Example: you may feel drowsy with this medication. Being present with client. Example, I will stay with you during the procedure. Questions, statements that encourage client to provide more than a yes-no answer. Example, tell me about the argument. 496. Therapeutic Communication. Part 7th. Therapeutic Communication Techniques. Second 497. nclex Flash Review. Mental Health. Paraphrasing presentation of reality. Reflecting silence touch, repeating back to client his or her underlying thoughts or feelings. Example, you felt sad when your daughter stated she was moving, assisting the client in differentiating the real from the unreal. Example, I do not see that. Directing client's thoughts or feelings back to them for further exploration. Example, you seem unsure about telling your daughter. Being quiet with client without interrupting any pauses or breaks in the conversation, thereby allowing client time to collect thoughts, feelings. Touching client in an appropriate, culturally sensitive manner to convey caring attitude. 498. Therapies, Part 7th, Behavioral Therapy, Cognitive Therapy, Crisis Intervention. 499. nclex Flash Review. Mental Health. Definition, treatment modality that utilizes learning principles to effect changes in behavior by focusing on the consequences of actions. Undesirable actions are viewed as learned behaviors that can be modified. Definition, short-term treatment modality that focuses on replacing clients' negative or irrational beliefs and/or distorted attitude delivered in group or individual setting. Clients' cognitive abilities must not be impaired for modality to be effective. Utilizes problem solving to identify and overcome issues. Definition, treatment modality focused on resolution of crisis situation that the client is unable to handle alone. Utilizes identification of immediate coping patterns with a goal of returning client to pre-crisis level of functioning, generally 6 weeks in duration or less. 500. Therapies, Part TA, Family Therapy, 501, nclex Flash Review, Mental Health. Definition, a modality that utilizes the client's family versus the individual client as the focus for therapy, utilizes family system theory to assess the functioning of the family and the client within the family to identify members, roles, life scripts, self-fulfilling prophecies, and incongruent communications. Goal is to decrease conflict and promote appropriate family functionality and interrelationships. Definition, treatment modality that involves 2 or more clients and 1 or more healthcare professionals interacting to resolve emotional or self-esteem issues and improve behavior and social functioning. Members test reality by giving and receiving feedback. Definition, treatment is provided through the planned use of the treatment environment, including people, resources, and activities. It includes everyone who comes into contact with the client. Focuses on activities, limit setting, and client decision-making, and allows for the testing of situations in a realistic way through the provision of a microcosm of the outside environment. Medications, Part 7th, Acetylcholinesterone Inhibitors. 503. nclex Flash Review, Mental Health. Example medications use adverse reactions, nursing implications. Dunpezil, Aricept, galantamine, Reminol, Tecrine, Cognex. Treatment of Alzheimer's disease, nausea, diarrhea, elevated liver enzymes. Contraindicated with anticholinergic medications. Medications should not be abruptly discontinued. Example medications, trihexyphenidyl, Artane, benztropine, Cogentin, procyclidine, Camadrin, piperidine, Akhenaton. Use treatment of extrapyramidal symptoms from antipsychotic medications. Adverse reactions, vertigo, urinary hesitation, GI distress, disruption in cognition. Example medications use adverse reactions, nursing implications. Chlorpromazine, Thorazine, trifluoperazine, Stelazine, perfenazine, Trilofan, flufenazine, Perlixin, haloperidol, Haldol, clozapine, Clozaril, loxapine, Loxetane. Relief of psychotic symptoms, behavioral control. Extrapyramidal symptoms, drug-induced Parkinson, shuffling gait, tremors, pill-rolling movement, dyskinesia, flat affect. Akathisia, uncontrolled restlessness, toe tapping, pacing. Dystonia, spasms of neck and limbs, disruption of coordination. Tardive dyskinesia, permanent gait shuffling, drooling, dystonia. Hypotension, increased liver enzymes, dry mouth, blurred vision, tachycardia, constipation. Monitor for neuroleptic malignant syndrome, rigidity, irregular erratic pulse, blood pressure, respirations, change in mental status. elevated creatinine, if present. Stop medication and administer dopamine as ordered. Medications: anti-alcohol abuse, barbiturates, sedatives. Mental health: nclex flash review, mental health. Example medication use: adverse reactions, nursing implications, disulfiram, and abuse. Assists client to stop drinking alcohol by causing the client to experience negative symptoms if alcohol is consumed while on the medication. Occur if alcohol is consumed while taking medication, and include nausea, vomiting, throbbing headache, vertigo, blurred vision, thirst, confusion, diaphoresis. Ensure client understands the adverse effect of alcohol consumption while on the medication does not prevent withdrawal symptoms. Example medications use: adverse reactions, nursing implications, bupropion, Wellbutrin, mirtazapine, Remeron, nifazodone, trazodone. Treatment of depression: vary according to medication. Bupropion, anxiety, restlessness, sleep disturbances, dry mouth, agitation, headache, sore throat, tremors. Mirtazapine, increased appetite, increased cholesterol, changes in blood pressure, decreased white blood cells, weight gain. Nifazodone, blurred vision, vertigo, dry mouth, headache, nausea, weakness, sleeplessness, decreased blood pressure. Trazodone, nausea, diarrhea, constipation, confusion, arrhythmia, confusion, headache, dry mouth. Monitor for signs and symptoms of suicide, especially as clients' energy and mood increase. Example medications use: adverse reactions, nursing implications, barbiturates, amytal sodium, butazole sodium, nembutol sodium, seconal sodium, luminol sodium. Sedatives: chloral hydrate, aquachloral suprettes, azopiclone lunesta, meprobamate miltown, ramelteon roxaram, zaleplon sonata, zolpidem ambien. Treatment of anxiety, sleep disorders, drowsiness, confusion, lethargy, hangover effect, megaloblastic anemia, thrombocytopenic purpura, agranulocytosis. Client to avoid alcohol, avoid driving or operating heavy machinery. Patient should take medication 30 minutes prior to bedtime. If using for insomnia, client should not stop medication abruptly. 506. Medications: benzodiazepines, monoamine oxidase inhibitors, MAOIs. 507. nclex flash review, mental health. Example medications: alprazolam, Xanax, chlordiazepoxide, Librium, clonazepam, Klonopin, chlorazepate, Tranxene, diazepam, Valium, lorazepam, Ativan, midazolam, Versed, oxazepam, Serax, temazepam, Restoral, triazolam, Halcyon. Use: treatment of anxiety. Adverse reactions: daytime drowsiness, vertigo, headaches, blurred vision, hypotension, incontinence, amnesia, slurred speech, lethargy. Toxicity: somnolence, confusion, decreased reflexes, coma. Nursing implications: elderly clients are at risk of falling. Clients should avoid use of alcohol. Cessation of medication can cause withdrawal symptoms. Toxicity can be reversed with IV administration of flumezine or romazicon. Example medications: isocarboxazid, Marplan, phenelzine Ardil, tranicipromine parnate. Use: treatment of depression. Adverse reactions: orthostatic hypotension, insomnia, lethargy, dry mouth, increased weight, edema, anxiety, agitation, mania, headaches, constipation, impotence. Nursing implications: drug interaction with sympathomimetic medications and or foods containing tyramine. May cause hypertensive crisis, hypertension, radiating headache, nausea and vomiting, change in mental status, chest pain, chills, stiff neck. Treatment of choice for hypertensive crisis is IV phentolamine, Regitine. Tyramine-containing foods include avocados, bananas, liver, caffeine, aged cheese, figs, meat tenderizers, overripe fruits, papayas, raisins, red wine, beer, sherry, salami, sausage, pepperoni, bologna, sour cream, soy sauce, yogurt. 508. Medications: mood destabilizers, antimanic, selective serotonin reuptake inhibitors, SSRIs, Reuptiter 9. Mental health. Example medication use: adverse reactions. Nursing implications: lithium, control of mood disorders. Polyuria, polydipsia, anorexia, dry mouth, increased weight, bloating, fatigue, headache, hair loss, diarrhea, metallic taste. Toxicity: blood level exceeds 1.5 to 2 meters EQL. Symptoms include nausea, vomiting, tremors, slurred speech, twitching, oliguria. Therapeutic range 0.6 to 1.2 meters EQL. Monitor sodium intake. Client should consume normal dietary intake. Sodium deficiency increases risk for toxicity. Toxicity is managed via administration of mannitol, gastric lavage, and management of fluid and electrolytes. Example medications: citalopram Celexa, escitalopram Lexapro, fluoxetine Prozac, fluoxamine, Luvox, paroxetine Paxil-Paxeva, sertraline Zoloft. Use treatment of depression. Adverse reactions: nausea, drowsiness, anxiety, sleep disturbances, headache, vertigo, seizures, changes in weight, apathy, tremors, diaphoresis, dry mouth. Nursing implications: monitor BP, assess for suicide, avoid use with monoamine oxidase inhibitors. Prozac in combination with other SSRIs can be fatal. When changing medications, need 5-week space between Prozac and other SSRI due to long half-life of Prozac. Avoid abrupt discontinuation of medication. There may be increased bleeding with use of NSAIDs. Client education includes avoidance of over-the-counter cold medicines and taking care to change positions slowly. NCLE, XRN Flash Review, 510 Medications, Part 7th Tricyclic Antidepressants, 511. NKey XRN Flash Review, Mental Health. Example medications use adverse reactions, nursing implications, special considerations. Amitriptyline, Elavil, nortriptyline, Aventil, Pameler, dazipramine, Norpramin, doxepin, Sinequan, trimipramine, Sermentil, imipramine, Tofranil, protriptyline, Vivactyl. Treatment of depression: dry mouth, blurred vision, postural hypotension, constipation, arrhythmias, sedation, weight gain, irritability, anxiety, photosensitivity. Overdose, arrhythmias, agitation, flushing, pupil dilation, seizures, hallucinations, coma. Assess for suicide risk. Client education includes taking medication as prescribed, checking with healthcare provider prior to taking over-the-counter, cold medications to avoid drug interaction, and avoiding use of alcohol. If client's medication is changed to a monoamine oxidase inhibitor, 1 to 3 weeks should elapse between medications to avoid hypertensive crisis. 512.